Good colleagues, thank you for joining. We'll start as colleagues run from their different sessions. This is the first DG strategic roundtables for the 79th World Health Assembly in this lovely renovated EB room. For those coming here for the first time or those that have been coming for longer, whether you're from WHO or your member state, it's really great to be back in this room. So the title for our roundtable today is From COVID Lessons to Action, the Evolution of the WHO Health Emergencies Program. It's 10 years since the program was established, almost to the assembly. Bookmarked by the challenging Ebola response at the time, but many other health emergencies that we have gone through since, especially the pandemic from a few years ago. And through this, of course, we have learned many lessons. The world has learned many lessons. Nothing has stood still. And so this objective of this session today is really to reflect on the lessons primarily out of COVID, but also broadly out of all the health emergencies that we have learned, we have gone through, and try and shape how we will evolve into the future collectively. So on that note, I'll invite our Director General to say a few opening remarks for this session.
Thank you. Minister Somze, Minister Mekdes, Excellencies, Honorable Ministers, dear colleagues and friends. Good afternoon and welcome. Welcome to our distinguished panelists and all member states joining us today. As I discussed in my address to member states this morning, WHO is currently responding to two outbreaks that have captured headlines around the world. On Sunday, I declared a public health emergency of international concern over the outbreak of Ebola in the DRC and Uganda. At the same time, we're continuing to respond to the outbreak of hantavirus among passengers and crew on the cruise ship, the MV Hondius. In particular, the current Ebola outbreak is a reminder of the West African Ebola epidemic from 2013 to 2016 that shocked the world and which led to the creation of the WHO Health Emergencies Program 10 years ago. In the past decade, the Health Emergencies Program has established itself as an essential part of WHO's work. It has supported the response to numerous outbreaks, conflicts, and humanitarian disasters. And it has supported countries to build and reinforce their defenses against emergencies of all kinds. And to strengthen international cooperation, the COVID-19 pandemic was in many ways the ultimate stress test for the program. COVID-19 was not simply a public health crisis. It was one of the defining experiences of our lives. Every country, every community, and every family experienced the pandemic differently. Some lost loved ones, some lost colleagues, many lost years of economic and social progress, and all of us, in one way or another, were tested. The pandemic tested our systems, our partnerships, our science, our operational capacities, and our ability to act under enormous uncertainty and political pressure. Under Dr. Mike Ryan's leadership, my good friend, WHO helped steer WHO and the world through an extraordinary storm. The program was under unprecedented pressure while coordinating one of the most complex global emergency responses in modern history. What is important is that COVID-19 did not only expose vulnerabilities, it also accelerated innovation, reform, and cooperation. In response to the lessons the pandemic taught us, WHO and member states took many measures to strengthen global health security, which I described in my opening remarks to the Assembly yesterday. measures to strengthen surveillance and epidemic intelligence, to advance more equitable access to medical countermeasures, to strengthen national preparedness and emergency workforce capacities, to establish new financing mechanisms, and of course to deliver the historic pandemic agreement adopted last year. The pandemic agreement and the amendments of the international health regulations were born directly from lessons learned during COVID-19. They reflect a collective recognition that preparedness cannot begin when a crisis starts. The PABS Annex is the final piece of the puzzle. Of course, we all hoped we would be celebrating its adoption this week. That celebration is not cancelled. It's merely postponed. The commitment of member states to continuing negotiations is a clear signal that far from giving up, they're forging ahead. I have every confidence that they will succeed, that you will succeed, and we will succeed. Today, under the leadership of Dr. Chikwe Ehekwazu, the program continues to prevent and prepare for emergencies of all kinds and to respond decisively when they arrive. At any one time, we're responding to multiple overlapping and intersecting crises in the face of geopolitical fragmentation, growing challenges to multilateralism, financial pressures, and misinformation. I'm very grateful to all our panelists today for joining us to reflect not only on what we learned from COVID-19, but on how we translate those lessons into stronger protection for future generations. Because ultimately, the question before us is simple. Will the world be better prepared for the next crisis than it was for the last one? We need to ensure that the answer is yes. This is our collective responsibility because, as I said in the morning, we're in the same ship. Thank you very much.
Thank you, DG, for your kind words as always, inspiring all of us. So let me start by saying there's a phrase I use sometimes, but I'll use it today because it couldn't be more apt today, that you stand on the shoulders of giants. And really, the work that Mike has done from the beginning of this program, or even before the program started, in defining our work here, and having had the privilege of working with him together with Sosefal, who I just see has joined us for a few years, has been still defining for me and for many colleagues I see around the room. So Mike, it's a real honor to welcome you back to your home, to WHO, and pass the mic to you to share a few introductory remarks with us. Thank you.
Thank you, Chikwe. Thank you, Chief Tedros. It is nice to be home. Strange to be home. Nice to be back in the EB room again. And it's quite interesting because almost exactly to the week, 26 years ago, we sat in this room, 121 of us from 67 institutions, trying to work out how we were going to respond to outbreaks in future. And this was really in the aftermath of the plague outbreaks in India and the Kikwit outbreaks and the various outbreaks that have been occurring, meningitis outbreaks, Daniela, we discussed it yesterday, cholera, global pandemic of cholera raging through Africa, and there was a real concern that we weren't coherent and we were all working together, and often bypassing national authorities, often not behaving properly in the field, not offering the assistance we needed to offer, and we created the Global Outbreak Alert and Response Network in this room 26 years ago in frustration. And I think we started with $10,000. Imagine, he wouldn't get a reception at the World Health Assembly for $10,000 today. It was a different era. It was a different thing. And I speak of history because nothing is ever new and no problem is ever new. George Patton, the great general, once said that you prepare for the unknown, by studying how others in the past have coped with the unforeseeable and unpredictable. I use a more youthful quote from Assassin's Creed, those of you who follow the trilogy, where it says, of history is a great wheel turning inexorably, just as the seasons come and go, just as the moon moves endlessly through a cycle, so does time. The same wars are fought, the same plagues descend, the same folk, good or evil, rise to power. Humanity is trapped on that wheel, doomed endlessly to repeat the mistakes we have already made, unless someone comes to change it. And I think this group here and the member states of the World Health Organization have the position and power to change the future. We can't change the past. We can learn from it. And I think this is really what this meeting is all about, a recommitment to the future of health security, of epidemic and public health emergency response. And no better person than Chikwe to lead that, but all of the wonderful people in the programme, all of the wonderful partners that I've worked with over the years, and all of the wonderful projects and so many of the things that are in the concept note around what needs to be built in the future. We already have the DNA of those in the system. We were doing epidemic intelligence from open sources in 1997, if people cast their mind back, and using Monte Carlo processing and using all kinds of interesting technologies to pick out outbreaks on the internet at the time. The internet was a very small place, and we did it in 6 languages with the government of Canada, and created the outbreak verification list, which became famous, circulating around the world as a Word document. And the reason why everyone received it as a Word document was that I specially negotiated with administration to get a free copy of Word. We had 1 copy of Word for the whole program, and it was used for the outbreak verification list. And we kept its format into the new era so people wouldn't get sidelined by a new format, and it kept the Times New Roman font, so we kept maintain continuity. So, but we've evolved into the epidemic intelligence from open sources and the work we're doing now with the AI. We've evolved networking with the emergency medical teams, standby partners, GORN, and now the Global Health Emergency Corps. Each of these things has evolved, and really we think we learn proactively, but what I've learned is we react to stimuli. And the stimuli, unfortunately, we've reacted to is each and every major outbreak we've faced. This program was built out of the ashes of the West Africa outbreak. But the programs before that were built out of the ashes of SARS-1 or the H1N1 pandemic, Sylvie, or the plague outbreaks or the meningitis outbreaks. We created the ICG mechanisms for meningitis in terms of countermeasure management. When no one knew the word countermeasures, we were working with MSF, UNICEF and Red Cross on managing global stockpiles of vaccine and distributing them free of charge to countries within 48 hours. That was happening in 1996 in response to the great meningitis outbreaks. But it was small, it was weak, it was unpredictable, it was unsustainable. What's happening now with the countermeasures program is much more systematic, and John Arne will speak to that global collaboration as well. Johanna will speak to the broader networking collaborations, and obviously our 2 ministers will speak to what's happening in national capability. It's great to see that come together. For me, it's very simple. Ask yourself the question in every era. You're just asking the question, how do you build speed into the system? How do you build precision so you're not reacting, overreacting, you're reacting appropriately? How do you build scale quickly into your response? How do you build, and these are more novel concepts over the last 10 years we've learned, and especially in the program under Tedros' leadership, how do you build a bigger degree of acceptability and trust with member states, but more importantly with communities? How do you build equity into that system? How do you build resilience into that system so national systems cope more effectively at the beginning? And how do you build those capabilities into the national system? They're the questions you ask. And if you're trying to do that, we have come up with the Health Emergency Response Framework. And I'm going to show you something, because the framework that Chikwe is running is something, if you see that there, that was done in Gulu in 2000 on a piece of paper on a board. Because there were so many people in the field, we didn't know where to put people. So we put this up on the board and we asked people to say, where do you fit in with the Ugandan government? Margaret Lamuno, who's now at WHO. And basically to get people to fit into some framework in the field, to say, I'm a clinical manager, I'm a logistician, I'm a surveillance person. And it was as simple as that that brought order. And I think our strategic framework, or Chikwe's strategic framework, focuses on that. Clear purpose in what we do. A focus on investing in people, a focus on investing in processes and programs that work, on the performance of those programs, on predictable finance for those performance, and again, the performance of those programs. For me, it's all about those P's. The people here will speak to that. And in that sense, I come back to my final statement. The existence of this program and all the sister programs in the partner organizations is under threat. The very existence. We talk about reform and we talk about evolution, we talk about expansion, but existence is now an issue for public health programs at all levels. But we need to enable those programs, we need to evolve those programs, and we need to expand those programs. I'm not a great fan of the word reform, because reform implies that what went before was broken and it needs to be changed. It needs to evolve. Systems were designed to deal with what they were dealing with years ago. The structure of WHO was designed 75 years ago to service member states who were emerging from a world war, emerging through independence and post-colonial creation of ministries of health. That structure, in my view, no longer satisfies the world's need today, and equally so in our little world of emergencies. The structure, process, functions and performance of the emergency programme must evolve to meet the needs of today. And I have huge faith in the team here and the teams at the regional office level, in all our partners, in Chikwe particularly as my friend, in Tedros as our leader, that will continue to happen. I look forward to hearing from the other participants. Thank you.
Thanks, Mike. In the years I worked with you, very often I leave the room wishing I had recorded your remarks. Today, at least, we're lucky that your remarks are being recorded, and we have many colleagues watching online. So beyond the colleagues in the room, many people are watching online. Thank you for joining this first strategic roundtable of the 79th World Health Assembly. So now that DG and Mike have set the scene, we'll go into an exciting panel of speakers. It was very difficult to decide on the 5 colleagues we will invite today. Thank you, all of you, for immediately accepting our call. It means a lot to us because our work spans it spans operations, policy, law, people, partners, countries, and sometimes there are people working in all these spaces. And in what you offer us today, I hope we're able to cover some of them, but not all of them. But I think the most important thing is that we are a learning organization, and DG has really pushed us hard through every response, and Mike just mentioned it, to innovate, to learn, to push. Sometimes in the conversations today, people say we should go back to our core functions. But, we have to evolve. And it is that evolution in response to the needs that has seen us evolve in many ways. And when I say we, I mean all of us together. We are a secretariat of a World Health Organization, owned and run and driven by our member states, and working with partners in any context we're working. So I think all of those will come out through the panel today. So thank you very much for accepting. We will start with a dear friend. Johanna Hannefeld is the acting president of the Robert Koch Institute in Germany, one of the oldest public health agencies in the world. And has worked very closely with the emergencies program, specifically the Hub for Epidemic and Pandemic Intelligence, which was one of the big innovations during the pandemic. I still remember when it was announced in April 2021, I took a second look and said, interesting, I wonder what's going on. This was many months before anyone thought of, making it a reality. But now it is a reality. And Johanna will speak to us a bit in how the hub and the program itself is rethinking surveillance, rethinking epidemic intelligence post-COVID, what we have learned, what we are learning, and how that whole engagement will hopefully drive a lot of the work we are doing, but also what member states will be doing into the future. So Johanna, over to you.
Yeah, thank you, Chike, for the warm introduction, and thank you, DG, also for the invitation, for being there. So, Mike, nothing is ever new, but boy, have you evolved, right? So, and working with the Berlin Hub, I have the pleasure of really seeing that evolution, and I'm very happy to share some of the observation around the rethinking of surveillance and of epidemic intelligence after COVID-19, of that evolution. So, RKI and Germany, we're really proud and honored that we have been with you in this field driving this innovation. I just wanted to make a couple of points before I reflect on this. And the first is the word of intelligence, right? So we've seen this incredibly rapid acceleration of available data and information. So we've really seen an explosion of that. But we've also seen how rapidly outbreaks, when not detected and responded to, can develop and infectious diseases spread. And then we've seen the rise of dis and misinformation in our politics, but also in public health, amplified by social media and so on. So our work in public health, I feel at country level, but also globally, has fundamentally changed. It's become more complex, and the analytical component of that work has become much more important, but also much more in this complexity. So this means that intelligence and the sophisticated analytics have become much more important and have really become vital. And that's not an undoing of the post-its you put up at that time, but it's the evolution that you described. And intelligence is really about the ability to distill all these multiple data sources in real time with a great variety of sources, open sources, traditional surveillance systems that we have, where we get notification, where we have syndromic surveillance and so forth, to analyze them, to detect the system, to detect the signals that allow us to act and respond, ultimately protecting public health, and to do this while retaining the trust of our publics. So for me, this is really not an insignificant challenge, and it's also a daily challenge if you're in a National Public Health Institute. And the WHO hub in Berlin, including through the partnership, not just through the partnership with RKI, but including through the partnership with RKI, has really been at the forefront for me for meeting that challenge. So we've developed new tools and methods for this analytics. We've worked together with our country partners to develop, for example, AI-supported approaches. We've done this, developed and evolved the open source tool of EIOS and advanced analytics to detect and assess signals globally, but also at country level. And what's been important for me, particularly through our partnership, we've not only developed the methods for this, but we've also done it together with partners at the regional level, but at the country level, for example, in AFRO and EMRO, to make sure that we don't just have exciting methodological innovation, but really implementation that stands the test in diverse settings. One of the outcomes of this work in the past couple of years has been a new framework for public health intelligence that I wanted to briefly highlight, and a curriculum that goes hand in hand to build capacities in public health capacities in National Public Health Institutes. So build public health intelligence at National Public Health Institute level around the world. And we've been doing similar work around genomics and biosecurity. But the point I wanted to make in mentioning that curriculum is that I think we talk about fancy analytics, and they are really important, right? And so the methodological innovation is really important. But we do need the systems to implement it. And we need them at national and we need them at community level. So this work has to go hand in hand and connected globally. And for me, that's the second real big pleasure and joy of working with the hub, is that the hub is this thing. It's connecting. It's a hub for the world. It's bringing people together. And that's been another aspect of our partnership. So we've got a GORN Fellowship Program, which also brings in other aspects of the Health Emergency Program, where we can support partners from National Public Health Institutes who come to Berlin, who develop a method or develop a solution to a challenge in their surveillance that they meet in their day-to-day work. We support them back at country level and help them implement this sustainably. So this work comes together not just through the methods, but really through the way in which we work, being able to combine our skills and our networks, and being able to do that as National Public Health Institute with regional partners, but also with the WHO in new and exciting ways. And I think that really, to me, is then the ingredients that create this gold dust of health security, I think, where you have rapid detection and response, but you also build greater public trust. So we're grateful for this partnership, and we look forward to continuing this evolution together. Thank you.
Thank you, Anna. Maybe I'll push you just a little bit more in that direction. You mentioned trust. You mentioned connecting people, connecting institutions. Are there any examples of how this has happened since you've started engaging with the hub, and both within the ecosystem in Germany, in Europe, but also around the world?
Yeah, so I mentioned the GON fellowship program. In addition, we also have the thing about the hub is it's a great connector, right? So everybody knows there's now a hub in Berlin and everybody wants to connect to it. But what it does tangibly in the work that we do as a partner of the hub is we develop some of the programs where we implement this with our partners at country level. So, for example, in developing the public health intelligence curriculum, we tested this with several countries, several partners in the EMRO region, really working at the country level. Then we brought that information back to you or co-developed it with you, and we were able to inform WHO normative guidance on this. So this is incredibly powerful, combining this national level institution with WHO's normative function. And it's really, well, it's unique, and it's been wonderful to see the power of these different networks coming together. And then if you bring in GON, for example, through the fellowship, you have another connection. You have the connection to the emergencies, and you're building capacity. So you're building the next generation of public health emergency leaders, and they're connected immediately. So in many ways, these different activities bring this together very nicely.
Thank you, Anna. So please think of your questions. We will open it up to a question and answer session. We will get there. I am trying very hard to keep time. So just hold them, and we'll get there after we've gone through the 5 speakers. So I mentioned that Joanna is leading, or one of the leaders of one of the oldest public health agencies in the world. My sister Mekdes comes from a country where they have, I think, the oldest public health agency on the African continent. And Ethiopia, thanks to the 2 current and former ministers of health from that country seated on my right, have really led on innovating in so many aspects of the work that we do in public health. But today we're going to ask Minister Faiza to speak a little bit to how Ethiopia has invested in national emergency preparedness and response capacities over the years, and how that has evolved, both influencing the work we're doing in WHO through the Global Health Emergency Corps, but also taking that knowledge back to the country and using it to develop the whole emergency preparedness and response landscape. So, Minister Mekdes, it's a real honor to have you join us for this strategic roundtable. So I'll pass it to you. Thank you.
Thank you very much, Dr. Chikwe. Thank you, DG, Dr. Tedros, and all in here, Minister. It is a pleasure to be here at the WHO, my former home also, and to see Mike Ryan again, and the whole entire team and the family. I would say I'm one of the lucky ones. You see that I'm being surrounded by a team, and it takes a team to respond to emergencies. It takes trust. It takes every one of us everywhere in the world. No one has ever done emergency, and there is no one who could speak about what lessons we should take than a room full of people who have invested their time, their energy, and also their commitment. And it's a pleasure to be here with you to talk about what Ethiopia has done and what Ethiopia has invested. But I will try to collect it more around a change we have seen since COVID, because the theme we have is what changed, what really changed us after COVID. Now, let me give you some numbers on what we had before COVID to where we are today, because each preparedness, for the first time, we're learning that preparedness is the only solution. We were not prepared when COVID came, and we were not having we had a system. Our primary healthcare system was very strong. Our predecessors, every leader who was already investing their time in Ethiopia has been looking at how can we strengthen primary health care, how can we strengthen our prevention, plus also treatment. But when COVID hit, the number of hospitals which were having, oxygen system embedded in our system was not that much. We were all trying to look at how can we strengthen our system immediately. And it takes time, it takes energy, it takes also investment. And I will also take you to how many PCR machines we were having. The investment we had through HIV programs were helping us to have a PCR machine around within the different parts of the region, but they were locked. They were not open. We were not doing sequencing for surveillance. And then for the first time, when COVID hit, we had to send our sample for sequencing out of the country, and happy and lucky that we had also countries within the continent which could have helped, and the WHO system also helped us to link among the other countries. So we have now increased, during now the recent outbreak I was managing as my first time. The first outbreak was just Mpox, but was not as much because there was already an experience that we were sharing from the other countries. But the first Marburg outbreak for our country, and then I was not having the same challenge, but there is still a challenge. But the challenge has been averted by investment. The total number of laboratories, regional laboratories, has increased from, just before COVID around 14 to now around 33, more than double. And that was the fact that we were able to do sequencing. The machines are not the only thing, but we have also been investing on workforce, those who are already trained, both in land, but also out of land. It takes a team to develop what we had. The total number of hospitals that were having oxygen plants was always cylinders. I want to link both the response, but also the surveillance side. So it was only 3 plants that we had from the public system. But now we have more than 64 plants per country which are generating oxygen. So it is about saving life, but what you have on your hands will also matter. And COVID has been a very good instrument for us to wake up and know that we have to invest in the healthcare system, both in a way of changing our policy. Now our policy is both on prevention plus also treatment and cure. And we're already investing a lot on how we can expand on our workforce. And the COVID preparedness lesson gave us a lesson to say that protecting lives and national stability is about a development gain that you would share not only with your country, but also with the regional framework and a global framework. The workforce scale we had and the investment we have also added is from 600 plus deployments that we have. Professionals are now trained to be deployed for emergency from the Global Health Corps. This is one of the things that we are also aspiring to have certified, internationally certified by September 2026. And we have also built through a structured multidisciplinary program. The public health institution we have is 100 years. 100 is the oldest version, the oldest public health institution. It has been tested through different times. When 2014 Ebola response was asking all of us as a country and a region, our emergency team was also deployed for the first time out of our land to support others. The Turkey earthquake response, it is beyond just infectious diseases, but it's also a preparation for public disaster. We had also the Sudan refugee influx, the landslide, the recent landslide, where we stood together with regional, global, and also WHO's mechanism to support our community. So the operation system is a real-world validation, and the recent Marburg outbreak that we have contained within less than 3 months, and by January we have already declared as been finalized, is in a setting with low infrastructure, around 800 kilometers away from the capital. So unless you start to decentralize and ensure that your investment, what countries are now calling is more for decentralization, and if we were not investing on the capacity at that remote area, it would have been difficult. So what countries had when UN system was created 80 years back, which Ethiopia was the first signatory among the African countries, to what we have now is completely different. and let alone a change we have seen since COVID to how we have handled Marburg. So there is a lot to study, but it's about shifting a transition of the ad hoc surge to the current one that we have in a predictable global workforce, a predictable investment, interoperability, pre-training and pre-deployment. So there are lots of lessons to learn, but we have to know that the world has changed and we have to adapt to it. Thank you.
Thank you, Minister Meknes. Maybe just one quick follow-up question. You know, the buzzword in public health at the moment is sovereignty. Mm-hmm. Every country is thinking about what it does on its own, which is a great thing. But in some challenges we face, whether it's climate change, whether it's pandemic preparedness, we have to work together. The principle of universality is very important and will define our work. So what are some of your thoughts on how countries can, in addition to build their own capacity, also make sure that we have framework with which we can all collectively do the work we have to do for our people?
There is not going to be sovereignty unless countries are already investing in their system, and a healthcare system which is not owned, and a financial system that is predictable, and supporting your system by your own has to be also linked with predictability and continuous financing your instruments. So countries have to have a predictable financing mechanism, shifting from emergency funds to a sustainable investment fund. And this can be done, of course. There are several states now, tables that are discussing around sustainable financing. So there is no sovereignty without having sustainable financing and national commitment and government's commitment to work around it. And long-term funding on both workforce, on system, infrastructure, science. A lot of us are now working around localization, local production. And why I added localization before local production is the capacity has to be built in country. That way we will have a sovereignty. That way we will have a shared sovereignty for the world, because we don't know what would be our threat in the future. So the shared commitment that we will set have to be about equitable access. And for sovereignty, the equitable access to benefits, the equitable access to countermeasures, both diagnostics and therapeutics, have to be on table when we're talking about sovereignty. This is about rapid vaccines, therapeutics. A lot is in discussion. But the operationalization of solidarity has to be in place. There is no sovereignty without solidarity. We need solidarity. We need to be around, and deployment and in different places during emergency or beyond. So the principle behind, I would say, is investing together, trusting each other, and ensuring that we're not doing it just for one country, and we have to see beyond, from region, sub-region within a country to a country, from a country to a continent, from a continent to the global one. That way we will have a good solidarity and sovereignty. Thank you.
Thank you. We add the word solidarity to sovereignty, and then it comes together nicely. But thank you very much for your reflections on that. So now we'll come to John Arne Rottingen. John Arne is currently CEO of Wellcome, but he's much more than that. He's a friend, a thought leader, scientist, and has thought about medical countermeasures from many perspectives, from the research and development angle to the deployment and recovery and ultimately resilience, and has really been at the heart of many of the conversations leading to this, the growth of this space. This space is something that is very important for us, whether it's the pandemic agreement, whether it's the current Ebola response that we're just standing up. Medical countermeasures are the heart of all the work that we're doing. So John Arne, thanks for coming, and over to you.
Thanks, Chikwe, and thanks for the opportunity. And Director General, honorable ministers and distinguished participants, it's really an honor to be able to speak here, now on behalf of Wellcome, but also as a long-term friend and collaborator of the World Health Organization. Because, as we just heard, today's discussion is vital, but it's even more, unfortunately, very timely. And from the very concrete perspective, we have an ongoing and worrying Ebola outbreak of the Bundibugyo variant that has led to the declaration of FAIC, as the Director General just said. And it is unfortunately a virus where we do not have any specific medical countermeasures, no clear diagnostics, specific vaccines or therapeutics. And the vaccine that we tested through a ring vaccination trial in Guinea in 2014 and 15 that was highly effective and have helped controlling later Ebola outbreaks was not specified for this ongoing Ebola variant. That's a fact. And that's why the public health response with contact tracing, testing, follow-up is so crucial. But this meeting and this discussion is also timely from a policy and political perspective. We do approach the UN high-level meeting on pandemic prevention, preparedness and response later this year, and our focus should be shifting from what we learned during the COVID-19 pandemic to what we actually have changed as a result, but where the continued gaps are. The key question is not whether the challenges exposed by the pandemic and since are understood, but whether we are moving fast enough and at a sufficient scale to address them. COVID-19 demonstrated what is scientifically possible. Vaccines developed at unprecedented speed, new platform technologies proven in real-world settings, and global attention mobilized around countermeasures. But it also highlighted fundamental weaknesses in how those countermeasures are coordinated, financed, delivered, and used. And while we rightly focus on how we can recreate those scientific successes in the future, we must do much more to avoid repeating the systemic failures that stood in the way of their equitable delivery and access, as we just heard. The experiences demand that advances in medical countermeasure innovation must be systemic, spanning discovery, manufacturing, delivery, trust, and uptake. We need a full end-to-end perspective, as we say, including also the last mile delivery to people. I would like to highlight, therefore, 3 key lessons in this. Firstly, innovation must deliver real-world impact, not just scientific successes. The global R&D ecosystem delivered extraordinary breakthroughs during COVID-19, but their impact was uneven, constrained by gaps in access, delivery systems, and also trust. This has reinforced that access and uptake are not downstream issues that we think about late in a development cycle. They need to be core to innovation itself. They need to be planned for. The shift toward community protection that WHO is driving, including risk communication and trusted engagement, is therefore essential. And the simple point that remains even more pertinent than in 2020, a vaccine that is not trusted, because we've seen all the mistrust emerging after that, or a diagnostic test that is not used, cannot be considered successes. Embedding community perspectives into countermeasure design and deployment must now be a core capability. My second point, preparedness requires sustained systems and efforts, not emergency coordination only. And during the COVID-19 pandemic, mechanisms such as the ACT Accelerator showed that rapid coordination is possible, but evaluations also revealed challenges in collective governance, in financing, and sustained capability. We need to learn from those evaluations, particularly also that we need to see beyond vaccines, in diagnostics and therapeutics, in PPEs, and the wider health system's needs, already addressed by my fellow panelists. Preparedness must be built and demonstrated before crisis. That depends on having development and manufacturing platforms, clinical trial networks, and regulatory pathways all ready to activate. At Wellcome, we're really proud to have long supported this work, particularly through our co-founding of CEPI, an institution that plays a critical role in strengthening our ability to prevent and respond to outbreaks through vaccine readiness. As a case in point, the 2024 Marburg outbreak in Rwanda showed what operational readiness can look like, because following earlier in-country preparedness exercises, CEPI supported a vaccine trial within days, enabling vaccination of frontline workers just 10 days after detection. And as we watch, with great concern, indeed, the emerging Ebola virus outbreak centered in DRC, we must have front of mind the experience in past outbreaks of the value of being able to rapidly mount trials for new countermeasures and take every step possible to embed research into the response. And I would say we are actually in a better place. The WHO R&D blueprint set up after the West African Ebola epidemic actually kicked off in this room exactly more or less 11 years ago, has together with partners ensured that we this time around have mutually agreed protocols to start from. And WHO set up the interim MCM net based on the experiences after ACT Accelerated to foster effective coordination on medical countermeasures. It's still, probably still interim because WHO needed and wanted to await the conclusions of intergovernmental negotiations of the pandemic agreement and PABS. But in addition, independent tracking is also key. To this end, Wellcome has since 2022 hosted and supported the International Pandemic Preparedness Secretariat, whose 100-day mission scorecard highlights where real progress is being made and where gaps remain. This transparency is essential to move from commitments to demonstrable readiness and to guide prudent investments. And IPPS actually started its now current 100-day clock on Sunday after Dr. Tedros declared FIKE, and will report progress every 15 days on how we are progressing. And third, my final point, we must acknowledge the extent to which the enabling ecosystem for all of this, and particularly its financing, is coming under ever greater strain. Countermeasures are only effective if they are deployed early. We all know that. That depends on strong surveillance and data systems. We heard about it from my colleague, capable of generating rapid, actionable intelligence. Again, progress has been made, including driven by new institutions, by the Epidemic Intelligence Hub of WHO, by Africa CDC and other partners. And all of this improve accessibility through data sharing and collaboration. But this progress is fragile, particularly in a more constrained and uncertain global funding environment and in the current geopolitical situation. More broadly, medical countermeasure innovation depends on sustained investment and strong collaboration across public, private, and philanthropic partners. In particular, governments need to be called out. Governments need to see this as protecting global security and macroeconomic stability. We have said this again and again. Governments tend to forget. This is a global public good where all need to contribute their fair share. Pressure on this ecosystem risks undermining both future innovation and current preparedness and activity. And in this context, organizations like CEPI remain critical, not only for advancing vaccines and platform technologies, but for maintaining the networks and capabilities that underpin the entire system. The aforementioned IPPS has facilitated progress on establishing a much-needed therapeutics coalition, and discussions are ongoing, but maybe too slowly, on diagnostics. And all of this need coordination. So again, back to the IMCM net. They will convene all relevant partners and actors on the current outbreak, I understand, already later this week. So in summary, as we look to progress since COVID, there is still a gap between the commitments and the capabilities actually delivered. Sustained political leadership on this issue that fully includes the perspectives of the Global South and of equity is more important than ever. If we carry forward only the scientific advances from COVID-19, we will fall short. But if we strengthen the systems that enable that science to reach people quickly and equitably, we can fundamentally improve preparedness for the future. Unless someone comes to change it, Mike said. We cannot wait for someone. We are representing everyone, almost, and we need to be that team together. Thank you.
So thanks, John Arne. I'll hold on questions till the end, just to manage the time that we have, and move on to Daniela Garone. Daniela sat next to me is the International Medical Coordinator of MSF. She's a co-chair of GOAN. I met her working on the technical advisory panel of the Pandemic Fund. So she's known for wearing multiple hats at different times. But, you know, Daniela, today we'll speak a little bit about financing the work that we do in preparedness and response. And, you know, we have not brought a finance expert because we brought you to think a little bit, because you've got these links on both sides. And, you know, one of the biggest lessons that we learned from COVID, from the pandemic was, you know, we cannot depend on reactive financing to finance the work we're doing in preparedness and response. So looking forward to hearing your reflections on this. Over to you, Daniela.
Thank you very much, Chikwe. I must admit I was thinking for a while why you will invite me to talk about finances. But I think it makes sense to have somebody who has been in the reactive mechanism to talk about how to do a reactive response on time. I think if you allow me to start, and if COVID-19 and outbreaks like Ebola and Mpox and cholera have taught us anything, is that solidarity cannot be improvised in the middle of a crisis. And that is a fact. But yet today, converging pressures, escalating conflict, forced displacement, the climate crisis, and shrinking in the health and humanitarian budgets are pushing millions of people into the need of a humanitarian and health system. And that's while forcing the world to do much more, to do it better, and to do it with less. Across many of the countries that MSF is working, we already witnessed the consequences of the global health funding cut, from shortages of health staff to surveillance systems that are unable to detect on time, to limited access to medical countermeasures. The reactive financing is necessary, but it costs far more than preventive implementations and investment. Dedicated mechanisms to build preparedness, such as the Pandemic Fund, are essential, but has to be make them work, and we must honestly reflect on the lessons from the recent global health emergencies, including COVID. 5 of these lessons teach us that we will not find solutions in frameworks, but in the realities. Outbreaks start and end in the communities. The inclusive governance and decision-makings are essential, but we must walk the talk. COVAX was established to ensure equitable access to COVID-19 vaccinations regardless of the country's income. Yet, many of the low and middle-income countries, civil societies, regional institutions, and the affected communities were excluded from a meaningful decision-making. As a result, the reality on the ground was far from what it was needed. It is encouraging that the communities and organizations now are working together to co-define pandemic fund proposals rooted in national dialogue and in national programs. This is a first right step toward engaging communities as genuine partners and not merely beneficiaries. The second lesson is only through real equity can we protect populations. Many outbreaks begin in remote areas and spread rapidly. We know this today, and many know this today. Reaching populations in conflict and crisis settings must be the core priority, not an afterthought. Existing global mechanisms are rarely designed with an humanitarian deployment in mind, as the experience of the humanitarian buffer and its failure has shown us. The limited fit-for-purpose pathways to ensure equitable access to care and medical countermeasures in fragile and humanitarian contexts continue to limit the country's ability to respond on time. Effective response requires flexibility. Flexibilities in funds, flexibilities in approach, flexibility in operations, but flexibility on legal frameworks that will not impose unacceptable risk to those who can implement. Reactive funding to support the timely deployment of medical countermeasures remain critical. We know it through the global vaccine stockpile Mike was mentioning. It was created in '96 for meningitis, and we're still sitting around and growing. Now we assumed the Mpox, created by MSF with UNICEF, WHO, and IFRC, many of those who are sitting here are ICG members. Without this financing and flexibility, using the supported Gavi mechanism plus the WHO revolving funds to Gavi non-eligible countries, we never could achieve equity. Populations need to be, if we don't have these flexible mechanisms that are not attached to an income situation, we're never going to be we will have a population systematically excluded from the response. The WHO contingency funds is providing an opportunity to fast-track REACT fundings in emergency, the same as the Global Fund, Emergency Fund, as well as the Pandemic Fund relocation of fundings that were happening for MPOX response. Preparedness must be sustained between crises. We know time and again we have learned that investing in civil societies, health systems, and workforce is much more important. Pandemic Fund has the potential to fill those long-standing gaps in preparedness, but this should be channeled through the systems in the countries. Despite mobilizing over 1 billion plus many more in co-financing, the continued replenishment of Pandemic Fund is critical. The beauty of the fund is bringing everyone together. Now we have to walk the talk of the Pandemic Fund strategy. Last, we need to ensure coherence across the growing landscape of preparedness financing and non-financing initiatives, from the Gavi Day Zero financing to the contingency planning, to the Pandemic Fund, to the Global Fund, and to the medical countermeasure nets. I think there is a critical role that WHO is playing to put all of these mechanisms together and make the best use of these resources to deliver medical countermeasure on time and to everyone that is in need. I think the mandate of WHO is clear. It's now need to build on the EMTs, on the GORN, on the EOCs, under the SHIHEC framework with the reality in mind. I think I'm going to stop there because you're running out of time.
Thank you. Thank you, Daniela. I think we will make you a financing expert. But no, thanks for helping us reflect on all the innovations that have happened and really focusing on the need for flexible, rapid financing at the different levels, from the CFE that we can deploy rapidly to the Pandemic Fund and everything in between. So we'll go to our last speaker for the session. Pierre Somse is Minister of Health for the Central African Republic. Many of you would have seen him as a long friend of WHO, one of our longest standing ministers in the African continent, but also a dear friend and brother. And I remember during my short internship in WHO Afro last year, Pierre really offered me the mentorship and way to approach ministers of health in our unique way on the continent, for which we are always grateful. So thank you, sir. Over to you.
Thank you. Merci. Merci beaucoup.
Thank you very much, and good afternoon, everyone. Director General, dear brothers, friends. Distinguished guests. First of all, thank you. Thank you to the WHO and Dr. Chikwe for having brought me into this very important round table. To give our perspective and to hear about a topic of relevance to our daily realities in emergency situations. I was asked to speak about the UHPR. This is a tool, but also an action that WHO has initiated in the midst of the COVID crisis, but also with the idea in mind to consolidate what has been built, the experience gained, and the science that we have discerned from COVID, in order to manage epidemics of this scale more flexibly, more smoothly, and more in depth. And first of all, allow me to give you an idea of what happened in Central Africa, just to give some context. The UHPR is an exercise that requires involvement and participation. Ryan's team at global level are involved with the experts. Then we have the regional office team and also stakeholders at national level. All need to be involved and have been involved at different levels. The President of the Republic, the government, different sectors, community leaders, religious leaders, representatives of vulnerable groups, the private sector. All of these stakeholders were mobilized so that together we could undertake an exercise which sought to provide diagnostics as to the response capacity, the preparedness to provide a response to an epidemic. But at the same time, to determine what actions needed to be taken in order to strengthen the country's capacity, in order to make it more able to manage response in the short, mid, and long term. And the particularity of this exercise is that it falls within an already established framework, a committee coordinating the COVID emergency, which was the crisis committee presided over by the head of state. And so this was an exercise piloted at very high level. WHO was also involved at a very high level. And so this really was an activity at scale. And so we have the question of what is the difference between the UHPR, external evaluations, and so on. And this is something I want to resolve here. You will see that it's the same thing, but it's also not. We have an external technical evaluation, and as a Minister of Health and expert in public health, when I was nominated minister, first of all, I received an external technical evaluation. And when I looked at this, I thought, this won't go very far. It's a report between technicians, from one technician to another, with an evaluation which won't make things move. And if I weren't an expert in public health, I wouldn't have paid it any attention. So then you look at the UHPR, and this is everyone. We use the results from the evaluation on the IHRs and others, but we went further. There was more work done by experts in order to bring in data at national level, at international level. There is a whole body of work feeding in, and intelligence feeding in, which was made available to a whole community, to a whole multi-sectoral group. So we're no longer at that evaluation level here. And the UHPR report was adopted by the Council of Ministers. It was presented to the Council of Ministers and adopted. The external evaluation report, I know it exists, but others maybe not. So that generally is the UHPR process, and we could add detail, but I might have to add too much detail and take too much time. But what is its added value? I could give a presentation here again, but we don't have a lot of time. But UHPR is singular. In one review, we have combined everything. And if I speak about holistic management of a disaster, I see at least 4 things, at least 4 elements in there. There is early warning. You need to anticipate, you need to know. Then there's preparation, there's response, and there's evaluation. And I see 4 actions there that we do in a fragmented way. And the UHPR has brought all of those elements together. There's this cycle of actions coordinated in one single action. And I say one cycle because this brings in all stakeholders to one single place. There are the political actors, we have ministers, heads of state, and so on, administrative stakeholders. You then have community stakeholders, community leaders, cultural leaders, religious leaders. All of these stakeholders and actors who often don't find themselves in our epidemiological work, they are suddenly brought in. And so I'm saying it's one activity because this really does tie in everyone at local level, national level, and global level, and regional as well, of course. We have WHO at global level, WHO at regional level, then we have country and local level as well. So it is a tool that really does unite all of these actors. And it's also a tool to mobilize resources and a tool that produces immediate results. You see financial resources going in, political resources invested, community resources, technical resources, and cultural resources. All of these elements are there present. And afterward, I can confirm these resources are engaged. And we are currently in the process of implementing 300 recommendations coming out of this. Many have already been implemented. And one of the important points to highlight is the issue of human resources in Central Africa. We do have training in epidemiology. We have some 100 field experts trained. And one extremely important point is the training system. We didn't have enough information indicators. And now we have a national digitalized information system in place. With the assistance of AI, the support of the WHO and other partners. And we also needed to review our architecture of how we can respond to epidemics, starting with the crisis committee, which was set up for COVID. And the review found that we can't go from finding an epidemic here through to universal health coverage somewhere else. This is an integrated process, and we needed to reconfigure the crisis committee to take into account these elements. And now we have this presided over by the President of the Republic that takes into account primary health care, universal health coverage, and international health security. And as an outcome of that today, we have political mobilization with the Council of Ministers. The situation of epidemics has become a permanent standing issue among the Council of Ministers. Before, that wasn't the case. And a second example of consequence, we can talk about the management of Mpox. When Mpox came about, when we triggered the response, our champion, Dr. Roslin, is there, who worked under COVID and helped with the community response. Everyone, community leaders, managed to manage a response to Mpox. And I will conclude by saying that UHPR makes everyone an epidemiologist. In research and in intervention, everyone, involving the community as well. Thank you.
I will ask for thank you, Pierre. Thanks a lot for reminding us on all the levels of our work that are important. And when we started UHPR, there are many questions, like you rightly said, but I think that those have answered themselves. But thank you for your leadership. I promised you you'll have time for questions. Unfortunately, I will break that promise because we have run out of time, but really thanks to the incredible panel that we've had to address some really tough issues, from surveillance to workforce, medical countermeasures, financing and governance. So thank you so very much. Thanks to the team that put this together, really grateful. Thanks to the amazing colleagues in the emergencies program across our 3 levels that work very hard every day to pull all of this together. We've learned a lot of lessons and we'll take them forward. Thanks, Mike, for everything you've done and continue to do. We're always grateful. And back to you, DG, for your final comments and closing.
Yeah, thank you. I think everything has been said, so I'll be very brief. First, thank you so much to Minister Mekdes and Mr. Pierre. Thank you so much. This shows your commitment, your presence here. And then also to our colleagues, to Mike, Yonarne, Johanna, and Daniela. Thank you so much for your contribution to this panel. I think one message has come through very clearly, that the world cannot afford to approach health emergencies in the same way it did before COVID and during COVID. So we have to evolve, continue to evolve, build on all the changes we have been making. So that's very clear. Of course, the one ask maybe I would add to that is, the last piece of the puzzle now, since we have the pandemic agreement and the IHR amendment, is the pubs. So I hope our leaders here, ministers, are in this room, and we would appreciate it if you can push. The meeting is in July, from July 7, I think, up to 17. But of course, before that, there are informal sessions. If we can make it happen this July, that would be great, especially given what's happening with Hanta and Ebola. There is already a sense of urgency. And Madeline from the Bureau is watching and say, are you going to deliver on this? I'm sure they will deliver, but it's just trying to remind. So thank you so much again, and all the very best. Merci beaucoup.
We will now reopen agenda item 13, Public Health Emergencies, Preparedness and Response under Protect Health, sub-item 13.3, Open-Ended Intergovernmental Working Group on the WHO Pandemic Agreement. The relevant document for this sub-item is A79/8 and A79/8 add 1. We are also invited to consider the draft decision recommended by Intergovernmental Working Group on the WHO Pandemic Agreement, contained in the annex of document A79/8. The associated financial and administrative implications are contained in document A79/8 add 1. When we suspended our discussion yesterday evening, we had completed our debate on this sub-item. I shall now give the floor to the Secretariat, Dr. Barbosa, Regional Director for the Americas.
Thank you, Mr. Chair. I make this statement on behalf of the 6 WHO Regional Directors. Over the past year, Member States have worked intensively through formal meetings, resumed sessions, intersessional consultations, informal discussions, and expert exchanges. This work has advanced key elements related to pathogen access, benefit sharing, contracts, laboratory coordination, and WHO-recognized sequence databases. Important progress has been achieved. At the same time, additional work is needed to ensure that the PAB system is not only negotiated, but also practical, fair, trusted, and implementable. This is essential. Future health emergencies, fakes, and pandemics will require the timely sharing of information and materials, equitable access to vaccines, diagnostics, and therapeutics, and stronger cooperation across the multilateral system. The continuation of this process reflects the country's commitment to an inclusive member state-led approach. It also reminds us that solidarity is not an abstract principle. It must translate into systems that work for countries, communities, and people when they need them most. We remain committed to support our member states through technical cooperation and continual engagement in the global effort for early detection, alert, and response. The world is naturally more prone to highlight and act on outbreaks and epidemics that may become pandemics. We are collectively stronger in the epidemic prevention and preparedness. And we are convinced that sharing timely, relevant information and working together, we have stopped the outbreaks from turning into epidemics or pandemics. Thus, we must begin paying more attention in counting the epidemics and pandemics that didn't happen because we were able to scan and analyze millions of signals, identifying situations that may constitute an event, sharing timely and relevant information, deploying experts, performing rapid risk assessment, and implementing control measures to stop an outbreak at the source and effectively prevent epidemics and pandemics. Key provisions are needed to streamline access to critical information and essential health products, especially in areas affected by health emergencies. We commit ourselves and encourage all member states to continue working together with trust, flexibility, and shared responsibility to advance a fair, operational, and implementable outcome for a safer and healthier world. Thank you very much, Mr. Chair.
Thank you, Dr. Barbosa. I now give the floor to Dr. Chekwe, Executive Director, WHO Health Emergencies Preparedness and Response Program.
Thank you, Chair. Distinguished delegates, thank you for your continued commitment to the negotiations on the PABS Annex. Over the past year, everyone in your secretariat, and indeed across your organization, has worked hard to support your discussions and negotiations. We have offered you not only deep expertise on the very difficult technical issues that you have discussed, but we have also shared the lessons that we have learned from working on your behalf on many of the individual components of the future PAB system. We have stayed with you through all the days and often nights, led by our Director General, and will stay with you for as long as it takes. Every single day as we work on your behalf, we face new infectious disease threats, and as you have witnessed yourselves over the last 3 weeks with the hantavirus outbreak and the public health emergency of international concern for Ebola just declared. Every day, we work with the anxiety that your agreement to the annex will not come too late. We hold on to the interim mechanism that we've set up on your behalf since the last pandemic. However, none of these mechanisms are solid enough to give us the leverage that we need to respond to the next emergent pandemic when it comes. We continue to count on your commitment and offer you our continued support through the next period. We will be there for you as long as you need us. We are counting on you on behalf of all those working every day on prevention, detection, and response in all your countries and here in WHO to give us the instruments to do the work that we need to do on your behalf. This is your process. You are the drafters, You are the negotiators, and you will agree the text and implement it. We look forward to welcoming you back to this room in a few weeks' time to continue the work that we cannot stop. I thank you.
Thank you, Dr. Chikwe. Is the committee ready to note the report as contained in document A79/8? The report is noted. We will now consider the draft decision entitlement outcome of the open-ended intergovernmental working group on the WHO pandemic agreement in relation to the drafting and negotiation of the annex described in Article 12 of the WHO pandemic agreement contained in the annex of document A79/8. Is the committee ready to approve the draft decision? I see no objections. The decision is approved. The agenda sub-item is now closed. We will now take up the grouping of the following agenda item under Protect Health. Sub-item 13.1, report of the Independent Oversight and Advisory Committee for the WHO Health Emergencies Program. And sub-item 13.2, implementation of the international health regulations. The relevant documents are A79/6, A79/7, A79/INF./2, and A79/INF./3. During the discussion, you are invited to provide guidance on the question contained in the document A79/7. Before we begin our discussion on this grouping of items, I would like to invite the chair of the Independent Oversight and Advisory Committee for the WHO Health Emergencies Program, Professor Walid Ammar, to make some introductory remarks. Professor Ammar, you have the floor.
Okay. Thank you, Mr. Chair. I am honored to present document A79/6 on behalf of the Independent Oversight and Advisory Committee for the WHO Health Emergencies Program, IOAC. The year 2026 marks the 10th anniversary of the establishment of the WHE program by member states, following shortcomings from the response to the 2014-2016 Ebola outbreak in West Africa. It was founded on the principle of a single program with one clear line of authority, one workforce, one budget, and one set of rules and processes. Over the past decade, the program has evolved to meet growing demands. While many changes were necessary adaptations and positive evolutions, others have moved away from the program's original principles and initial intent. Persistent challenges remain, including the grade and mandate of the XD, the inconsistent application of delegated authorities, and the emergency response framework. In this context, the IOEC believes that current practice and decisions in force should be fully aligned and consistently applied. This is the 14th report which presents findings on the prioritization process, WHO leadership in health emergencies, financing, human resources, partnerships, and member state leadership for health security. On the prioritization process, the IOAC congratulates the Director General, regional directors, and WHO leadership for their stewardship and for ensuring that core emergency functions are preserved across all levels of WHO. On financing, we commend member states for increasing assessed contributions. We also recognize Dr. Tedros' steadfast commitment to strengthening the WHE program, as evidenced by the expansion of its financial and operational resources. However, flexible and predictable funding gaps remain. In particular, we are concerned by the depletion of the contingency fund for emergencies. In 2025, it released $29.4 million to support 24 emergencies, but received only $10.6 million from 12 donors. At a time of rising global needs, a shrinking CFE is a serious operational risk. We therefore call for its continuous replenishment. In 2025, WHO responded to 50 graded emergencies in 82 countries and territories. This sustained level of activity is no longer exceptional, but increasingly the norm. The ongoing hantavirus and Ebola outbreaks are a further reminder that emerging infectious disease threats continue to test global preparedness and response capacities and reinforce the urgent need to protect, sustain, and strengthen the WHE program. In this context of escalating health emergencies and cross-border threats, we congratulate member states on the adoption of the WHO pandemic agreement at last year's assembly, a success for multilateralism. However, we are concerned that consensus on the PAPS Annex has not been reached, and we call on member states to urgently conclude negotiations and submit a mutually agreed PAPS Annex to a special session of the Assembly in 2026. The world needs this agreement, and further delay will carry significant consequences. On this 10th anniversary of the WHE program, in a context of heightened geopolitical volatility and financial constraint, this moment requires strategic clarity. The IOEC is conducting a 10-year review of the program's evolution to provide member states with evidence to reflect on whether its mandate, expectations, authority, and financing are aligned. Findings will be shared toward the end of this year. Action taken now will shape global capacity to respond to future crises. A strong WHE program is not optional. It is a global necessity. On behalf of the IOAC, I thank you.
Okay. Thank you, Professor Amar. I will now open the floor for discussions. Would those delegates wishing to speak, please press the microphone button now to be added to the speakers list. The microphone will open automatically when I call your delegation to take the floor. There is no need to touch the microphone button again, as this will remove you from the speakers list. I first give the floor to delegate of Tunisia. The delegate of Tunisia, you may speak.
Thank you, Chair. I'm delivering the statement on behalf of the region. Esteemed Chair, Excellencies, we welcome the report of the Independent Oversight and Advisory Committee and recommend its continued oversight of the WHO Health Emergencies Program. The report confirms that health emergencies are increasing in frequency, scale, and complexity, driven by conflict, climate change, and outbreaks, placing unprecedented strain on systems. We recognize WHO's strong leadership in emergencies. The program has become a critical global asset, demonstrating its capacity to coordinate, deliver, and support member states, particularly in fragile and conflict-affected settings. These challenges are closely linked to implementation of the International Health Regulation, which remain the foundation of global health security. Our region remains committed to advancing IHR implementation. Full participation in state party annual reporting has improved transparency and accountability. Engagement across the joint external evaluation cycle has supported countries in translating assessments into prioritized national action plans for health security. Continuous improvement mechanisms, including after-action reviews and simulation exercises, have strengthened operational readiness, while regional training and communities of practice have enhanced technical capacity, including for the implementation of IHR amendments. Nevertheless, significant challenges remain. Financing constraints continue to impede sustainable implementation of national plans, and capacities remain uneven, particularly in fragile and conflict-affected settings. Workforce and institutional gaps persist, and cross-sectoral coordination is not yet consistently operationalized. The message across both agenda items is clear. The effectiveness of WHO's emergency response and the success of IHR implementation are mutually reinforcing and depend on sustained commitment and investment. We must preserve WHO's core functions, secure more flexible and predictable financing, strengthen partnerships, avoid fragmentation, and ensure coordinated and efficient global response. Thank you.
Thank you, Tunisia. I now give the floor to Tanzania, to be followed by Samoa.
Thank you, Chair. I have the honor to deliver this statement on behalf of the 47 member states of the WHO African region on agenda item 13.1 and 13.2. The African region thanks the Secretariat for the reports and appreciates the continued work of the WHO Health Emergencies Program and the guidance of the Independent Oversight and Advisory Committee in strengthening global health emergency preparedness and response. We recognize that the evolving global health landscape, including emerging infectious diseases, climate-related emergencies, humanitarian crises, and zoonotic threats, require stronger and more sustainable implementation of the international health regulations. The increase in these global threats and crises weaken healthcare systems, emphasizing the need for the sustained international coordination. In line with the IHR 2024 amendments, the African region calls for stronger engagement with member states in emergency preparedness, detection, and response, coupled by sustained financing of emergency operations. We note with appreciation the support provided to member states in strengthening surveillance and the broader IHR core capacities, including internal and external evaluations. To sustainably implement IHR, member states emphasize the adoption of the One Health approach and continued use of IHR M&E framework to identify gaps and guide investments. Equitable access to medical countermeasures, technology transfer, and sustained technical and financial support for developing countries to ensure effective implementation of the amended regulations is further encouraged. In addition, African region appreciates the continued oversight role of the Independent Oversight Advisory Committee in strengthening WHO's emergency preparedness and response architecture. We note the committee's emphasis on sustainable financing accountability, and stronger coordination across 3 levels of WHO to ensure effective emergency operations and long-term preparedness. We further recognize the committee's recommendation on strengthening prevention and preparedness capacities, including investment in early warning and resilient health systems, public health intelligence, and workforce capacity. The African region particularly supports calls. We encourage continued support to countries while ensuring that equity, solidarity, and country ownership remain central to WHO Health Emergency Program and implementation of the amended IHR regulations, especially in vulnerable countries. The African region remains committed to strengthening global health security through solidarity, cooperation, and national ownership. I thank you.
Thank you, Tanzania. I now give the floor to Samoa, followed by Kenya.
Thank you, Chair. We thank the Director General and the Independent Oversight and Advisory Committee for their reports. For Samoa and other small island developing states, health emergencies are increasingly frequent and complex, driven by climate-related disasters, infectious disease outbreaks, and pressures on fragile health systems. These challenges require sustained international cooperation and continued investment in WHO's Health Emergencies Program to reserve its essential emergency capacities and support vulnerable countries. Samoa welcomes ongoing implementation of the International Health Regulation 2005 and the 2024 amendments. However, as a geographically isolated island nation with limited resources, sustaining core IHR capacity remains challenging, particularly in preparedness, workforce retention, and resilient health systems. We therefore call for sustainable financing for emergency preparedness and response, strengthen support for small island developing states in implementing the IHR amendments, continue investment in preparedness mechanisms and workforce development, and stronger partnerships that build long-term resilience and country ownership. Samoa also welcomes the WHO pandemic agreement and encourages the timely conclusion of negotiations on the pathogen access and benefit sharing annex. Samoa remains committed to working with WHO and member states to strengthen global health security and ensure no country is left behind. Thank you, Chair.
Thank you, Samoa. I now give the floor to Kenya, followed by Australia, who will be giving speech on behalf of a group.
Kenya aligns itself with a statement delivered by Tanzania on behalf of the 47 member states of the WHO Africa region. We reaffirm our commitment to the full implementation of the International Health Regulations 2005 as a critical framework for strengthening national, regional, and global health security. Kenya has made significant progress in strengthening IHR core capacities. We have completed our second joint external evaluation, which informed the development of the second National Action Plan for Health Security 2026-2030. Further, Kenya has established a functional IHR national focal point, institutionalized the integrated disease surveillance and response strategy, and strengthened the public health emergency operations at both national and county levels. We continue to implement the One Health approach through strong multi-sectoral collaboration across human, animal, and environmental health sectors and consistently meet our SPA reporting obligations. Kenya acknowledges the entry into force of the 2024 IHR amendments and remains committed to aligning national, legal, institutional, and operational frameworks accordingly. We also note the extension of the standing recommendations for Mpox, COVID-19, and commit to their implementation. Kenya recognizes that full implementation of the IHR requires sustained global investment, technology transfer, and equitable access to health products, particularly for low and middle income countries. We therefore call upon this Assembly to strengthen global solidarity and provide guidance to support the sustainable implementation of the IHR within the evolving global health landscape. I thank you.
I thank Kenya, and now give the floor to Australia, followed by Cuba.
Thank you. I have the honour of making this statement on behalf of Mexico, Indonesia, the Republic of Korea, Turkey and Australia. Our group, MICTA, brings together countries from different regions with diverse realities, priorities and experiences. What unites us is a shared belief in the value of inclusive, legitimate and cooperative multilateral solutions to global challenges. MICTA joins others in acknowledging the 10-year milestone for the WHO Health Emergencies Programme. At a time of significant volatility, we thank the IOAC for the reminder that health security is fundamentally dependent on international cooperation. We concur with the committee's view that multilateralism remains the most effective and essential mechanism for coordinated, equitable and durable responses to global crises. The WHE and member states face a number of important challenges and opportunities in the coming months. All member states need to demonstrate political commitment and work together to reach consensus on a PABS annex that has the practical impact and delivers on equity. This is central to the entry into force and effectiveness of the WHO pandemic agreement. MICTA appreciates the IOAC's call for a decisive breakthrough at the 7th IGWG meeting in July. The first meeting of the new States Parties Committee for Implementation of the IHRs in September is a key step for member states to strengthen national leadership for IHR implementation, foster whole-of-society approaches and ensure that external support builds on, rather than bypasses, existing national capacities and systems. We should reaffirm at the highest level our commitment to pandemic prevention, preparedness and response with a concise, action-oriented political declaration from the UN high-level meeting in New York in September. And we must engage in the comprehensive 10-year review of WHO's work in emergencies to ensure a sustainable vision for the future, enabling, supporting and catalysing national action. This includes ensuring WHO can more effectively leverage the full extent of its partners' capacities and resources, while establishing clearer expectations and stronger accountability mechanisms to ensure delivery on commitments. MICTA takes this opportunity to express our support for the IOAC's recommendations and renew our commitment to solidarity, cooperation and multilateral governance for a world equipped to respond to current and emerging public health threats. Thank you.
Thank you, Australia. I now give the floor to Cuba, followed by Thailand. The delegate from Cuba, you have the floor.
Thank you. Señor Presidente.
Thank you, Chair. Cuba, as a signatory to the IHR of 2005, continues its systematic implementation, and we take all measures to enrich its implementation and to continue to ensure it's sustainable. In fulfillment of what was set out in the IHR, we have 24 entry points defined internationally, all of them covered by personnel, and they're equipped accordingly. As set out with respect to the coordination with the central government authorities to strengthen our action plans, we involve all agencies and make sure that they can sustainably operate. We have clearly defined all the protocols at the border points with different levels of healthcare, hospitals, and primary healthcare institutions. In addition, our National Coordination Center is using IHR to drive its monitoring and surveillance activities, and we are gradually incorporating this in our sectoral work, and we provide reports to PAHO and the WHO, and we always submit regular reports. We also have digital reports, and the system is continuing to be developed to trace all travelers entering the country. Thank you.
The floor is given to Thailand, followed by Chile.
Thank you, Chair. Thailand appreciates the IOAC and IHR implementation reports, while recognizing the growing demands on the WHO Health Emergency Program amid an unprecedented financial crisis. A strong, well-coordinated, and fit-for-purpose WHO is essential to address increasingly complex emergencies. Thailand's IHR core capacity scores has improved steadily since 2017, reflecting continued national investment in preparedness, surveillance, laboratory system, and emergency response capacities, as well as illustrating how overarching JEE process is for enhancing the national capacities. Thailand highlights three priorities. First, Thailand recognizes the importance of strengthened governance and accountability of the WHE program and emphasizes that clear role, responsibilities, and reporting lines across all levels are crucial. Second, critical capacities must be safeguarded, especially at the country level, with equitable access to vaccine, therapeutics, and diagnostics. Thailand emphasizes the importance of integrated surveillance, decentralized laboratories, community-based approaches, and sustainable financing. We encourage all member states to strengthen governance and invest sustainably in critical health emergency capacities. Last but not least, Thailand reaffirms our strong and unwavering commitment to join hands with WHO and all member states to strengthen IHR implementation and JEE. We are looking forward to JEE 2027 to further strengthen national and global preparedness. Thank you, Chair.
Thank you, Thailand. I now give the floor to Chile, followed by Panama.
Thank you very much, Chair. Chile is grateful for the report of the IOAC, and we recognize the value of having a technical body that is independent and permanent that can help build transparency and accountability and ongoing improvement of health surveillance by the WHO. We take note of the report, and we would encourage the Secretariat to continue its implementation of the recommendations of the committee with a special focus on institutional efficiency, transparency, operational coordination, and direct support to member states. We particularly welcome the independent oversight that enables us to identify gaps and to guide our priority setting and to ensure that recommendations result in tangible improvements. And greater early warning capacity, integrated surveillance, intersectoral coordination, and risk communication, and timely and equitable access to medicines. Likewise, we believe it is vital that this work is coordinated with the implementation of the IHR and more specifically its recent amendments, and with all the progress made towards the new international architecture for preparedness and response to pandemics. This being the case, we would reiterate the importance of continuing to work towards adopting and negotiating PABs. Likewise, regarding the international health regulations, as far as Chile is concerned, not only is it an obligation to implement them, but it is an essential condition for the protection of our people and to build confidence between member states and ensure that we can improve global public health. We continue to reaffirm the importance of maintaining the focus on equity, and here the preparation and response to emergencies is key. We are very grateful for this work, sir, and the work that we have from the IOAC and this committee. Thank you.
I thank Chile, and now give the floor to Panama, followed by Togo.
Gracias, señor presidente.
Thank you, President. Panama is grateful for the presentation of the report on the implementation of the International Health Regulations and the report of the IOAC for the World WHO Health Emergency Program, and we highlight its key role in global public health. We welcome the progress made, especially when it comes to strengthening coordination centers and communication of events and the growing capacity for early detection. Recent experience has shown that robust coordination and between agencies and support will help us better respond to outbreaks, and this is key to ensuring timely responses. We know that there are still challenges to the sustainable implementation of the IHR, especially when it comes to laboratory surveillance and multisectoral coordination. There are three key pillars: strengthening national surveillance and early warning capacity, further implement the amendments to the IHR, including concepts such as pandemic and equitable access and digital measures. Multisectoral coordination is the third pillar. We are improving our institutional coordination, and we support initiatives to strengthen this dimension. It's important that we have sustainable financing, and we must have greater international cooperation to support developing countries in delivering on their commitments. This will help us to consistently and coherently move forward in our implementation and coordinate with other international undertakings. So this all preparedness and resilience efforts must be aligned with the IHR. Thank you.
I thank Panama, and I now give the floor to Togo, followed by Qatar.
Thank you, Chair. Togo aligns itself with the statement made by Tanzania. Microphone, please.
Please push the button again.
Merci, Monsieur le Président.
No.
You may have the floor.
Merci, Monsieur.
Thank you, Chair. Togo aligns itself with a statement made by Tanzania on behalf of the 47 member states of the Africa region of WHO. Togo has updated and launched in 2025 the implementation of its National Action Plan for Health Security 2025-2027, and which was developed after joint consultations with a view to capacity building and achieving the minimum capacity necessary for IHR actions. Togo regularly submits itself for annual self-evaluation and for monitoring and follow-up of our health actions, and also prepares reports explaining which areas we could improve our capacity and improve our preparedness, responses, and resilience building when it comes to health emergencies. Togo supports the recommendations to strengthen transparency and participation of stakeholders, especially those from the private sector, in accordance with the principles of prevention of conflicts of interest. When it comes to the mechanisms and the member states, in order to improve, we are engaged in more participation between the mechanism and the member states with a view to improving our actions on the ground. We would also prefer to have predictable funding so that the mechanism can achieve the goals that have been set for it. Togo takes note of the report, and we thank you very much, Mr. Chair.
I thank Togo, and now give the floor to Qatar, followed by France.
سيد الرئيس، السلام عليكم ورحمة الله.
Thank you very much, Chair. Good morning, everyone. We support the statement made by Tunisia. On behalf of the Emir region, we would like to express our appreciation to WHO for its efforts to respond to health emergencies. The WHO Health Emergency Program is an essential pillar in the global health system, and it plays a pivotal role when it comes to aiding states and supporting WHO in its ability to address global health crises. We are seeing a change in the global health landscape, and we'd like to express our support to WHO in its efforts to improve preparedness at the regional, national, international levels. We call on a strengthening of efforts to strengthen the international health system and make sure that it is able to address health emergencies. It is therefore we are committed to this work, and we hope that we will be able to engage in capacity building in regards to the IHR. We have carried out a joint external evaluation with the Ministry of Health, and our country has also prepared a national action plan for health security. This is a very important framework which will help us to strengthen our ability to address health emergencies, as well as, and our commitment to this work is an essential element when it comes to handling these emergencies and ensuring health security and safety, following the elaboration of a vision that would enable us to address future emergencies. We are committed to working together in order to ensure that there is health security for all. Thank you.
Thank you, Qatar. I now give the floor to France, followed by Central African Republic.
Thank you very much, Chair. WHO's rapid response to the hantavirus and Ebola epidemics are laudable. WHO should remain a primary actor in the coordination and management of health emergencies. These situations confirm once again that how important it is to have fully operational multilateral systems in order to manage health crises, especially the IHR, for example. And we very much hope that soon we will have a pandemic agreement and the PABS annex as well soon. Moreover, the management of these situations invites us to reflect collectively on the global health emergency management architecture. The committee, which was created after the COVID-19 pandemic, responds to recent needs to strengthen the ability of member states to consolidate their action programs and work together with WHO. We very much hope that this remains relevant and operational. It is of paramount importance that information is shared between the Secretariat and the member states, and that this group is renewed, and we very much thank the Secretariat for providing information to that effect. We will not forget the lessons learned from previous crises. We are seeing a multiplication of health crises, and this is weakening our ability to predict, coordinate, and respond effectively to crises. Thank you.
Thank you, France. And now give the floor to Central African Republic, followed by Norway. Please, the delegate from Central African Republic, push the button again.
Thank you, Chair. The Central African Republic fully aligns itself with the statement made by Tanzania. On behalf of the 47 member states of the region, the CAR would like to thank the Director General for his report on the application of the IHR dating to 2005 and takes note of the recommendations regarding Mpox and COVID-19. The CAR reiterates its commitment to the IHR, which is an important pillar of global health security. We also commend the entry into force of the 2025 amendments, especially when it comes to equitable sharing of health products and digital recognition. These are of great importance when it comes to states that have limited resources. Our country is a continental state with 6 bordering countries, and the risk of the import of diseases is very high, and that is why we commit to engaging in the strengthening of the IHR and capacity building. We also think it is important to share information on entry points of certain threats, and we would also like to highlight that it's important to update the requirements for IHR. Regarding COVID-19, we support the efforts to integrate additional aspects into our systems. We have also launched new vaccination campaigns, and our campaigns are engaging in capacity buildings. We are also training new personnel. We call on WHO to continue to support states in post-pandemic evaluations, as well as the consolidation of their achievements. With regard to Mpox, this disease has been included in our mandatory monitoring system, and we have strengthened that monitoring system. We emphasize the importance of showing international solidarity, especially when it comes to technology transfer and equitable access to health products, especially for countries with limited resources. No country is safe unless all countries are safe. The Central African Republic reiterates its commitment to contributing actively to the strengthening of global health security in a spirit of shared responsibility and cooperation. I thank you.
Thank you, Central African Republic. I now give the floor to Norway, followed by Philippines.
Thank you, Chair. Norway would like to thank the Secretariat and the Independent Oversight and Advisory Committee for their reports. In our intervention, we will focus on the international health regulation implementation and the efforts that are being made globally to strengthen core capacities through that framework. We commend all of those involved in the ongoing response to the Andes virus outbreak and the Ebola outbreak in the DRC, as well as in all of the other public health events across the world, for their tireless efforts. IHR is at the core of the response to both these outbreaks. In response to the Secretariat's question, we would like to offer the following input. While we work towards completing the pandemic agreement, including the PABS Annex, we cannot lose sight of the critical role that IHR plays in member states' capacity to prepare for and respond to public health emergencies at national level. We also want to see progress in advancing new elements of the revised IHR, such as the IHR Implementation Committee and coordinating financial mechanism, for which the Secretariat plays a central role. I thank you.
Thank you, Norway. I now give the floor to Philippines, followed by Indonesia.
The Philippines notes with appreciation the reports. Ongoing health events demonstrate our shared vulnerabilities, underscoring the absolute necessity of the IHR and a sustainable health emergencies program. Pathogens know no borders, demanding robust collaboration focused on human welfare beyond case counts. To sustainably implement the IHR, states parties must ensure health systems are resilient enough to adapt to evolving risks. The Philippines emphasizes 2 key areas. First, all states parties should consider standing recommendations on Mpox and COVID-19, leveraging hard-won lessons for preparing, preventing, and responding to threats. Second, for states parties where the 2022 amendments are pending domestic procedures, like the Philippines, we must still actively prepare our systems. We must improve IHR implementation and emergency readiness by developing clear roadmaps, policies, and multi-sectoral national action plans for health security. Furthermore, high-level political commitment is essential, as sustainable implementation cannot be achieved by health ministries in isolation. We urge the Secretariat to package impactful advocacy materials showing global leaders exactly how these multilateral frameworks protect everyday lives. This, we hope, will result in consistent support to guarantee global emergency readiness, ensuring timely and effective responses characterized not merely by speed, but by profound equity, seamless multi-sectoral coordination, and predictable resourcing. Thank you, Chair.
Thank you, Filipinas. I now give the floor to Indonesia, followed by India.
Thank you, Chair. At the outset, Indonesia aligns itself to the statement delivered by Australia on behalf of MICTA. Indonesia further thanks the Independent Oversight and Advisory Committee for its report.
I'm sorry, the delegate from Indonesia, could you please speak up?
Thank you, Chair. At the outset, Indonesia aligns itself to the statement delivered by Australia on behalf of MICTA. Indonesia further thanks the Independent Oversight and Advisory Committee for its report and welcomes progress on IHR implementation. However, increasing health emergencies due to geopolitical situations and environmental crises, among others, created new challenges that undermine global health security and demand stronger collective action. Hence, Indonesia believes preparedness must be embedded within broader health system strengthening instead of a standalone agenda. Primary health care, workforce development, surveillance, laboratory systems, digital health, and One Health approaches are all essential foundations. Nationally, Indonesia continues advancing its health security architecture through the National Action Plan for Health Security, underpinned by Health Law Number 17/2023. Key achievements include our integrated surveillance platform Satu Sehat, strengthened laboratory networks, rapid response team, and public health emergency operation centers, alongside simulation exercises, multi-sectoral coordination, and enhanced points of entry capacities. Indonesia also reiterates the urgency of concluding PAP's annex negotiation under the IGWIC process in a balanced and enforceable manner. Benefit sharing must go beyond access to final products to encompass R&D, technology transfer, and sustainable manufacturing capacity, particularly for the Global South. We encourage WHO to sustain and expand technical assistance to member states through joint external evaluations, capacity building, and cross-border coordination, while ensuring sustainable and equitable financing mechanism that leaves no one behind. Indonesia remains committed to working with WHO and all member states to build a stronger, more equitable, and more resilient global health emergency architecture in a fastly changing global landscape. Thank you, Chair.
Thank you, Indonesia. The floor is now given to India, followed by Bahamas.
India appreciates the comprehensive and transparent report of the Independent Oversight and Advisory Committee on the WHO Health Emergencies Program. The growing frequency, scale, and complexity of the health emergencies driven by climate change, conflicts, humanitarian crisis, and fragile health systems continue to pose significant challenges to global health security. While WHO has demonstrated commendable leadership in responding to these emergencies, persistent gaps in preparedness, sustainable financing, and coordinated response capacities warrant continued global attention and collective action. Chair, India reaffirms its strong commitment to the effective implementation of the international health regulations as a cornerstone of global health security and of pandemic preparedness, prevention, and response. India continues to strengthen core capacities under Annex 1 of the amended IHR through the dedicated disease surveillance program, laboratory strengthening through the nationwide laboratory network like the Virus Research Diagnostic Laboratory Network, and targeted workforce development initiatives. Particular emphasis has been placed on strengthening health emergency management systems, points of entry and border health capacities, preparedness for radiation, nuclear, and chemical emergencies, and infection prevention and control practices, supported through dedicated financial and technical investments. India is aligning its national systems with the 2024 amendments to the IHR, including measures towards implementation of its amendments. India reiterates its commitment to strengthen international cooperation for the effective prevention, preparedness for timely detection, and response to public health emergencies through IHR. Thank you.
Thank you, India. I now give the floor to Bahamas, followed by United Kingdom of Great Britain and Northern Ireland.
Chair, the Bahamas commends WHO's continued leadership in strengthening global health security under the IHR and aligns with concerns and recommendations of the IAOC regarding the future of the WHE program, We note the report and affirm that sustainable implementation of the IHR requires practical, financed, and country-owned implementation, particularly for SIDS. Chair, the realities of SIDS must clearly be brought to focus. The Bahamas is an archipelagic state with multiple points of entry, high exposure to climate shocks, limited human resources, and competing fiscal demands. A single severe weather or public health event can redirect natural resources towards response and recovery, while the obligation to maintain surveillance, lab, risk communication, emergency coordination, and border health remains constant. Our position before this Assembly is therefore clear. Member states can sustainably implement the IHR only when national commitment is matched by predictable, financed, technical support and implementation tools that reflect vulnerability and not GDP alone. The Bahamas therefore calls on the Secretariat to support SIDS in 3 ways. First, by helping country translate SPAR into other assessments, and other assessments into costed investment-ready national action plans for health security. Second, by extending technical support for simulation exercise that tests real-time communication and cross-sectorial information sharing and operational readiness. And third, to provide targeted national-level training on the 2024 amendments to the IHR. While the WHO seeks to mitigate persistent shortfall in sustainable emergency financing, it must also advocate for vulnerability-based access to financing mechanisms, particularly for SIDS. For the Bahamas, stronger and more accessible global financing mechanisms are essential to sustaining emergency preparedness, response, and recovery in the face of compounding health and climate shocks. We are the gatekeepers of our national and global health security, and equities equal this function and exact the price we all pay, especially the vulnerable. Thank you.
Thank you, Bahamas. The floor is now given to United Kingdom, followed by Malaysia.
Thank you. The UK welcomes both reports. We welcome the Independent Oversight and Advisory Committee report. The IOC plays a critical role in providing independent oversight of WHO's emergency programme. The UK also welcomes the report on the implementation of the international health regulations and the continued focus on strengthening member state capacity to detect, respond to, and report global health threats. We confirm the UK's support for the 2024 IHR amendments. And we welcome WHO's guidance on the implementation and designation of the national IHR authorities, which the UK has established. We also support the appointment of the IHR roster of experts. We ask WHO to continue providing practical guidance on IHR implementation and to convene member states to share lessons learned and support a more coordinated and unified approach. We request further detail on the establishment of the States Parties Committee for the implementation of the IHR and the coordinating financial mechanism, both agreed under the 2024 amendments. The States Parties Committee is important for promoting and supporting learning, exchange of best practice and cooperation among States parties for effective implementation of the IHR. Meanwhile, the CFM will play an important role in promoting coherence and coordination between organisations and parties investing and accessing funding in PPR. The first meeting of the committee is due to take place in September of this year, and we seek clarity from the Secretariat on what the next steps will be towards operationalising this committee and agreeing the terms of reference for the committee and the CFM. It's critical that we provide enough time to get this right. We look forward to engaging with WHO Secretariat and Member States in taking forward next steps for implementation of these IHR amendments. Thank you.
Thank you, United Kingdom. Now the floor is given to Malaysia, followed by Mexico.
Thank you, Chair. Malaysia appreciates the Director General's report on the implementation of the International Health Regulation 2005, and we recognize that the entry into force of the 2024 amendments to the IHR marks an important milestone in strengthening global health security architecture. Strengthening and sustaining core capacities at national and subnational levels must remain a priority, particularly in surveillance, laboratory systems, risk communication, workforce development, emergency coordination, and points of entry preparedness. Malaysia emphasized the importance of integrated and collaborative surveillance systems. Lessons learned from COVID-19 and Mpox have demonstrated the importance of timely detection, genomic surveillance, event-based surveillance, and rapid information sharing. Sustainable implementation of the IHR requires continued investment in workforce capacity, simulation exercises, and operational readiness. Malaysia also supports efforts to strengthen public health emergency preparedness at points of entry, including ship sanitation, inspection capacities, public health contingencies planning, and cross-border coordination mechanisms. Malaysia has continued to strengthen multi-sectoral collaboration through One Health approach, and we continue to strengthen preparedness and response capacities at international points of entry through enhanced surveillance, ship sanitation activities, contingency planning, interagency coordination, and capacity building initiatives for port health personnel. Malaysia also recognized that sustainable implementation of the IHR requires continued technical and operational support from WHO, particularly on the following areas: technical guidance and support for implementation of the IHR amendments, strengthening genomic surveillance and interoperable digital surveillance systems, capacity building for workforce development, simulation exercises, and emergency preparedness. Malaysia reaffirms our commitment to the effective implementation of the IHR and to continued collaboration with WHO and member states in strengthening global health security for all. Thank you, Chair.
I thank Malaysia. Now I give the floor to Mexico, followed by China.
Thank you. Mexico aligns itself with a statement delivered by Australia on behalf of MICTA. We share the committee's concern over the financial pressures that are threatening the capacities of the WHO's Health Emergencies Program. Reducing them would be repeating historical mistakes that we have already paid for with human lives, and we're calling for flexible, sustainable, and predictable financing. In Mexico, we have been strengthening our national public health emergency system with multisectoral coordination, epidemiological surveillance, and communication of risks using a humanitarian and human rights-centered approach. We have been implementing a safe hospitals program and have national plans in place to deal with various threats. We also have an annual SPAR exercise among institutions to reflect the real state of our basic capacities. Given the resurgence of Mpox, we started a vaccine program with HIV persons as our main target. However, there must be mechanisms that guarantee the equitable distribution of vaccines, especially in middle and low-income countries. We reiterate that travel-related measures must be proportional and evidence-based, and we must avoid unnecessary interference with international trade. As per the IHR, we underscore that global health security requires a One Health approach, effective technical cooperation, and international solidarity. Our people's health must be at the center of all our global decisions. Thank you.
Thank you, Mexico. I now give the floor to China, followed by Colombia.
Chair, China commends the positive efforts of the IOAC for Health Emergency Program in conducting its oversight duties and offering recommendations. We also fully recognize the achievements by the WHO Secretariat in advancing the implementation of the IHR 2005, coordinating the implementation of the amendments to the regulations by state parties, improving information sharing mechanisms, and supporting capacity building. The current global situation in preventing and controlling public health emergencies remains critical. China will continue to support the WHO in playing a central and leading role, actively participate in negotiations on the annex to the pandemic agreement, and contribute to improving global health governance. China supports the WHO in fully incorporating the IOAC's recommendations to optimize the framework of the program, consolidate resources, focus on core functions, and strengthen emergency funding and rapid response capabilities. We support the long-term recommendations on COVID-19 and Mpox and call on states parties to effectively fulfill their obligations under the IHR and the amendments and to strengthen core public health capacity building. Meanwhile, we hope the Secretariat will expedite the implementation of the amendments, update the SPA self-assessment e-tools, and provide comprehensive technical advice to alleviate the burden, and prepare for the first meeting of the State Parties Committee for the implementation as soon as possible, clarify working procedures, strengthen coordination with the Conference of the Parties to the Pandemic Treaty, and avoid duplication of efforts and respond efficiently to global health challenges. China is willing to work with all member states to uphold global health security for all. Thank you.
Thank you, China. Now the floor is given to Colombia, followed by Japan.
Gracias, señor presidente.
Thank you, Chair. We reaffirm the importance of strengthening the WHO, HE, and the effective implementation of the IHR in a global context with more and more complex health challenges that are interconnected. The reports before us today shows that we need to build sustainable capacities to prevent, prepare, and detect early and respond to health emergencies. There are still major challenges to strengthen these capacities, especially when it comes to surveillance, laboratories, human resources, as well as coordination response mechanisms. This being the case, Colombia is of the view that the WHO's leadership is still vital, especially when it comes to the regulatory function of the WHO and establishing science-based standards. Preparation for emergencies should not be understood only as a crisis response, but rather an ongoing investment geared towards building national essential health systems that are resilient. We believe it's timely that we move towards more sustainable approaches on implementing the IHR that are geared not only towards assessing capacities, but strengthening them on an ongoing basis. We also believe it's useful to identify a set of critical priority capacities that will enable member states to develop more integrated and sustainable responses. In line with this approach, we continue to strengthen our essential capacities set out in the IHR by strengthening our public health surveillance, laboratory capacities, and genomic surveillance, as well as coordination among national and territorial agencies to strengthen early detection and timely response. We reaffirm our commitment to a strong, technically robust, and sustainable WHO. Thank you.
Thank you, Colombia. I now give the floor to Japan, followed by Germany.
Thank you, Chair. Japan welcomes the IOAC report on the WHO Health Emergency Programs and values its guidance, emphasizing that WHO must maintain its core leadership and coordination role despite financing constraints. As organizational restructuring proceeds, Japan stressing strengthening country and regional capacity to achieve health for all, including enhancing prevention, preparedness, and response for future pandemics, and reinforcing national health systems and regional functions. Under limited resources, governance and oversight mechanism must become more effective, avoiding duplication and fragmentation. Japan underscored the need for build on existing frameworks, including IOAC and IHR, while ensuring WHO focuses on comparative advantage in infectious disease outbreak. In humanitarian settings, WHO should lead coordination while operational roles are instructed to relevant partners. Japan highlights the importance of ensuring complementarity and continuity among the governance frameworks, with transparent reviews and clear communication for member states to maintain accountability and oversight. In this context, it also respects the 10 years review of the WHO program to produce concrete recommendations on governance and oversight. For effective emergency response, predictable and flexible financing, skilled workforce retention, strong security management, and duty care of the field staff are essential. downsizing must not repeat past weakness, and both member states and the Secretariat shares responsibility. Regarding IHL, Japan welcomes implementation progress and the 2024 amendments, emphasizing that IHR should function continuously, requiring strong core capacity and coordination in both routine and emergency contexts. Thank you.
Thank you, Japan. The floor is now given to Germany, followed by Spain.
Thank you, Chair. The WHO's emergency program is one of the heart chambers of WHO and a cornerstone of WHO's core mandate. Within it, the implementation of the IHR constitutes one of the most important aspects of WHO's work and should continue to be a central priority to WHO, which requires adequate funding from assessed contributions. We commend WHO's work in evaluating gaps and supporting the implementation of IHR core capacities. This international legal framework is a cornerstone of public health. But we are concerned that the emergency program continues to be chronically underfunded. The funds currently available do not cover the total anticipated costs. How can WHO fulfill its core work of responding to health emergencies with severe funding shortfalls? Can the emergency program fulfill the role of convening and coordinating the diverse actors in the global health security landscape if these areas are insufficiently funded? We need clarity on these questions, especially in light of the ongoing reform discussion on the global health emergency landscape. We expect WHO to use its resources to deliver on its core mandate in health emergencies in the ongoing WHO reform process. And we call on Member States to join us in helping the emergency program fulfill its mandate and making the program fit for purpose in a new global health ecosystem. Thank you.
I thank Germany. Now the floor is given to Spain, followed by Ireland.
Señor Presidente.
Thank you very much, Chair, distinguished colleagues here in attendance today. We're grateful for the presentation of the report of the IOAC for the World Health Organization's health emergency program, and we wish to recognize the work of the organization in strengthening preparedness and response to health emergencies. We strongly support the activities of the WHE, and we endorse its central role in the prevention, preparation, and response to health emergencies. We also underscore the importance of strengthening the operational mechanisms of the program to ensure it is effective, coordinated, and sustainable, both in the post-COVID-19 context and in response to future health crises. Spain also endorses the consolidation of the technical and operational capacities of the WHO, as well as the strengthening of international cooperation, predictable and sustainable financing, and the effective fulfillment of the IHR by adapting these priorities to the epidemiological situation and needs of member states. We would also like to leverage what we saw recently in the management of the hantavirus outbreak in Tenerife. This experience has made it clear that Spain's commitment to the pandemic treatment and the IHR is not only one in words, but one that translates into tangible, coordinated, and effective action. The rapid response, cooperation between agencies, and the joint work with international partners reflects the importance of the efforts over the years to have an ambitious and operational agreement. After this episode, the new international public, the fake declared in DRC and neighboring countries because of Ebola may become more serious, and it merely highlights the importance of these legal instruments and to supplement them as soon as possible with a PABS annex. In this connection, we believe it's also vital that negotiations on the PABS will be successfully completed and strengthen our solidarity. Thank you.
Thank you, Spain. Now the floor is given to Ireland, followed by Haiti.
Chair, Director General, distinguished colleagues,
Ireland thanks the Director-General for the reports of the IOAC and on the implementation of the IHR and takes note of the extension of the standing recommendations for MPOX and COVID-19. Ireland reaffirms our commitment to the principles and obligations of the IHR, recognising their essential role in strengthening global health security, promoting transparency and cooperation, and supporting timely coordinated response to the international spread of disease. Ireland recognises the importance of regular self-assessment to ensure effective national prevention, preparedness and response capacities and capabilities. We were pleased to participate in the JADE exercise to test IHR communications, and we conducted our first all-hazard health threats risk assessment this year, supported by WHO Europe. This provided an invaluable opportunity to guide our future efforts to strengthen preparedness and response capacities in Ireland, and we are grateful to colleagues in WHO Europe for their expertise. The recent cluster of hantavirus infections and the Ebola spike announced on Sunday shows us that the IHR is an important tool to coordinate efforts and assist Member States in containing and responding to any such disease. We look forward to the operationalisation of the coordinating financial mechanism through the work of the Intergovernmental Working Group on the PABS Annex and also the first meeting of the IHR Implementation Committee in September. In conclusion, Ireland reaffirms its commitment to collaborate with Member States to ensure the effective implementation of the IHR in the interest of global public health. Thank you.
Thank you, Ireland. Now the floor is given to Haiti, followed by Singapore.
Monsieur le Président, Chairman, ladies and gentlemen, colleagues, we thank the IOAC for its report that highlights the major challenges to global health security. As far as Haiti is concerned, this is a daily reality. Haiti is facing unprecedented crises. It's a time characterized by insecurity, population displacement, recurrent and natural disasters. This reality recalls an essential fact. Responding to emergencies and the implementation of the IHR cannot be dissociated from the sustainable strengthening of health systems. Therefore, Haiti calls for three priorities: build national preparedness and surveillance capacity, ensure the continuity of essential health services during crises, and to ensure that there is predictable and sustainable financing for fragile countries. In countries such as ours, resilience is built not through parallel responses, but through investment in international institutions and country leadership. That is, furthermore, global health security is contingent on the most vulnerable countries' capacities to remain on their feet in times of crisis. Thank you.
Thank you, Haiti. The floor is now given to Singapore, followed by Madagascar.
Thank you, Chair. Singapore commends WHO for the continued efforts to support Member States in implementing the IHR and designating the national IHR authorities, following the entry into force of the 2024 amendments. As fragmented local action remains a key vulnerability, the designation of national IHR authorities is a significant step towards strengthening domestic coordination and ensuring sustained implementation of the IHR through concrete national systems. To strengthen regional and global cooperation, we are encouraged by ongoing efforts to strengthen national IHR focal point communications, information sharing, and operational readiness through training, simulation exercises, and technical support. Such initiatives are important in helping Member States build stronger coordination mechanisms and respond more effectively to increasingly complex public health threats. The recent hantavirus outbreak demonstrated the continued relevance and effectiveness of the IHR framework. Rapid information sharing across jurisdictions enabled swift contact tracing, timely implementation of public health measures, and coordinated response efforts. This is precisely what the IHR was designed to facilitate. Singapore urges Member States to fully utilize existing monitoring and evaluation tools such as SPA and JEE to build and strengthen national core capacities. We also encourage WHO to ensure these tools continue to evolve in step with the 2024 amendments so that they remain relevant and fit for purpose for effective and sustainable IHR implementation. Singapore remains committed to supporting the IHR, including through capacity building partnerships in our region. Thank you.
Thank you, Singapore. I now give the floor to Madagascar, followed by Angola.
Merci, Monsieur.
Thank you, Chair. For giving us the floor, Madagascar aligns itself with a statement made by Tanzania on behalf of the 47 member states of the WHO Africa region. Madagascar would also like to commend the IOAC for their report on the management of health emergencies and shares the concerns expressed when it comes to the international context, which is experiencing a weakening of the health system, multiplication of crises, and funding restraints for preparedness and response. When it comes to the global context, Madagascar recognizes that health emergencies are structurally integrated into the global landscape, and this requires sustained international coordination and management of the climate change and conflicts which impact countries with limited resources such as Madagascar, which are facing a number of threats. For example, the Mpox epidemic, zoonotic disasters, natural disasters which are recurrent and are impacting our health system. Madagascar fully aligns itself with the position voiced by the IOAC. Preparedness and response to emergencies are the sovereign responsibility of states, and it is in this spirit that Madagascar carried out its joint external evaluation in November 2025 and commits to updating its national health safety action plan and integrating it into its own national systems. It commits also to mobilizing the relevant sectors. Regarding the pandemic agreement, Madagascar commends its adoption in 2025. This is a historic achievement in multilateralism. We call for the rapid conclusion of work on the PABS Annex. Madagascar reiterates its commitment to strengthening national international health safety and security and calls for strengthening of technical partnerships, coordination, and sustainable financing in an increasingly fragile world. International solidarity is not an option, it is a need. Thank you.
Thank you, Madagascar. Now I would like to give the floor to Angola, followed by Algeria.
Thank you, Mr. President. The Republic of Angola thanks the World Health Organization for the presentation of the report on the implementation of the international health regulations and recognizes its fundamental role in strengthening global health security. Angola reaffirms its commitment to IHR, including the progressive implementation of the 2024 amendments as a basis for the prevention, early detection, and effective response to public health emergencies. Mr. President, the implementation of the IHR is a national priority. With the establishment and equipping of the Public Health Emergency Operations Center in January 2026, the country strengthened its capacity for real-time case detection and notification, as well as for conducting integrated epidemiological investigations aligned with the multi-sectoral One Health approach. The country has also invested significantly in strengthening the national laboratory network with a focus on laboratory diagnostic capacity, quality, and biosafety. Investments have also been made in entomological laboratory research. At points of entry, we have improved health preparedness at ports, airports, land borders, and river borders through the development of contingency plans and strengthened multi-sectoral coordination. We further underline the importance of sustainable financing and international solidarity to enable the full and equitable implementation of the IHR 2005. We take good note of the report represented and reaffirm our commitment to continue working with the WHO and member states towards a stronger, more cohesive and dynamic global health security framework capable of adapting to evolving epidemiological changes. We thank you very much.
Thank you, Angola. Now I give the floor to Algeria, followed by Republic of Korea.
Merci, Monsieur le Président.
Thank you, Chair. Algeria aligns itself with the statement made by Tanzania on behalf of the Africa Group. And we would like to thank the working group that was handling the amendments with a view to strengthening the capacity of the member states in addressing health emergencies. We would like to commend WHO for the role it played in the coordination of the work on these amendments, which should be applied soon. This agenda item is very important, especially at this time. The member states must commit to a true dialogue on the multifaceted consequences of these crises and should take strong consensus-based decisions in our view. In order to strengthen international solidarity and response to future pandemics, we should improve our management of these crises. The work of these two groups will support international efforts to strengthen global health security. It is of paramount urgency and importance to strengthen our health systems and to reduce inequalities and social gaps and make sure that our societies are sustainable and equitable. My country commits to the voluntary evaluations in order to improve its systems, and we support the initiatives that would contribute to the development of prevention and prevention tactics. Chair, we must understand that solidarity and the activation of funding mechanisms are of great importance in order to overcome these crises. We will establish a special fund to respond to health emergencies. We are calling for a multilateral framework for responses that would respect international law and the sovereignty of each state, and we thank you.
Thank you, Algeria. Now the floor is given to Korea, followed by Sri Lanka.
Thank you, Chair. The recent outbreak of hantavirus and Ebola highlights the importance of building resilient health systems through strengthening core capacities under the IHR. The Republic of Korea believes that strengthened monitoring and assessment are essential for embedding IHR implementation into national systems. In this regard, we actively utilize the joint external evaluation, which serves as a critical tool for identifying concrete measures to strengthen implementation of the IHR and national core capacities. In August 2025, we have completed the second JEE, and we were able to reassess its national capacities in line with the revised IHR framework and further strengthen its preparedness and response systems to effectively address the evolving global health security landscape in the post-pandemic era. Chair, following the entry into force of the amended IHR last September, the Republic of Korea designated the Korea Disease Control and Prevention Agency as the national IHR authority. In close coordination with relevant ministries and agencies, we are regularly monitoring and managing our national implementation of the IHR. At the same time, we recognize that substantial efforts and close cooperation will be required before the amended IHR to be fully operated across countries. In particular, we believe that the Intergovernmental Working Group meeting this September should provide an important opportunity for active discussions on the operation of the IHR Implementation Committee and CFM. The Republic of Korea remains committed to working closely with the international community to support implementation of the IHR and to further strengthen global health security. I thank you.
I thank Republic of Korea and give the floor to Sri Lanka, followed by Oman.
Thank you, Chair. The Independent Oversight and Advisory Committee's report underscores the growing challenges of health emergencies driven by climate change, geopolitical instability, and funding shortfalls. Member states continue to face underfunding, inequitable access, and fragmented systems which weaken preparedness and resilience. Sri Lanka has faced direct impacts, including Cyclone Ditwa in 2025, which caused significant damage to healthcare infrastructure, highlighting the urgent need to integrate climate resilience into health security. Accordingly, Sri Lanka and member countries are undertaking a universal health and preparedness review to elevate health security as a government-wide priority, while also advancing institutional and community-level resilience with the support of the Pandemic Fund. Building reforms such as the progressive establishment of more robust preparedness approaches, we reaffirm that sustained investment, workforce strengthening, and resilient supply chains are critical. We call upon all member states to prioritize emergency preparedness and response as a cross-sectoral agenda, ensuring focused financing that health systems remain resilient and capable of protecting populations in the face of future crises. Thank you.
Thank you, Sri Lanka. I now give the floor to Oman, followed by Uganda.
السيد الرئيس تتقدم سلطنة عمان بخالص الشكر.
Thank you, Chair. We would like to sincerely thank WHO for its consistent efforts to improve preparedness and response to health emergencies, which strengthens global health security as well as the global resilience system. We reiterate the importance of strengthening international governance of health, as well as monitoring mechanisms which will ensure consistency between the international, regional, and local levels. We should also strengthen our response to health and humanitarian crises, which are constant threats to the global system, as well as managing climate change and other cross-border systems. We are committed to strengthening our national system through epidemiological monitoring and capacity building, diagnostics, reference laboratories, monitoring of points of entry, the implementation of emergency plans in the framework of, in the context of global health systems. We also will work on ensuring that we have evidence-based and rapid response systems. We would like to highlight the importance of WHO's support to the member states in strengthening their capacity, the rapid alert systems, epidemiological data exchanges, sustainable financing. All of these factors make the international response more equitable, fairer. We must have tools at our disposal, such as diagnostics and medication. In conclusion, we support the efforts made in preparedness and response with a view to achieving more health systems that are more capable of addressing threats that await us in the future. Thank you, Chair.
Thank you, Oman. I now give the floor to Uganda, followed by Paraguay.
Chairperson, Uganda aligns itself with a statement delivered by the Republic of Tanzania on behalf of the member states of the WHO Afro region. Uganda welcomes the report under the Agenda 13.1 and 13.2 and commends the continued work of WHO Health Emergency Program, the Secretariat and Independent Oversight Advisory Committee in strengthening preparedness, readiness and response. Uganda speaks from lived experience. We continue to face high burden of public health threats, including Ebola, Marburg, smallpox, cholera, climate-related emergency, refugee-related health risks. Uganda is currently managing an Ebola outbreak which occurred under control and is under control, reflecting the value of preparedness, investment, and rapid coordination. This experience reminds us that timely detection, rapid response, access and diagnostics, therapeutics, vaccines, and other health products, and strong coordination are all at all levels remain essential. Over the years, Uganda has invested in integrated disease surveillance, response, and incident management, supported risk communication, community engagement. These systems, supported by WHO and partners, have enabled Uganda to detect, respond to outbreaks more effectively. Uganda has completed its joint external evaluation in 2023 and developed its national Action Response 2028-2029. However, important gaps remain. These include insufficient and unpredictable financing, limited surge capacity, workforce fatigue during prolonged emergencies, gaps in multi-sectoral coordination, and uneven capacity at points of entry. Uganda therefore supports the call for sustainable implementation of international health regulations, including the 2024 amendments, with predictable financing, technical support, and strong country ownership. Finally, Uganda reiterates the importance of equity in emergency preparedness response, including timely technology transfer, local manufacturing capacity, enabling access to medical countermeasures, and urgent finalization of the PUB Annex. I thank you.
Thank you, Uganda. Dear delegates, I have an announcement to make. Given our late start this morning, I propose that we extend our session this morning until 1:30 p.m. I understand we have the agreement of the interpreters to do so. I take it that this proposal is accepted by committee. I see no objections. Thank you. I now give the floor to Paraguay, followed by Chad.
Thank you very much, Chairman. The delegation of Paraguay is grateful for the reports on the implementation of the international health regulations, as well as the extension of the standing recommendations on COVID-19 and Mpox. The experience in the recent past made it clear that it's important to have effective mechanisms for timely detection of public health threats and to coordinate rapid and joint responses. This being the case, Paraguay believes it's vital that we continue to strengthen national capacities as set out in the IHR. In line with this commitment, our Ministry of Public Health and Social Well-being has been promoting initiatives to improve early detection and preparedness for health emergencies using a community and intersectoral approach. This year, we had a strategic workshop on community-based surveillance, and it was geared towards strengthening the identification of health risks and environmental risks by the territories, especially priority regions identified by the country. We also stepped up our initiatives to ensure we are prepared for the high airborne disease season by training our technical teams and laboratories in the Sentinel network, and we also promoted vaccination and preventive measures. We also welcome the approach to integrate monitoring of COVID-19 with other respiratory infections and promoting international cooperation and avoiding unnecessary restrictions on travel and international trade. We will continue to work using our national capacity to prepare for emerging health threats and to provide timely notifications of public health events in coordination with PAHO and other international partners. Thank you.
I thank Paraguay and give the floor to Chad, followed by Fiji.
Monsieur le Président.
Chair, Excellencies, ladies and gentlemen, Chad aligns itself with the statement made by the Republic of Tanzania on behalf of the Afro region. We'd like to thank the Secretariat for the high quality of the report on the IOAC, the WHO, HEP, the management of health emergencies, as well as the application of the 2005 IHR. Chad commends the efforts undertaken by the WHO and the member states to consolidate the capacity to prepare for and respond to humanitarian, health, and climate emergencies, especially through the strengthening of surveillance system, rapid early alert systems, as well as responses. We'd like to recall that since 2023, my country has been experiencing a serious humanitarian crisis with the rapid increase of millions of refugees, as well as injuries as a result of war. This has had a negative impact on healthcare services, which were already weakened by limited human and financial resources, In parallel, the impact of climate change is also being exacerbated. There have been protracted consequences in certain regions of the country which have seriously impacted the quality of life and conditions of the residents, which increases their vulnerability. We remain concerned by the continuing challenges presented by funding constraints, as well as the lack of equitable access to medical products. In this regard, Chad would like to inquire what specific measures are envisaged to strengthen technical assistance to developing countries with a view to ensuring the full implementation of the IHR and a more equitable and rapid response to future health emergencies. Finally, Chad reiterates its commitment to multilateralism, to international solidarity, and to strengthening of resilience of the health system in the interest of global health security. Thank you.
Thank you, Chad. I now give the floor to Fiji, followed by Ghana.
Thank you, Chair. Distinguished delegates, Fiji stands in full support of the amended international health regulation adopted during the 77th World Health Assembly. This amendment serves as a vital instrument of international law to ensure equitable preparedness while firmly respecting national sovereignty. Drawing critical lessons from the COVID-19 pandemic, Fiji is systematically strengthening its national health security infrastructure. Under the IHR monitoring and evaluation framework, we have successfully updated our national focal point communication mechanism, finalized our annual state parties self-assessment annual reporting, and are actively preparing to undergo a joint external evaluation this year in next year in 2027. To operationalize these core capacities, Fiji is deploying US $10.1 million awarded from the Pandemic Fund for the Fiji Health Emergency Inclusive Readiness, FHEIR project. This multi-sectoral initiative embeds a strict One Health approach, advancing digital data integration, expanding community surveillance to climate-sensitive hotspots, and leveraging the pathogen genomics laboratory at the Fiji CDC to anchor priority genomic sequencing for the wider Pacific region. Furthermore, Chair, to secure our borders, we have established a fully pledged, dedicated border health and protection unit in Nadi, adjacent to our international airport, to intercept emerging communicable threats. Chair, operational readiness requires continuous verification, and Fiji has actively tested its system through the annual IHR crystal exercise that ensure real-time, multi-sectoral, and multi-stakeholders coordination. Regionally, the recent active antivirus situation underscores the absolute necessity for IHR framework in securing the timely, transparent, and accurate data sharing required for rapid global containment. Fiji re-emphasized the health security is impossible without global solidarity. We reaffirm Fiji's commitment working with WHO and partners to build a responsive, resilient health system that protects our people. I thank you, Chair.
Thank you, Fiji. I now give the floor to Ghana, followed by Ecuador.
Mr. President, ladies and gentlemen, Ghana aligns itself with a statement delivered by the United Republic of Tanzania on behalf of the 47 member states of the African region under agenda items 13.1 and 13.2. Ghana recognizes the important role of the WHO Health Emergency Program in coordinating responses to disease outbreaks, humanitarian crises, and other public health emergencies. We note the concerns raised regarding increasing global health threats, financial constraints, and the need to preserve core emergency capacities across all levels of the organization. With regards to the implementation of the international health regulations, 2005, Ghana welcomes continued efforts to strengthen national IHR focal points, surveillance systems, laboratory capacities, risk communication, and multi-sectoral coordination. We also note the entry into force of the 2024 amendments to the international health regulations and emphasize the need for sustained technical and financial support to facilitate effective implementation by member states. Ghana further underscores the importance of collaborative surveillance, timely information sharing, joint external evaluations, simulation exercises, and national action plans for health security in strengthening preparedness and resilience against future public health threats. In conclusion, we note the report and support continued efforts to strengthen the WHO Health Emergency Program and the implementation of International Health Regulation 2005 in order to advance global health security, preparedness, equity, and resilience. Thank you.
Thank you, Ghana. And now I give the floor to Ecuador, followed by United Arab Emirates.
Chairman, Ecuador is grateful for the report on the implementation of the international health regulations, and we call for further strengthening of technical and operational capacities of the regulations and for sustainable resources to ensure that there's epidemiological surveillance laboratories and at points of entry. We believe it's vital that we implement the amendments of 2024 and strengthen multi-sectoral coordination. We need ongoing upgrading and updates. We will continue to strengthen our national capacities at all points of entry, and we are doing this through updating our contingency plans and ensuring that there is interinstitutional coordination with aviation, ports, and so on. We have been able through this to improve our response to risks such as measles, avian flu, mpox, and other emerging threats by strengthening our commitment to health security and international cooperation. We endorse the report and fully support the initiatives to strengthen implementation of the IHR. We believe the IHR remains an essential instrument to protect global public health and to promote a coordinated response and solidarity in tackling health emergencies. Thank you.
I thank Ghana. And now give the floor to United Arab Emirates, followed by Gabon.
Thank you, Chair. The UAE reiterates its commitment to the effective implementation of the 2005 IHR, which represent the cornerstone of international security and preparedness for emergencies. Experience has demonstrated that the exchange of data in real time is of paramount importance when it comes to addressing health emergencies of a cross-border nature. We have a number of recommendations regarding the improvement of national focal points for IHR, and this is an example of the need for data exchange via digital channels strengthened by AI and in real time between member states and WHO. This platform will help to streamline data exchanges, technical data exchanges in a more efficient manner, evaluating the situation in real time and analyzing risks while maintaining cooperation with focal points, which improves the efficiency of our work at borders, airports, ports. When we have international crises, this platform strengthens the capacity of states while respecting their sovereignty and also respecting data. This is an important investment in health in order for us to be more able to address health emergencies in the future. Thank you.
Thank you, United Arab Emirates. Now I give the floor to Gabon, followed by Belarus.
Monsieur le Président.
Chairman, Your Excellencies, distinguished delegates, Gabon associates itself fully with the statement delivered by Tanzania on behalf of the 47 member states of the African region of the WHO, and we take note of the report. Given the growing number of regional and global health emergencies, inaction is not an option. It's for this reason that under the guidance of our highest authorities, we have strongly improved our health facilities. Our public health agencies are now under high surveillance, especially since the outbreak of Ebola in the DRC. And this is also an opportunity for Gabon to reaffirm its solidarity with the kindred people of the Democratic Republic of Congo. Chair, national preparation and preparedness must be supported by international solidarity. Gabon shares the strong concerns of the African group at the drop in humanitarian financing and the drop in contingency funding for emergencies. My country insists on the absolute need to find new impetus for international cooperation because no single state can alone save itself and face global threats. We believe that a robust global health system with sustainable financing and with competencies is the only effective way to move forward, and we fully support the contribution of the IHR to this. We therefore call on the international community to work towards ensuring that we successfully conclude negotiation of the annex to the IHR pandemic agreement to ensure that we can implement it. Thank you.
Thank you, Gabon. Now the floor is given to Belarus, followed by Micronesia.
Thank you, Chair. Belarus expresses its appreciation for the report on this agenda item. In a context of global challenges, we have borne witness how quickly diseases spread. They know no borders, and no country can remain in isolation from these threats. Integrating efforts in public health and international IHR will enable us to more effectively react to these situations and ensure the sustainable development for future generations. The national system of healthcare in Belarus has sufficient experience to diagnose and treat communicable diseases and NCDs, as well as we also have effective epidemiological oversight and can react to outbreaks. We have an operational plan for reacting to crises such as hantavirus and Ebola. Considering the active migration of people, we are updating our diagnostic capacities. We understand the need of rapid time information on emergencies. We also pay particular attention to issues of migration and health. We are protecting the vulnerable parts of our population and human rights. Cross-border migration, including in conflict-affected regions, are creating new and complex issues for our health system. Our experience has demonstrated that these vulnerable groups of the population often have issues, including incommunicable diseases. In order to protect these groups of people, our legislation has provided guarantees on a broad spectrum of issues, including the right to accessible medical assistance and social support. Distinguished colleagues, in our work to ensure preparedness and response to emergencies, Belarus is in close cooperation with WHO, UN agencies as well. An important support in this is the AHR, which lay in the foundation of the functioning of our national health system. We appreciate WHO for its support provided in the taking of these decisions. We would like to reiterate that Belarus is committed to constructive participation and cooperation on all strategic issues related to public health, which are of global importance, and we are also committed to ensuring that there is health and well-being for all those who require that support. Thank you.
I thank Belarus. Now I give the floor to Micronesia, followed by Namibia.
Thank you, Chair. The Federated States of Micronesia thanks the Independent Oversight and Advisory Committee for its report and aligns itself with previous statements delivered by other member states and reaffirms its continued commitment to the IHR. Just 1 month ago, Super Typhoon Sinlaku devastated Micronesia, affecting an estimated 34,000 people and exposing the severe vulnerabilities faced by small island developing states. The typhoon caused widespread power and communication outages, damaged homes, health facilities, crops, transportation networks, and disrupted healthcare delivery across our dispersed islands. In some areas, hospitals relied on emergency backup power while access between islands was severely impacted. For Micronesia, disasters affect far more than infrastructure. They disrupt health services, supply chains, food security, clean water access, and essential transportation and communication systems. Climate change continues to intensify these threats through stronger storms, sea level rise, and changing disease patterns. Chair, recovery for small island states is long and costly. This is why Micronesia calls on the international community to continue to strongly support sustained investment in WHO's emergency preparedness and response capacities, including resilient health systems, workforce development, country-level preparedness, and emergency financing mechanisms. Thank you, Chair.
Thank you, Micronesia. I now give the floor to Namibia, followed by Pakistan.
Thank you, Chair. Namibia aligned with the statement delivered by Tanzania on behalf of the African region. We thank the Director General and the Secretariat for continuous support toward the strengthening the implementation of the international health regulation. We recognize the evolving global health landscape characterized by emerging and re-emerging of conditions, climate-related health risks, humanitarian emergencies, antimicrobial resistance, and the increased population mobility. In this regard, effective implementation of the IHR remains critical for strengthening preparedness, prevention, detection, and response to core capacities at all levels. Namibia conducted its second joint external evaluation in October last year, and we are updating our National Action Plan for Health Security to guide the implementation of the identified gaps. We continue to submit the SPA annually to WHO. We welcome the report and they recommend the establishment of the predictable long-term financing mechanism to close persistent gaps in IHR core capacity, with priority on investment in workforce development, point of entry preparedness, promote mechanisms on cross-border collaborations, and the regional coordination to address these transboundary health threats. In closing, we reaffirm our commitment toward the implementation of international health regulations and full support the WHO Health Emergency Program. We encourage member states and partners to continue providing necessary support to the WHO Health Emergency Program to continue strengthening the global health security. And thank you.
Thank you, Namibia. The floor is now given to Pakistan, followed by Burkina Faso.
Thank you, Mr. Chair. Pakistan considers the implementation of international health regulations as a national priority and a cornerstone of global health security. Strengthening IHR core capacities remain critical for achieving universal health coverage under SDG 3 and for building resilient public health systems capable of preventing, detecting, and responding to public health emergencies. Government recognizes health security as an integral component of the broader health systems. Pakistan has conducted 2 successive joint external evaluations with support of WHO, which demonstrates its commitment to transparency and continuous improvement. Post-2023 evaluation, Pakistan has prioritized increased domestic financing for the National Action Plan for Health Security and now focusing upon health emergency management, investment in sustaining multidisciplinary workforce, including surge capacity for IHR implementation with One Health approach. It continues to focus on surveillance and response along with antimicrobial resistance surveillance. And the government of Pakistan acknowledges the importance of global cooperation, including Pandemic Fund, Gavi, and Global Fund, supporting ongoing efforts. We look forward towards implementation of new global instruments like Pandemic Treaty to ensure equity and technology transfer, which will help improve pandemic preparedness and response abilities of low and low-middle income countries. Pakistan calls upon WHO and health security partners to continue their support. It remains committed to implementation of core capacities under IHR by working in close collaboration with the global community to build resilient health systems capable of preventing morbidity and mortality as national law and laws to national and global economy. Thank you, Mr. Chair.
Thank you, Pakistan. I now give the floor to Burkina Faso, followed by Ethiopia.
Merci, Monsieur le Président.
Thank you, Chair. The delegation of Burkina Faso subscribes to the statement delivered by Tanzania on behalf of the African region, and we thank the Secretariat for the documents on the implementation of the International Health Regulations 2005. These documents remind us that global health security is a collective responsibility requiring solidarity, preparedness, and stronger cooperation. Burkina Faso reaffirms its support for the IHR, which is essential to prevent, detect, and effectively respond to public health emergencies. At a time when we have security and humanitarian challenges and complex epidemics, we are actively moving ahead with strengthening our national capacity in line with the IHR. We formalized in 2024 our IHR focal point by law, and we conducted our second JEE, which helped us draft our National Action Plan for Health Security 2025-2029. The initiatives helped us strengthen our One Health approach and to strengthen surveillance based on events, laboratory capacities, training health teams on epidemiology on the ground, as well as surveillance at priority points of entry. We also welcome the extension of the standing recommendations on Mpox and COVID-19, which underlines the need to maintain integrated surveillance systems that are resilient and risk-based. This means that we must insist on the importance of technical and financial support for developing countries to ensure that they can effectively and equitably implement the IHR. Despite these various challenges, I wanted to underscore that continuing implementation of our plan for 2020-2025-2029 and strengthening our human resources means that we would need sustainable strengthening of our multisectoral capacities, and this is in line with the objectives of the IHR. We are committed to working with WHO and all member states to strengthen global health security in a spirit of cooperation, solidarity, and shared responsibility. Thank you.
Thank you, Burkina Faso. And now give the floor to Ethiopia, followed by Russian Federation.
Thank you, Chair. Ethiopia aligns with the regional statement delivered by Tanzania on behalf of the Afro-region member states and thanks the IOSC for the report and recommendations. Ethiopia speaks as a country simultaneously investing in preparedness and managing active emergencies. We have adopted the 717 framework, decentralized our surveillance architecture to subnational levels, established a network of subnational emergency operation centers, enabling rapid pathogen identification within 72 hours, completed multi-hazard risk profilings through joint external evaluations, and are implementing our second National Action Plan for Health Security with a specific focus on subnational capacity. The IOSC is finding that the African region will absorb a 25% workforce reduction in WHO's health emergency program. The highest proportionate cut of any region is deeply alarming. A weakened WHO presence in Africa, precisely when needs are most acute, is a contradiction that member states must urgently address. Ethiopia calls on the Secretariat to safeguard core emergency capacity in the African region and ensure that the single program model and its clear line of authority are fully preserved through this transition. Ethiopia urges rapid conclusion of the pathogen access and benefit sharing annex in the pandemic agreement. The IOSC is right that without it, the agreement cannot become operational. Ethiopia also takes note of the DG's report on the IHR implementation with appreciation. Ethiopia notes with particular concern the African and East Mediterranean region's ongoing Mpox burden and supports the recommended national access on surveillance, diagnostics, genomic sequencing access, and elimination of human-to-human transmission. On sustainable IHR implementation, Ethiopia offers 3 priorities. First, the subnational capacity must become the primary metric of IHR implementation success. Second, the entry into force of the 2024 amendment must be accompanied by targeted technical and financial support. Third, the contingency fund for emergency. The IHR system's operational backstop must be adequately replenished. Its current underfunding noted in the IOC's report directly undermines the timely response that the IHR demands. Thank you.
Thank you, Ethiopia. I now give the floor to Russian Federation.
Thank you very much, Chair. Russia has extensive capacity in responding to outbreaks and infections. In accordance with the updated IHR, the Russian government has approved a national body that is responsible for implementing the IHR, that's Rospotrebnadzor. Russia has been working with other countries and organizations on combating infections since 2014. We have been establishing a unified prevention and response system for outbreaks in the CIS region. Since 2023, we have been providing support to African countries and been working together with them. We are providing to them tests, vaccines, laboratories. We're training personnel. We're working to strengthen the sovereignty of these countries. We should note that Russia's support compared to other donors is not dependent on any requirements. We are just simply engaged in strengthening their responses to epidemics. One of such examples is the provision of medical laboratories, mobile laboratories. Together with WHO, we have developed and published the minimal standards of work for mobile laboratories. Right now, in 20 countries of the world, we have 61 mobile laboratories that have been provided by the Russian Federation with no expectation of any sort of return. We have been working on the elimination of the cholera outbreak, as well as the Marburg virus, as cholera, Marburg, and other diseases. We have been carrying out this work with the support of mobile laboratories. We have also carried out exercises with the participation of over 350 specialists from 26 countries in the world. In this context, we believe that we must more effectively use the potential of our member states, including rapid response teams and mobile laboratories. We support the initiative we voiced earlier to create a register of such laboratories in order to use them in such emergencies. Thank you.
I thank Russian Federation. And now, in conformity with the Rule 47 of the Rules of Procedures of the World Health Assembly concerning the representatives of the United Nations and of other intergovernmental organizations, I would now like to give the floor to International Organization for Migration.
Thank you, Chair, distinguished delegates. In the context of increasing human mobility and complex health security threats, the International Organization for Migration firmly believes that strengthened implementation of the international health regulation can reinforce much-needed cross-border health preparedness and response. In 2025, IOM supported member states in more than 40 countries to strengthen core capacity at point of entries and more systematically integrate human mobility patterns into surveillance, risk assessment, preparedness, planning. Reflecting on the recommendation as noticed in A76/6, IOM stands ready to partner with WHO member states in strengthening practical, sustainable approaches to preparedness and response, in particular at point of entry and through intersectoral action along migratory routes. Thank you.
Thank you. And now I give the floor to International Development Law Organization.
Thank you, Chair. The International Development Law Organization thanks the Secretariat for the report on the implementation of the international health regulations and welcomes Member States' continued attention to strengthening global capacity for prevention, preparedness, and response. The effective implementation of the IHR is not only a technical undertaking, but also a legal and governance challenge. Experience from recent public health emergencies has shown that the existence of clear, coherent, and implementable legal frameworks is essential to enable timely action, coordination across sectors, and compliance with international obligations. IDLO wishes to highlight the importance of legal preparedness as a foundational yet often underemphasized dimension of IHR implementation. Domestic legal frameworks play a critical role in operationalizing core capacity as well as in clarifying institutional roles and responsibilities. We encourage member states and partners to strengthen legal preparedness in support of IHR implementation, including through legal assessments, law reform processes, and capacity building at national and subnational levels. IDLO stands ready to leverage its experience supporting countries in strengthening their legal capacity for the implementation of the IHR.
Thank you. Several non-state actors in official relations with WHO have requested the floor on this agenda item. According to the privileges conferred by the relations with the World Health Organization, I have pleasure in giving the floor to representative of WONCA Association.
The front line of any health emergency is not only at a hospital, it is also at local family practices. Vertical emergency programs will collapse if the horizontal foundation of primary healthcare is weak. To bridge global policy and the local consultation room, the World Organization of Family Doctors calls for investment in primary care as the early warning system, including interoperable digital health systems so family doctors' real-time clinical data triggers national public health alerts. Preparedness of the primary care workforce through training and support in outbreak detection and emergency response. An integration of primary care continuity into emergency frameworks to prevent the secondary wave of unmanaged chronic conditions that follows every crisis. Global health security is only as strong as primary healthcare and only as durable as the trust family doctors hold. May I wish you a happy World Family Doctor Day today. Thank you.
Thank you very much. I now would like to give the floor to Stitching Health Action International. I believe they are not here. Then the floor is given to Medicus Mundi International, Network Health for All.
Don't speak, man. No, but he has to say.
Please, I was informed that Stitching Health Action International is going to give a speech, please. The floor is yours.
Thank you, Chair. The amended AHR constitutes one of the most effective tools at the disposal of the international community to respond to health emergencies. We commend WHO for its coordination and support provided to member states and stakeholders, which has played a role in the avoidance of several potential fake. We insist on the need for transparency in the implementation of AHR. This is essential across the entire response, particularly regarding manufacture, procurement, and donation of health goods, be it for Ebola, hantavirus, or any other lurking threat. IHR entered into force through the political will of 182 member states. The same magnitude of consensus is needed in other pandemic-related dossiers. Thank you.
Thank you. And I'll give the floor to Medicus Mundi International, Network Health for All.
Thank you, Chair. This statement is supported by the People's Health Movement. With the IHR amendments entering into force, we expected renewed energy and more comprehensive implementation reporting. However, the current report is fragmented and incomplete. More information is needed on the following: verification requests not addressed within 24 hours and the reasons for these delays, which core capacities improved in the past year, where international financial flows were directed, and finally, how WHO coordinated laboratories are functioning, including the application of relevant access and benefit sharing laws. Clarification is also needed on extensions of standing recommendations and whether accessibility and availability of vaccines, therapeutics, and diagnostics, as mandated under Article 18, were properly considered. It is concerning that no information was provided on the allocation mechanism alongside extension of the COVID-19 standing recommendations. More broadly, we urge WHO to streamline reporting under Agenda Items 13 and 14 into a single report to better identify gaps in core capacities, response coordination, and shortcomings in accountability. Thank you, Chair.
Thank you. I now give the floor to International Baby Food Action Network.
As a member of the Interagency Infant Feeding in Emergencies Core Group, IPFAN is very concerned about new Codex guidelines that will allow flexibility for labeling, including of baby formulas and foods during emergencies. The onus will be on member states to stop exploitation by those seeking to undermine breastfeeding and expand markets. There is evidence that few member states have effective emergency preparedness plans, so they lack the capacity to recognize deceptive labeling. During COVID, formulas claim to provide immunity. During floods, that they aid recovery. Any deregulation risks the health and survival of displaced families while undermining tracking of contaminated products. While all women have the sovereign right to make infant feeding decisions, complete and accurate labeling is essential, especially in emergency situations. It's time for member states to ensure this. Thank you.
Thank you. And I'll give the floor to International Pharmaceutical Students Federation.
Honorable Chair, distinguished delegates, the International Pharmaceutical Students Federation, representing 600,000 members across more than 100 countries, recognize that sustainable implementation of the international health regulations is essential for global health security. The 2025 report shows progress in early warning, event verification, and core capacity reporting, but also the need for continued investment in surveillance, laboratories, risk communication, and points of entry. IPSF believes pharmacists and pharmacy students can support these efforts by improving access to essential medicines, aiding vaccine delivery and safe dispensing, promoting accurate public health information, and strengthening community trust during emergencies. As WHO advances the 2024 AHR amendments, IPSF calls for equitable preparedness, multi-sectoral collaboration, and youth engagement. Thank you.
Thank you. In accordance with the rules applicable to observers at the World Health Assembly, I have a pleasure to give the floor to the representative of United Nations Population Fund.
Thank you, Chair. Investments in the health and protection of women and girls and young people are investments in the future. During public health emergencies, they face disrupted access to essential maternal and newborn health care, family planning, and adolescent sexual and reproductive health services, alongside the heightened risk of gender-based violence. UNFPA works with governments and partners to strengthen resilient health and protection systems so that women, girls, and young people are not left behind when crisis strikes. This includes integrating the minimum initial service package for SRH into preparedness and response plans, prepositioning essential supplies, equipping midwives to safely deliver life-saving SRH services, and prioritizing GVV prevention and response. Those investments strengthen public health preparedness, resilient communities, and the stability of nations. Thank you.
Thank you. I shall now give the floor to the Secretariat. Dr. Ihor Perhinidis, on behalf of World Health Organization, Regional Director for Europe.
Thank you, Chair. Honorable Ministers, colleagues and friends. I'm honored to deliver this statement on behalf of the Regional Director for Europe. Recent hantavirus cases on the cruise ship and the ongoing Ebola outbreak in DRC and Uganda reminded us once again of the incomparable value of the international health regulations. Let me give you 3 reasons why. First, the IHR is the only global framework for solidarity, coordination, and collective actions. The hantavirus outbreak is a real test, and we commend the outstanding collaboration of the Netherlands and Spain, together with the ECDC, DG ECHO, and DG Santé. RD Euro thanks countries for their commitment to detect public health risks. In 2025, WHO Europe screened more than 224,000 signals, identifying 116 acute events and 70 alerts requiring operational response. And for the first time, all 55 state parties in the European region have submitted their annual IHR report to the WHO. Second, the interregional collaboration is essential. RD's Euro recent mission to Africa show how IHR implementation is evolving in practice. In Brazzaville, we are strengthening surveillance, early warning systems, and response coordination. In DRC, RD Euro saw firsthand how IHR capacities are being operationalized through the advanced laboratory networks and decentralized community-based surveillance for real-time outbreak detection. RD Euro thanks Dr. Janabi for his strong leadership and deep partnership. Third, the IHR can link to climate-related risks. 2 days ago, the Pan-European Commission for Climate and Health launched its call to action, including to demand for WHO to declare climate change a public health emergency of international concern, welcomed by many ministers here. Climate change is not a time-bound epidemic or an acute event, but it is an existential crisis. Waiting for systematic failure before acting would contradict the very preventive purpose of the IHR. The hantavirus situation reminds RD Euro of a Kenyan proverb. A calm sea does not make a sailor skilled. It is a real test in real time. The world needs a strong, trusted, and responsive multilateral system. The value of the IHR, grounded in science, transparency, solidarity, and trust, has never been more apparent. I thank you.
Thank you, Dr. Ihor. I now give the floor to Dr. Stella Chungong on behalf of Executive Director, WHO Health Emergencies Preparedness and Response Program.
Thank you very much, Chair. I'm speaking on behalf of the XD as mentioned. He sends his regrets because he is chairing the DG's strategic roundtable as we speak. So thank you all, Member States, for your interventions and welcoming the IOAC recommendations, as well as giving an account of the IHR implementation and identifying your priorities. We have taken note of all your comments and will reflect these in all our actions. On 13.1 on the IOAC, I would like to thank the IOAC for the report presented by the Chair, Professor Walid Ahmad, and welcome the recommendations. Using this opportunity, let me thank Professor Walid for his chairmanship over the past 4 years. The recommendations of the IOAC, as always, are extremely valuable and timely as an independent oversight committee, and we as the Secretariat are committed to their implementation. As a reminder, Member States called for the WHE to be established after lessons associated with the 2014 to 2016 West Africa Ebola outbreak exactly 10 years ago. And today, we are coordinating the response to yet another Ebola outbreak in the DRC. The IOAC's preliminary observations include reflections on the program's positive evolution during these 10 years and we look forward to its findings and recommendations to guide WHO's work in emergencies for the next decade. Regarding the agenda item 13.2 on IHR implementation, the IHR constitutes the cornerstone of the global public health alert and response systems as an inclusive legal instrument with 197 states parties. In the report on the implementation of the IHRs, it is mentioned that 191 out of 197 states parties had fulfilled their obligations. I am pleased to announce that we now received 100% of all 197 states parties having reported to the World Health Assembly on the implementation of the IHRs as requested through Article 54. This is the highest ever reporting and has never happened before. In a time where multilateral instruments are being questioned, full participation in IHR reporting is a strong signal that WHO frameworks hold and that countries remain accountable to it. The outbreaks of Ebola and hantavirus in the past 2 weeks also show why international threats need an international response and why the world needs the international health regulations and WHO. Thank you for your commitment to international cooperation and multilateralism for health security and immediate coordinated response to public health emergencies. In terms of preparations for the States Parties Committee for the implementation of the international health regulations to initiate its work by the 19th of September 2026, this has started, and we will inform and engage member states during this process in due course. The related work on coordinating financial mechanisms will be addressed under the guidance of the IGWG. We will continue to provide support for the designation and establishment of the IHR National Authority, which presents some challenges in some countries. And as raised by many member states, WHO will ensure complementarity in the implementation of the international health regulations and the pandemic agreement when it enters into force as two major legally binding instruments. I thank you.
Thank you, Dr. Stella. Is the committee ready to note the reports in documents A79/6 and A79/7? The reports are noted. This grouping of agenda items is now closed. We now still have a little more than 20 minutes before the break, so we will now take up the grouping of the following agenda items under Protect Health. Sub-item 14.1, WHO's work in health emergencies, and sub-item 14.2, strengthening the evidence base for public health and social measures. The relevant documents are A79/9, A79/9 add 1, A79/A/conf/2, A79/A/conf/3, and A79/5. During the discussion, you are invited to provide guidance on the questions contained in the documents A79/9 and A79/9 add 1 respectively. Under sub-item 14.1, we are also invited to consider the draft resolution contained in document A79/A/conf/2 and the draft decision contained in A79/A/conf/3. I will now open the floor for discussions. Would those delegates wishing to speak, please press microphone button now. The microphone will open automatically when I call your delegation to take the floor. There is no need to touch the microphone button again, as this will remove you from the speakers list. I first give the floor to the delegate of Lebanon, followed by Cyprus.
Esteemed Chair, Your Excellencies, Director General, I deliver this statement on behalf of the Member States of the Eastern Mediterranean region. Our region remains at the epicenter of a deepening polycrisis, facing an unparalleled convergence of conflict, displacement, disease outbreaks, climate shocks, and attacks on healthcare. WHO is responding to 14 graded emergencies, including 7 at grade 3, while nearly half of all people in need of humanitarian assistance worldwide are in our region. These crises are placing immense strain on health systems. Funding gaps are already disrupting essential services and affecting millions, while escalating instability continues to heighten public health risks. In this fragile and complex context, effective response depends not only on resources and access, but also on the quality of our decisions. This makes strengthening the evidence base for public health and social measures imperative. The COVID-19 pandemic demonstrated that timely, equitable, and proportionate public health and social measures can save lives and protect health systems. Yet, it also exposed major gaps in the evidence base needed to inform these measures, particularly in fragile settings where decisions must be made amid uncertainty and difficult trade-offs. For our region, decision makers need real-time, context-specific evidence to respond effectively, while carefully anticipating unintended consequences. Poorly designed measures can deepen inequities, disrupt livelihoods, and restrict access to essential services. Integrating community insights, behavioral evidence, and social determinants is critical to both effectiveness and trust. The message is clear. Stronger evidence enables more effective responses, and better informed decisions save lives. We call for strengthened technical support, enhanced multi-sectoral data systems, and expanded collaboration with academic and regional partners to ensure that evidence is timely, inclusive, and locally relevant. At the same time, we must act decisively to protect healthcare, ensure humanitarian access, and fund the responses at the scale required. This is no longer a question of capacity, it is a question of collective resolve. I thank you.
I thank Lebanon, and now I give the floor to Cyprus, followed by Angola.
Chair, I have the honor of speaking on behalf of the European Union and its 27 member states. The candidate countries Albania and the Republic of Moldova align themselves with this statement. We remain alarmed by the multitude of health emergencies across the world. 10 years ago, Resolution 2286 on the protection of medical care in conflict was adopted. We condemned in the strongest term all deliberate attacks on civilians, healthcare, and aid workers. Parties to an armed conflict are required to facilitate the functioning of medical establishments and protect them from harm. Attacks should at all times be investigated. We commend WHO and its staff for their tireless efforts to save lives in extreme conditions. The 10 years of WHO Health Emergencies Program have been a success, and it is in our common interest to ensure the functioning of the program through flexible and predictable funding. It is also imperative that actors within the global health architecture and the humanitarian health cluster assess their roles in health emergencies response. We express our deep concern regarding the rapid spread of the Ebola virus disease in the Democratic Republic of the Congo and Uganda, noting that there are currently no approved Bundibugyo virus-specific therapeutics or vaccines. We commend the Director General's decision to declare a fake in line with international health regulations and welcome the swift release of funds from the Contingency Fund for Emergencies, enabling an immediate response, including epidemiological surveillance, contact tracing, and the strengthening of laboratory capacity. The EU stands ready, as in previous outbreaks, to support the work of WHO and the Africa CDC in the coordination and delivery of urgent containment and response measures. Deployments by the EU Health Task Force are already planned. Mr. Chair, the EU and its member states support WHO in fulfilling its constitutional mandate to strengthen emergency prevention, preparedness and response globally, and to protect the health, well-being and dignity of all people. Thank you.
I thank you, Cyprus. I now give the floor to Angola, followed by Bahamas.
Thank you, Mr. President. The Republic of Angola aligns itself with the statement of the African region and thanks the WH team, especially the Director General, for the report presented on the WHO's work in health emergencies. The report demonstrates the growing complexity of health emergencies worldwide, aggravated by climate change, conflicts and social inequalities, thereby requiring a strong and adequately financed World Health Organization. Mr. President, in 2025, Angola faced a large-scale cholera outbreak that affected 18 of the country's 21 provinces, with high incidence and case fatality rates, thus highlighting the importance of prevention, preparedness, early detection and rapid response, particularly at community level. We thank WHO and other partners for the technical and operational support provided to the country in surveillance, case management and outbreak response. Measures such as oral rehydration therapy, vaccination campaigns and community engagement continue to be essential to saving lives. Distinguished delegates, Angola expresses concern regarding the growing impact of climate change and on health emergencies and underlines the need to strengthen resilience and disaster risk reduction in health preparedness and response. We also express concern regarding the funding gap affecting the WHO Health Emergencies Program. We do believe that predictable and sustainable financing is crucial for an effective response, particularly in the most vulnerable countries. Mr. President, our country once again reaffirms its commitment to the implementation of the international health regulations as a driver for strengthening the national surveillance system and ensuring equitable access to vaccines, diagnostics, and essential medicines. Furthermore, we support the action proposed by the World Health Assembly and call for a strengthened solidarity to protect our populations from current and future emergencies. We thank you.
Thank you, Angola. Now the floor is given to Bahamas, followed by Monaco.
Thank you, Chair. The Bahamas commends the WHO for its continued exemplary leadership and impact in health emergencies worldwide. We note that the evolving nature of these emergencies is increasingly shaped by humanitarian crises, climate-related events, and a growing burden of zoonotic diseases. This underscores the importance of a strengthened One Health approach. In response, the Bahamas has actively enhanced its national capacity for emergency preparedness and response through targeted training and collaboration with regional and global partners, including CARPHA, PAHO, WHO GORN, and bilateral engagement with countries such as Singapore in advancing health security. As a small island developing state, we continue to emphasize the need for sustained technical support through WHO programs and initiatives to address our unique vulnerabilities and to build resilient health systems capable of responding effectively to emerging threats. Mr. Chair, the Bahamas takes note of the progress report on strengthening the evidence base for public health and social measures. For public health and social measures, and recommends and commends the Secretariat for the work undertaken since the adoption of the WHO 78.8. We support the focus on strengthening methodological, legal, and ethical foundations and the development of standardized approaches to improve PHSM research and decision-making. We also welcome the development of master study protocols and the accompanying practical implementation manual. The launch of the PHSM Knowledge Hub and alongside its innovative digital tools is highly commendable. We further underscore the importance of context-specific evidence and systematic monitoring of unintended social and economic consequences, including equity impacts. The Bahamas supports the work of WHO in building systematic, comparable, and globally coordinated research ecosystems to improve PHSM effectiveness and implementation and equity. Undoubtedly, the work strengthens a coordinated global evidence base for more effective and proportionate health emergency responses. Thank you.
Thank you, Bahamas. Now the floor is given to Monaco, followed by Saudi Arabia.
Thank you, Chair. We'd like to thank the Director General for this report, which once again proves the scale and increasing frequency of health emergencies around the world. It also highlights the essential role played by the organization within the global health architecture. The Principality expresses its serious concerns regarding the multiplication of attacks against health services. This violence too often targets medical establishments and personnel. This is unacceptable. It's a serious violation of international humanitarian law. We should also pay tribute to all those who are risking their lives on a daily basis, working in such extremely difficult conditions. The government remains concerned as well by the disproportionate impact of crises on women and children, whose situation is often aggravated by the increasing impact of climate change. Moreover, in the context of significant budgetary constraints, the Principality calls for a rigorous and strategic prioritization as well as transparent use of available resources. The coordination role played by WHO should also be strengthened with a view to maximize the impact of operations on the ground. To conclude, Monaco encourages WHO to continue integrating preparedness and response policies in national health programs in order to build health systems that are more resilient and prepared for future crises. And finally, we would like to support and co-sponsor the draft decision presented by Lebanon. Thank you.
Thank you, Monaco. And now give the floor to Saudi Arabia, followed by India.
Mr. President, we'd like to welcome the report and commend the efforts of WHO in emergency response and in modernizing health systems nationally and internationally. We stress the importance for strategic allocation of resources to optimize funds towards high-impact interventions for the benefit of the most vulnerable groups. We need to have predictable financing models. We stress that it is important to build national capacities through knowledge exchange and ongoing technical support to promote the flexibility of health systems to be able to detect and respond to health threats given the financial challenges. We encourage the organization to expand regional partnerships with non-traditional donors to address these gaps and to ensure global coordinated and sustainable response. We commend the progress made and we need to conduct further research. We also need to strengthen the evidence base for public health and social measures in order to make sure that it is in line with the best science available. Taking into consideration national specificity and context, we attach great importance in integrating social welfare in the national health policies to ensure complementarity between governmental and social bodies to address any negative effects and to to ensure a comprehensive emergency response. Once again, we renew our support to WHO and its efforts, and we stand ready to exchange our national experience and to promote cooperation with other member states through building a global unified database to support evidence-based decision-making. Thank you.
Thank you, Saudi Arabia. The floor is now given to India, followed by Malaysia.
Thank you, Chair. India welcomes the Director General's report on WHO's work in health emergencies and on strengthening the evidence base for public health and social measures, which underscore WHO's continued efforts to strengthen global preparedness and response capacities. The central role played by communities in prevention, preparedness, and mitigation of public health emergency further highlights the importance of evidence-based public health governance in an increasingly complex global health landscape. Chair, India notes with concern that climate-related events, humanitarian crisis, and emerging infectious diseases are increasingly contributing to both acute and protracted health emergencies. This underscores the urgent need for stronger global solidarity, resilient health systems, and equitable access to vaccine, therapeutics, diagnostics, and other health technologies, particularly for developing countries. In this context, India firmly believes that global health security must be advanced through collaborative, inclusive, multilateral, and science-based approaches. India continues to contribute to global health resilience through the supply of affordable vaccines, medicines, and diagnostics, while also leveraging digital innovations. India also appreciates WHO's initiatives in convening global technical consultations on public health and social measures to advance research in this domain. These measures often serve as the first line of defense in responding to novel diseases and emerging health threats. Their effectiveness depends significantly on community participation and public trust. Such participation can only be ensured when these measures are evidence-based, culturally sensitive, context-specific, and scientifically sound. Chair, India reiterates its support for a stronger, adequately resourced, and responsive WHO at the center of global health emergency preparedness, coordination, and response. Thank you.
Thank you, India. And I will give the floor to Malaysia, followed by Thailand.
Thank you, Chair. Malaysia remains committed to strengthening health emergency preparedness, response, and resilience through a comprehensive disaster health management approach, while also enhancing ASEAN cooperation through active participation in the ASEAN EOC network and support for the implementation of SCPHEED, including the MBT Phase 3 initiative with regional and international partners. Malaysia welcomes ongoing efforts to strengthen emergency medical team coordination mechanism, including standardized reporting system and regional coordination platform to improve interoperability and operational efficiency during emergencies and disasters. In this regard, Malaysia would like to share that Malaysia is currently pursuing WHO classification for the Malaysia Emergency Medical Team MyEMT Type 1 fix as part of our commitment to strengthening national and regional emergency medical response capacity in line with WHO EMT standards. We also recognize the importance of resilience and sustainable healthcare facilities in ensuring continuity of essential health services during disaster and public health emergencies. In collaboration with the WHO, the Ministry of Health Malaysia is currently developing the Malaysia Resilient Healthcare Facilities Toolkit, MyREHF Toolkit, which aims to strengthen health facility resilience through systemic risk assessment, preparedness planning, and improvement strategies. Malaysia remains committed to strengthening regional and global health security through enhanced collaboration, capacity building, and digital interoperability with WHO, Asian member states, and international partners, and looks forward to hosting the fourth ASEAN Academic Conference on Disaster Health Management in 2027 to further advance regional cooperation and knowledge exchange. Thank you.
Thank you, Malaysia. And now give the floor to Thailand, followed by Sri Lanka.
Thank you, Chair. Thailand commends WHO leadership in health emergency, reaffirms our support for its central coordinating role, and welcomes ongoing efforts on strengthening the evidence base for public health and social measures. First, sustainable financing like the contingency fund for emergency is vital for no-regrets action. We must strike a balance between immediate response and long-term resilience by continuously strengthening IHR core capacity well beyond crisis. To address inequity in outbreaks like mpox and cholera, we urge WHO to prioritize local production, R&D, technology transfer, and regional self-reliance to ensure accountable access to essential medical countermeasures. Furthermore, we advocate the One Health approach and integrated multi-sectoral surveillance as a core strategy for early threat detection. Second, on public health and social measures, we support Master Protocol and the Knowledge Hub test through family healthcare networks to gather real-world community evidence and build public trust. Given the complexity of AI data protection and randomized trial during crisis, we require WHO to develop international operational guidance to support member states. Finally, as global research capacity and innovation must not be restricted to high-resource setting, Thailand remains committed and at the same time encourage all member states to continuously and actively engage in developing the global health architecture that left no one behind. Thank you.
Thank you, Thailand. The floor is given to Sri Lanka, followed by Central African Republic.
Thank you, Chair. Sri Lanka aligns with the Director General's report and underscores the urgency of sustaining the health emergency preparedness, response and resilience framework amid resource constraints. The global evidence is clear. Reduced financing has already disrupted services for millions, with disproportionate impacts on maternal and child health, nutrition and gender-based violence response. Without sustained investment, the broader implications for global health security are severe, risking reversals in hard-won gains. At the regional level, Southeast Asia has integrated collaborative surveillance and laboratory networks into preparedness strategies. Yet, climate-related disasters continue to expose systemic vulnerabilities. Sri Lanka's Universal Preparedness Review and Pandemic Fund supported initiative demonstrate national commitment. But recent experiences such as Cyclone Ditwa highlight the need for stronger financing, logistics and equitable service delivery. We therefore call upon member states and partners to ensure predictable, diversified financing for health emergency preparedness and response to strengthen regional and national capacities and to embed resilience into primary healthcare systems. Sustained investment in emergency workforce systems, supply chains, and community protection is essential to safeguard lives and uphold the principles of equity and solidarity in global health security. Thank you.
Thank you, Sri Lanka. The floor is now given to Philippines.
Thank you, Chair. The Philippines thanks the Director General for the comprehensive reports and reaffirms our strong support for the sustained implementation and full financing of the health emergency prevention, preparedness, response, and resilience framework. As a climate-vulnerable archipelago facing recurrent outbreaks and complex humanitarian risks, we underscore that the global health security depends on prioritizing support to countries where fragility, climate shocks, and health system strain converge. We call for strengthened collaborative surveillance, expansion of the international pathogen surveillance network, and strategic use of platforms such as a global influenza surveillance and response system to advance integrated multi-pathogen intelligence. Sustained investment in resilient primary care, laboratory networks, and equitable access to medical countermeasures is essential to prevent widening inequities during crisis. The Philippines also highlights the importance of strengthening the evidence base for public health and social measures. PHSMs must be grounded on timely, context-specific, and equity-focused evidence to ensure proportionate, adaptive, and trusted decision-making. We encourage WHO to deepen behavioral and social science research, support real-time community-level analytics, and build national capacities for implementation research, especially in resource-constrained and humanitarian settings. We further encourage WHO to expand multi-sectoral partnerships, including through the Health Impact Investment Platform, and to operationalize the Global Health Emergency Corps to ensure standardized, rapidly deployable national surge workforces. The Philippines therefore calls for predictable, front-loaded financing, strengthened national public health agencies, integration of One Health approaches, and climate-resilient health systems to safeguard global health security. Thank you very much.
I thank Philippines. And now give the floor to Oman, our last speaker before the break.
تتقدم سلطنة عمان بخالص الشكر والتقدير لمنظمة الصحة العالمية على جهودها
We wish to thank the WHO for its efforts in preparedness and response to health emergencies, and well as the health database, which helps strengthen resilient health systems and helps us tackle climate and health emergencies. We underscore the importance of preparedness and enhancing response mechanisms, as well as surveillance and health data, evidence-based data as well. And we would like to see recovery plans in place, as well as preparedness and response to early warning systems, health system reports, which will all facilitate responses and help us tackle the risks. In this effort, we have stepped up our health data, our digital infrastructure, and set up specialized centers to deal with health data and information, which means that we can provide complementarity for the sources of health, other health sources of health data, and feed this into our health planning. And we've been doing this since 1976. We also wish to note that health emergency risks and challenges are compounded by supply chain challenges, and all of this requires international solidarity and an integrated data system. Therefore, a single health system, as well as investment into national frameworks. We also wish to underscore the importance of WHO's support to help us enhance capacity for analyzing metadata and to also improve the quality of sustainable financing and to strengthen health security and adequate emergency responses. In conclusion, we will continue to improve our health system and digitize the system to ensure that we can contribute to global public health and tackle future challenges. Thank you.
I have an announcement to make. Dear delegates, we have now come to the end of our meeting, and we will suspend our discussion. When we resume at 2:30 p.m. after the lunch break, we will reopen the grouping of agenda items 14.1 and 14.2 to continue our debate according to the current speakers list. Delegates having already requested the floor should not touch the microphone button. Also, I would like to remind the delegates that several official site events are taking place during the lunch break. Please refer to the official site event calendar on the WHA website and the WHA app. The meeting is now closed.
Good morning, everybody. We will now continue with our agenda. I hope that you've been able to rest and recover energy for today's work.
The focus is on work and outcomes here. So each space in the
mantener el foco.
We want to keep the focus very much on our work. Each minute we spend here has to bring value to the outside world. And recalling that, I'd like to begin today's work. This morning, the sitting has opened and we will resume the plenary with item 2 of the agenda, report of the Executive Board on its 157th and 158th meetings, followed by item 3, the address of the Director General. So we now move to item 2 of the agenda, report of the Executive Board on its 157th and 158th sessions. It's my pleasure to invite to the podium the Chair of the Executive Board, Blair Cumley. You have the floor. Is he here?
Mr. President, Dr. Tedros, Director General of the World Health Organization, Honourable Ministers, Excellencies, distinguished delegates, ladies and gentlemen. Let me start by offering my heartfelt congratulations to you, Mr. President, and the other office bearers on your election, and by expressing my best wishes for productive and successful stewardship of the Assembly. As the Chair of EB, my advice is in Derek we trust when it gets difficult. I am pleased to provide this statement on behalf of the members of the Executive Board, who I am grateful to for their active engagement and support in the last year. My statement summarises the main outcomes of the 157th and 158th sessions of the Executive Board and will focus on key resolutions and decisions. For further details, kindly refer to the full report contained in document A79/2. At the 157th session held on 28 to 29 May 2025, the Board considered 18 items and sub-items and adopted 3 resolutions and 11 decisions. Notably, the Board appointed Dr. Mohamed Junabi as the Regional Director for Africa, approved the revised WHO Evaluation Policy 2005, adopted the process for the nomination and appointment of regional directors, and appointed members to fill the vacant position on its committees and selection panels. Regarding governance reform, the Board recognised the urgency of easing organisational pressures on WHO. The officers of the Board moved beyond noting reports to actively accelerate member state-led reforms, which we carried forward in the intersessional period prior to EB 158. We convened multiple times, and I want to thank the officers for their commitment and dedication. The officers of the Board's engagement was essential in ensuring efficient and effective leadership. Moving on to the main outcomes from the 158th session of this Board, which was held from 2nd to the 7th of February 2026, the Board considered 51 items and sub-items and adopted 8 resolutions and 25 decisions. In relation to the matters under Provide Health, the Board noted reports on follow-up to the political declaration of the high-level meeting of the General Assembly on the prevention and control of non-communicable diseases, mental health, communicable diseases, universal health coverage, primary health care, health in the 2023 Agenda for Sustainable Development, and substandard and falsified medical products. We recommended that the Health Assembly adopt the following decisions: welcoming the political declaration of the 4th high-level meeting and requesting support for its implementation, requesting the development of a post-2030 tuberculosis strategy, adopting the Global Strategy for Integrated Emergency, Critical and Operative Care 2026 to 2035, and deferring consideration of the proposed Global Strategy on Donation and Transplantation to the 80th Health Assembly. We also recommended that the Health Assembly adopt resolutions on global action to advance health equity for people with haemophilia and other bleeding disorders, Steatotic liver disease, a missing piece in the global non-communicable disease response. Precision medicine, a path towards targeted, personalised and equitable care. Strengthening equitable access to diagnostic imaging through teleradiology. Reducing the burden of stroke. Strengthening prevention, acute care, rehabilitation and health system readiness, and advancing smart, efficient pharmacovigilance as an essential tool for robust, sustainable, resilient and responsive health systems for everyone, everywhere. Having noted the report of the Expert Advisory Group on the WHO Global Code of Practice on the international recruitment of health personnel, the Board adopted a decision requesting the Director-General to facilitate Member State-led informal consultations on a decision or resolution focused on the Expert Advisory Group's recommendations to be considered for adoption by this Health Assembly. Regarding the draft updated Global Action Plan on antimicrobial resistance, the Board decided that informal intersessional consultations would continue to be facilitated by the Secretariat in an inclusive and transparent manner, with a view to enabling the adoption of the action plan at this Health Assembly. In relation to matters under Protect Health, the Board noted the various reports and requested the Secretariat to organise a Member State briefing on the implementation of Resolution WHA 75.11/2022. The Board also noted the report on health conditions in the occupied Palestinian territory, including East Jerusalem, and following 2 recorded votes, adopted a draft resolution. Concerning matters under Promote Health, the Board noted the relevant reports and recommended the Health Assembly adopts a decision to deferred consideration of the draft Global Plan of Action for the Health of Indigenous Peoples to the 80th World Health Assembly in order to allow additional time for further consultations. The draft strategy on economics of health for all and a resolution on radiation and health, strengthening global protection, preparedness and response. With respect to matters under Power and Performance, the Board welcomed the report of the Program Budget and Administration Committee and noted the various reports, including on the financing and implementation of the Program Budget 2024-2025 and outlook on the Program Budget 2026 to 2027. The Board approved the organisation-wide evaluation work plan for 2026 to 2027 and adopted a decision on non-state actors in official relations. The Board also adopted a decision to streamline the foundation committees and selection panels. The Board recommended that the Health Assembly adopts the proposed amendments to the process for the selection of the external auditor and a resolution presented by a Board member on acknowledging the notification of withdrawal of the Argentine Republic from the World Health Organization. Regarding the reform of the global health architecture and the UN 80 initiative, the Board adopted an amended decision in which it requested the Director-General to design a proposal on a joint process hosted by WHO, which is led by Member States for consideration by the Health Assembly. Finally, regarding Member State-led governance reform, the Board took concrete steps to move from commitment to implementation. We adopted a decision on piloting agreed reform measures led by the officers of the Executive Board, as well as a decision on a sustainable model for Member State-led governance reform. This work reflects a shared commitment by Member States to sustain WHO as a trusted, effective and efficient global health institution. These proposed reforms are essential to enabling meaningful Member State engagement by all Member States and improving how we govern ourselves, make better choices and live within our means. A stronger, more transparent and effective WHO is essential to ease pressure on the global health system. Mr President, distinguished colleagues, let me conclude by conveying my highest regards to you all and indicate my readiness to respond to any questions or clarifications you may need. Thank you.
Muchas gracias.
Thank you very much, Mr. Comley, for that excellent report. Allow me to take this opportunity to pay tribute to the work of the Executive Board and in particular to express our gratitude and recognition to outgoing members who have contributed actively to the work of the board. That concludes our consideration of item 2 of our agenda, and we now move to item 3, which is the address by Dr. Tedros Ghebreyesus, Director General, and I would invite him to take the floor.
Maybe we have to raise this a bit. Anyone who can help? Like. Just a bit. Okay. You moved it. So this way. No. President of the 79th World Health Assembly, Dr. Victor Atala Lajam, Excellencies, Honorable Ministers and Heads of Delegation, dear colleagues and friends. Early on Sunday, I declared a public health emergency of international concern over an epidemic of Ebola disease in the Democratic Republic of the Congo and Uganda. This is the first time a Director General has declared a FIC before convening an emergency committee. I did not do this lightly. I did it in accordance with Article 12 of the International Health Regulations after consulting the Ministers of Health of both countries and because I'm deeply concerned about the scale and speed of the epidemic. We will convene the emergency committee today to advise us on temporary recommendations. So far, 30 cases have been confirmed in the DRC from the northern province of Ituri. Uganda has also informed WHO of 2 confirmed cases in the capital of Kampala, including 1 death among 2 individuals who traveled from DRC. And there is 1 US citizen confirmed positive and transferred to Germany, as reported by the US. And we're working with the DRC, Uganda, and also the United States. First, beyond the confirmed cases, there are more than 500 suspected cases and 130 suspected deaths. These numbers will change as field operations are scaling up, including strengthening surveillance, contact tracing, and laboratory testing. Second, cases have been reported in urban areas, including Kampala, and the city of Goma in the DRC. Third, deaths have been reported among health workers, indicating healthcare-associated transmission. Fourth, there is significant population movement in the area. The province of Ituri is highly insecure, as you may know. Conflict has intensified since late 2025, and the fighting has escalated significantly over the past 2 months, resulting in civilian deaths. Over 100,000 people have been newly displaced. And in Ebola outbreaks, you know what displacement means. The area is also a mining zone with high levels of population movement that increase the risk of further spread. And fifth, this epidemic is caused by Bundibujo virus, a species of Ebola virus for which there are no vaccines or therapeutics. In the absence of a vaccine, there are many other measures countries, of course, can take to stop the spread of this virus and save lives, even without medical countermeasures, including risk communication and community engagement. I thank the government of Uganda for postponing the annual Martyrs' Day celebrations, which can attract up to 2 million people because of the risk posed by the epidemic. WHO has a team on the ground supporting national authorities to respond. We have deployed people, supplies, equipment, and funds. I have approved an additional $3.4 million from the Contingency Fund for Emergencies, bringing the total to $3.9 million. And I would like to use this opportunity to thank all countries who contribute to the CFE, and we will continue to keep all member states informed. As you know, WHO is also responding to the outbreak of hantavirus among passengers and crew on the MV Hondius cruise ship. The passengers have all been repatriated and will be monitored until the quarantine periods end on the 21st of June. Yesterday, the Hondius arrived in Rotterdam, where the crew disembarked and will be quarantined until the 29th of June. For the past 2 weeks, I have been in regular contact with the captain of the ship, Captain Jan Dobrowski of Poland, and I would like to thank him for everything he has done for the passengers and crew under his care. I'm sure Poland is proud of Jan. WHO's assessment continues to be that the risk of hantavirus globally is low. So far, there are 11 reported cases, including 3 deaths, and no deaths have been reported since the 2nd of May, when WHO was first informed of the outbreak of the ship. Those numbers have changed little since the outbreak was first reported to WHO 2 weeks ago. As things stand, there is no sign that we're seeing the start of a larger outbreak. But of course, that could change, and we urge all affected countries to continue monitoring the passengers and crew carefully. I thank the many countries involved in the response. Spain not only met its legal duty under the international health regulations, but also its moral duty to the passengers and crew. I would especially like to thank Prime Minister Pedro Sanchez for his leadership and for his inspiring message at this assembly yesterday. Spain handled the situation with compassion and kindness to the passengers and the crew, and not just the legal obligation. I also thank South Africa, which was the first to confirm hantavirus at the National Institute for Communicable Diseases in Johannesburg, after the first patient was evacuated there. And I thank the UK for notifying WHO and all countries through the IHR. And I thank Cabo Verde for helping with the evacuation of the 3 symptomatic patients. I thank the Netherlands, which has been actively involved through every stage of the outbreak and has received the evacuees from the ship. And I thank Argentina and Chile for sharing their expertise and support in the epidemiological investigations and for donating reference material for PCR and serologic testing to 5 reference labs involved in the response. The outbreaks of Ebola and hantavirus in the past 2 weeks show why international threats need an international response. They show why the world needs the international health regulations and why it needs WHO. Despite the challenges we faced last year, of course, there were many achievements to celebrate. The WHO results report contains a comprehensive and interactive account of those achievements, with scorecards and country stories that demonstrate our impact on the ground. I urge you to use it. In one speech, I cannot do justice to the length and breadth and depth of WHO's work or my colleagues' work. But allow me to highlight a few key achievements according to each of the 3 key priorities of the 14th General Programme of Work to promote, provide, and protect health. Let me begin with our work to promote health and prevent disease by addressing its root causes. This year, as you know, marks the 40th anniversary of the Ottawa Charter, a landmark declaration that reminds us that health is created in the places where people live, learn, work, and play. I would like to pay tribute to the architect of the Ottawa Charter, Professor Ilona Kickbush, and the then Director General, the late Dr. Halfdan Mahler. In the past year, WHO has worked to promote health and prevent disease in 6 key areas. First, tobacco. Last year, the WHO Framework Convention on Tobacco Control celebrated its 20th anniversary. Since the FCTC entered into force, tobacco use has dropped by 1/3 globally and continues to decline in 140 countries. With support from WHO, Maldives became the first country to adopt a generational tobacco ban for people born from 2007. And this year, the United Kingdom followed suit, banning the sale of tobacco to anyone born from 2009 onwards. Just last week, Zambia's parliament approved a landmark comprehensive tobacco control bill after years of work and strong support from WHO. Despite progress against traditional tobacco products, we face a rapidly changing market of new and emerging nicotine products, including e-cigarettes and nicotine pouches. Last week, WHO published a new global report exposing the marketing tactics and strategies driving the global growth of nicotine pouches. Second, health taxes. Last year, WHO launched the 3x35 initiative, calling on all countries to raise the real prices of tobacco, alcohol, and sugary drinks by at least 50% by 2035. In the past 12 months, India, Jamaica, Malaysia, Mauritius, Mexico, Montenegro, Vietnam, Saudi Arabia, Sierra Leone, and Zambia were among countries that either announced, introduced, or increased taxes on one or more of these products. Third, nutrition. At this assembly last year, Member States approved the extension of the 6 WHO Global Nutrition Targets to 2030. 2 of the targets were almost met on exclusive breastfeeding and childhood overweight, so Member States increased them. Almost 50% of children worldwide are now breastfed at least for 6 months. and 146 member states now have legal measures in place to protect breastfeeding, covering 91% of all births globally. Although obesity continues to rise in many low and middle-income countries, recent analysis show that obesity rates are plateauing in some high-income countries. Also last year, WHO verified Portugal and the United Arab Emirates for the elimination of trans fat, a leading driver of cardiovascular disease. We would recognize both countries for their achievements later today. Fourth, climate and environment. In the past 12 months, the WHO Alliance for Transformative Action on Climate and Health grew to more than 100 countries, supporting them to build climate-resilient, low-carbon health systems. Member states also endorsed an updated global roadmap on air pollution and health, including a commitment to halve health impacts by 2040. And new data from WHO, UNICEF Joint Monitoring Program showed that 1 billion more people now have access to safely managed drinking water than a decade ago, saving millions of lives. Fifth, violence, injuries, and drowning. In the past year, 68 countries have reported progress on violence against children, based on the pledges they made at the first Global Ministerial Conference in Colombia in 2024. For example, Benin is rolling out a national plan of action on child marriage, while Mongolia is introducing a nationwide child protection workforce. With partners, we launched the first global strategy for drowning prevention with a target to reduce drowning deaths by 35% by 2030. WHO also supported 15 more countries to strengthen legislation and action on road safety. For example, Ghana adopted new safety standards for child restraints in vehicles and motorcycle helmets. We urge countries to agree a strong political declaration at the UN high-level meeting on road safety to be held in July. And 6, cities. Over the past 12 months, almost 140 cities joined the regional Healthy Cities networks in 24 different countries, including 69 cities in Saudi Arabia alone. And WHO's Urban Health Capacities Assessment and Response Resource Kit was implemented in 14 cities, collectively home to approximately 33 million inhabitants. Participating cities have improved food safety, housing affordability and quality, and indoor air quality. Now to our work supporting countries to provide health by strengthening health systems and primary health care on the road to universal health coverage. Here are 4 areas we're doing that. First, health financing. Following deep cuts to official development assistance last year, WHO developed guidance on responding to the health financing emergency, supporting countries including Cambodia, Ethiopia, Mozambique, and Uganda. We're also supporting Sierra Leone under the leadership of the Vice President to navigate the impact of the cuts while also launching an ambitious health system reform. And with the World Bank and the government of Japan, we established the UHC Knowledge Hub in Tokyo, which is now supporting the first 8 countries with capacity building, knowledge sharing, and by bringing ministries of health and finance together, especially to increase fiscal space. Second, health workforce. The world is facing a shortage of 11 million health workers by 2030, with the biggest gaps in the African and Eastern Mediterranean regions. More than half the gap is the shortage of nurses, as last year's landmark State of the World's Nursing Report showed. In the past 12 months, WHO supported 11 countries facing the most acute shortage to strengthen their national workforce strategies, contributing to commitments for nearly 100,000 new health worker jobs. With WHO support, 38 countries have more than doubled their health workforce over the past 10 years. This Assembly will consider the important additions to the WHO Global Code of Practice on international recruitment of health personnel. Building the capacity of the global health workforce was one of the main reasons for establishing the WHO Academy in Lyon, with the support of the government of France. Following the restructuring, the Academy brings together WHO's work on health workforce strengthening alongside its learning function. The Academy now offers more than 400 courses free of charge in 23 languages, with more than 120,000 enrollments so far. I urge all member states to make use of this resource, and it's because it's there for you. One of the courses offered by the Academy is the Basic Emergency Care Program, which has now been implemented in over 100 countries. 4 African countries are now bringing it to scale in 846 health centers and hospitals over the next 2 years, saving tens of thousands of lives. Third, health products. In the past 12 months, WHO pre-qualified 50 medicines, 6 vaccines, 15 in vitro diagnostics, 41 medical devices, 6 vector control products, and performed 198 inspections of manufacturing sites. We also updated the essential medicines list to include new medicines for cancer and GLP-1s for diabetes in people with obesity. To expedite pre-qualification and procurement, we designated regulatory agencies in 5 more countries as WHO-listed authorities: Australia, Canada, Indonesia, Japan, and the United Kingdom. In addition, we recognized Ethiopia and Kazakhstan for reaching maturity level 3 for regulatory oversight of medicines and vaccines, and Singapore for reaching maturity level 4 for medical devices. And just 3 weeks ago, we designated regional training centers for biomanufacturing in countries in each region: in Brazil, China, Egypt, India, Ireland, Senegal, and South Africa. This is a major step forward in strengthening the global workforce needed to support local manufacturing, based on the COVID lessons, as you remember. On AMR, the Global Antimicrobial Resistance and Use Surveillance System, GLASS, showed that 1 in 6 bacterial infections globally are now resistant to antibiotics, and the trend is increasing. To enhance the pipeline of new antibiotics, in March we published 3 new target product profiles for treating some of the most severe drug-resistant infections in at-risk populations worldwide. We also launched the Traditional Medicine Global Library with almost 2 million scientific records. Fourth, health data systems and digital technologies. Of the estimated 61 million deaths that occurred globally in 2023, fewer than 1 in 5 were reported to WHO with sufficient cause of death information for reliable public health analysis. Strengthening health data systems is vital to enable countries to generate and use their own data to guide public health action. In the past 12 months, WHO expanded the global digital health certification network to 82 countries, enabling 2 billion people to access their health records on national digital health wallets. And I would like to thank EU for the great support to this new department we have in digital health. And we have now rolled out ICD-11 to 132 member states, and every day our ICD systems receive around 4 million requests for information, enabling analysis of national and global health trends. All of this work is supporting countries to strengthen foundations of their health systems and to help them progress towards universal health coverage. At the same time, we're supporting countries to address specific health threats in 5 areas. First, maternal and child mortality. Last year, WHO released updated estimates that more than 55 high-burden countries are using to prioritize and refocus. With partners, we issued the first consolidated guideline on postpartum hemorrhage, creating a single global clinical standard for the leading cause of maternal death that's saving lives when applied consistently. We also issued our first global guideline on infertility and published updated global estimates on violence against women, which unfortunately show little progress in 20 years. We supported policy change in 50 countries to reduce unintended pregnancy, expand STI and HIV self-testing, and accelerate screening coverage for cervical cancer. This year, with partners, we published new global estimates on newborn, child, and adolescent mortality, showing that in 2024, 4.9 million children died before their 5th birthday. Of course, there is a significant progress compared to 30 years ago when it was more than 11 million deaths a year, but still 4.9 million is big, and we have to continue to strengthen our efforts. Although under 5 deaths have fallen by more than half since 2000, progress has slowed dramatically. Reinvigorating it must be a global health priority. Second, vaccine-preventable disease. In March, we concluded the Big Catch-up Initiative, an historic effort with Gavi and UNICEF to reach children who missed out on one or all routine vaccines, partly due to the disruptions caused by the COVID-19 pandemic. Over the past 3 years, together we delivered more than 100 million vaccine doses to an estimated 18.3 million children in 36 countries. We also supported 7 new countries to introduce malaria vaccines, bringing the total to 25 and targeting 10 million children every year. And we supported 15 more countries to introduce HPV vaccination to prevent cervical cancer. Since we launched the global call to action to eliminate cervical cancer in 2018, almost 75 countries have introduced HPV vaccination, meaning 65% of girls globally now live in a country with routine HPV vaccination. And of course, we need to do more. Despite funding cuts, the Global Measles and Rubella Lab Network processed more than 700,000 tests to detect and respond to measles outbreaks globally. And we conducted an analysis of 31 studies in multiple countries over 15 years that showed once again that vaccines, including those containing thiomersal and aluminum adjuvants, do not cause autism. Third, sorry, it's a long speech. Third, disease elimination. In the past 12 months, WHO has confirmed the elimination of 7 different diseases in 17 countries. and I'm proud to list all of them. Algeria, Australia, Burundi, Egypt, Fiji, Libya, Senegal, and Tunisia have all eliminated trachoma. Kenya eliminated sleeping sickness, and Chile eliminated leprosy. In addition, Bahamas, Brazil, Denmark, Maldives, and Turks and Caicos all eliminated mother-to-child transmission of HIV. And Botswana reached gold tier status on the path to elimination. Some of these countries also eliminated mother-to-child transmission of hepatitis B or syphilis, or in the case of Maldives, all three, the first country to achieve triple elimination. So congratulations to Maldives. In addition, 5 countries have been validated for maintaining elimination status: Cuba, Oman, Anguilla, Montserrat, and Sri Lanka. And WHO certified Suriname and Timor-Leste as malaria-free. So congratulations to all 15 countries. The Special Program for Research and Training in Tropical Diseases, TDR, contributed to Suriname's achievement through research that helped to reach hard-to-reach populations. We will recognize all these countries today. And I also like to recognize the leadership of Mr. Yohei Sasakawa, who is celebrating 25 years as a WHO Goodwill Ambassador for leprosy elimination, our longest-serving Goodwill Ambassador, and still running strong. Arigato gozaimasu, Mr. Sasakawa. Thank you. Fourth, communicable diseases. On HIV, we took an important step forward by pre-qualifying lenacapavir in tandem with guidelines on its use, supporting the first 14 countries to roll it out. Lenacapavir is one of the most powerful and promising tools in the history of HIV. A long-acting injectable given every 6 months, it's next best thing to an HIV vaccine. On tuberculosis, WHO supported countries to expand access to rapid TB diagnostics, including new tests that can be used near the point of care. We also accelerated the rollout of shorter, safer, and more effective treatment regimens. And the TB Vaccine Accelerator is working with countries to prepare for the rapid integration of new TB vaccines into health systems should they succeed in phase 3 trials. On malaria, WHO pre-qualified the first treatment developed specifically for newborns and infants, as well as 3 new rapid diagnostic tests that can detect strains of malaria that other tests miss. On hepatitis, the Global Hepatitis Report published just last month shows that since 2015, the annual number of new hepatitis B infections has dropped by 32%, and hepatitis C related deaths have fallen by 12% globally. On sexually transmitted infections, WHO issued a first recommendation for the use of doxycycline post-exposure prophylaxis to help prevent infections among key populations. And fifth, non-communicable diseases and mental health. The UN General Assembly adopted the most ambitious political declaration yet, with concrete targets on tobacco, hypertension, and mental health. WHO also issued new guidelines on the use of GLP-1s for the treatment of obesity in adults. And WHO initiatives on cervical, breast, and childhood cancer are now benefiting over 1 million people in more than 100 countries. In partnership with St. Jude Children's Research Hospital, we delivered 1.5 million cancer medicines supporting treatment for 2,400 children in 5 countries. And I would like to use this opportunity to thank St. Jude for their cooperation and leadership in this area. We also supported 14 more countries to strengthen mental health services for children and young people. Since it launched in 2020, WHO's Special Initiative for Mental Health has expanded mental health services to over 90 million people and enabled first-time treatment for more than 1.5 million children and adults. WHO is supporting 13 countries in the Africa region to improve access to neurological medicines for epilepsy and Parkinson's disease, where the treatment gap is more than 75%. Now to WHO's work to support member states to prevent, prepare for, and respond to health emergencies. Most notably, last year, member states adopted the WHO Pandemic Agreement and the amended international health regulations entered into force. Although member states have not yet reached consensus on the pathogen access and benefit sharing system, the PABS Annex, they have committed to continue negotiations, and I have every confidence that you will finalize it. WHO took many other steps last year to strengthen health emergency preparedness and response in 2 key areas. First, prevention and preparedness. Through the Pandemic Fund, with the World Bank, WHO supported 70 countries to develop and implement 41 projects to strengthen surveillance, laboratory networks, workforce capacity, and multi-sectoral coordination. 21 countries completed joint external evaluations. 195 state parties submitted their annual IHR reports, and 25 countries completed their National Action Plan for Health Security. The Global Health Emergency Corps ran its second simulation exercise, Exercise Polaris 2, involving 600 health emergency experts and 25 partner organizations from 26 countries and territories. And just this weekend, we just launched our Global Health Emergency Strategy with a target to have 10% of the world's health workforce ready to respond to emergencies by 2030. The Research and Development Blueprint for Epidemics brought together global expertise to prioritize research and close preparedness gaps for high-risk pathogens, including avian influenza, Rift Valley fever, Oropochu disease, and Ebola. The WHO Hub for Pandemic and Epidemic Intelligence launched an update of the Epidemic Intelligence from Open Source System, or EIOS, which harnesses the power of AI to support more than 120 countries who use the platform every day to quickly identify new threats. Through the International Pathogen Surveillance Network, over 309 partners across 101 countries are also strengthening genomic surveillance to better track pathogens, detect new variants, and guide faster responses to emerging threats. In the past year, the Global Influenza Surveillance and Response System, GISRIS, a network of 165 institutions in 136 countries, tested more than 11 million clinical specimens and shared 65,000 virus samples with WHO collaborating centers. Through the Pandemic Influenza Preparedness Framework, PIP, WHO signed 8 new agreements, giving us access to more than 940 million vaccine doses in the event of an influenza pandemic, as well as antivirals, syringes, and diagnostics. The WHO BioHub coordinated 17 sample shipments to laboratories in 10 countries to guide research and development of countermeasures. We were also on the ground supporting countries to prevent outbreaks of high-threat diseases. We supported preventive vaccination for Ebola, for approximately 170 frontline workers in the Central African Republic, DRC, Guinea-Bissau, Uganda, and Sierra Leone. We also established a new stockpile for a monoclonal antibody against Ebola, with hundreds of treatment courses ready to be shipped in 24 hours if an outbreak is confirmed. After a 3-year break, we re-established the preventative cholera vaccination, allocating 50 million doses to Bangladesh, DRC, and Mozambique, thanks in part to a doubling of supply. And to protect against outbreaks of yellow fever, we supported the vaccination of more than 38 million people in the DRC, Guinea-Bissau, Niger, and Uganda. Second, response. In addition to the outbreaks of Ebola and hantavirus that we're responding to now, in the past 12 months, WHO detected 4.2 million signals and supported countries to respond to 50 emergencies in 82 countries, preventing disease spread and saving lives. We released almost $30 million from the WHO Contingency Fund for emergencies to support the rapid response to emergencies in 40 countries. And through the Global Outbreak Alert and Response Network, GORN, we coordinated 58 deployments to support emergency response in 60 countries. As you know, conflict is on the rise in our world, and that's why you see an increase in deployments this year. Last year, we supported the DRC to respond to an outbreak of Ebola, which it controlled within 6 weeks, deploying more than 100 experts, 150 tons of supplies, and vaccinating 47,000 people. In 2025, we also supported Tanzania and Ethiopia to control outbreaks of Marburg virus disease. And in September, I declared an end to Mpox as a public health emergency of international concern. We also continued to respond to the global resurgence of cholera, deploying more than 50 million doses of oral cholera vaccine from the global stockpile. And we launched the first WHO guidelines for the diagnosis and treatment of meningitis and supported the response to meningitis outbreaks with 4 million doses of vaccine. We also continue to work with partners towards our long-held dream of eradicating polio. Last year, 52 cases of wild polio were reported from just 24 districts in Pakistan and Afghanistan, a 50% decline from 2004. So far, this year, 6 cases have been reported. In addition, countries around Lake Chad mounted a joint vaccination campaign that reached more than 83 million children. And with partners, WHO vaccinated over 600,000 children in Gaza, controlling the Strip's first recorded polio outbreak in 25 years. In addition to outbreak response, we also responded to the health needs of millions of people affected by humanitarian emergencies. That included dispatching $150 million of supplies to 97 countries and territories. In Gaza, together with our partners, we organized the transport and shipment of 515 trucks of life-saving emergency health supplies, coordinated more than 82 health clusters, partners, and supported over 2,700 medical evacuations. In Sudan, since the start of the conflict in 2023, we have delivered more than 3,000 metric tons of medical supplies, responded to outbreaks of cholera, dengue, and malaria, and we're providing direct support to hundreds of health facilities. And in Ukraine, we provided almost 20,000 health consultations, supported the medical evacuation of more than 1,200 patients, and provided training to more than 3,000 health workers. In all these places, we continued to see attacks on healthcare as the alarming and illegal new normal of conflict. In 2025, WHO verified 1,385 attacks on healthcare in 19 countries and territories, causing 1,984 deaths and 1,187 injuries among health workers and patients. Of course, WHO does not work alone. As the health cluster lead of the UN Interagency Standing Committee, we coordinate over 1,500 partners. We also coordinated the deployment of more than 100 international emergency medical teams who, together with their national counterparts, provided over 1.8 million medical consultations in more than 17 countries. Excellencies, honorable ministers, Mr. President, this summarizes WHO's work to promote, provide, and protect health. Of course, it's a glimpse. As you can see, it's a lot. I have barely scratched the surface. Supporting all of this work are the Secretariat's efforts on the fourth P of GPW14 to power for health through science, data, and digital technology. As WHO moves forward following last year's prioritization and realignment, one of our priorities is to make better use of our network of collaborating centers, which includes over 800 research institutes in 80 countries. That's why in April this year, we convened the first global forum of WHO collaborating centers in Lyon, which involved 577 collaborating centers from all 6 regions and almost 1,200 participants. I would like to use this opportunity to thank His Excellency President Emmanuel Macron for his support and presence during that conference. To strengthen our core mandate on norms and standards, we also launched a 3-year project to modernize the way WHO prioritizes, develops, and disseminates our highest priority guidelines. Also last year, we launched a new global action plan and a new global network to strengthen clinical trials involving 34 major research institutions. And this year, we're celebrating 25 years of Research for Life and HINARI, which makes scientific publications available for free or at very low cost in low and middle-income countries, helping to address inequities in access to scientific publications and strengthening trust in science. Finally, we continue to take steps to make WHO more accountable, transparent, efficient, and effective under the 5th P of GPW14, Perform for Health. We continue to prioritize WHO support to countries by preserving our country presence. Through the work of the Action for Results Group, we have implemented the core country office model, which is helping to achieve an effective, efficient, empowered, and result-oriented, result-focused country presence. We also expanded our evaluation function and improved completion rates. In the past 12 months, WHO's Office of Internal Oversight Services completed 19 audits with no unsatisfactory conclusions. Our investigations function handled 1,174 cases and closed 636 cases. The year-end caseload fell to 656, which is the lowest in 3 years. For the first time, Member States agreed to include a gender equality indicator in the results framework in GPW14, and the Global Risk Management Committee continues to assess the risks to WHO's success. The number 1 risk on its list is tightly earmarked, unpredictable, and non-diversified financing, alongside significant reductions in financing. That's why it's essential that Member States approve the remaining increases in assessed contributions to make WHO more stable, resilient, and independent, as I said in my welcome speech yesterday. Excellencies, honorable ministers, Mr. President, there is no denying that for WHO, and the countries we serve, the past year was a difficult one. I would like to place on record my deep respect and gratitude to the WHO colleagues who are no longer with us and to those who still are and who continue to serve the organization and member states with dedication. I likewise thank member states for your support and trust throughout. Thank you so much. This week, you will consider many significant challenges in global health, antimicrobial resistance, malaria, emergencies, and more, as well as the proposal for a member state-led joint process on reform of the global health architecture. For 78 years, this assembly has been where the world meets to confront shared threats with a shared response. Multilateralism is not easy, but it's worth it. National sovereignty and international cooperation are not mutually exclusive. They are mutually reinforcing. When I was in Tenerife last week, supporting the disembarkment of passengers from the MV Hondius under the leadership of Spain, the Prime Minister and Minister Monica, who is here with us, it occurred to me that the cruise ship is a lot like our world. In that small ship, 23 countries, citizens from 23 countries. The passengers on the ship were from many different countries, but they faced a shared threat. Our mission was just to keep everyone safe and to get everyone home, because that's what we do as WHO. It's the same with our world. We're all in the same boat. We're stronger and safer together as one world. That's why WHO was created in 1948. That's why it remains relevant today. And that's why its vision must remain our driving force this week. The highest attainable standard of health, not as a luxury for some, but a right for all. As Prime Minister Sanchez said yesterday, we need a contagion of solidarity, because solidarity is our best immunity. I wish you all a very productive 79th World Health Assembly, and I thank you. Thank you so much.
Muchas gracias.
Thank you, Dr. Tedros. Before we open the general discussion under item 3, I would like to invite Dr. Pense, chef de cabinet, to kindly moderate the presentation of certificates of recognition to some countries for their public health achievement.
Thank you, Chair. Excellencies, Honourable Ministers, distinguished delegates, good morning. We are now at a moment to celebrate public health achievements that the Director General elucidated in his speech. These are in the countries over the past 12 months that have been confirmed by WHO. Many different public health areas are covered. Communicable diseases, including HIV, hepatitis, syphilis, malaria, and neglected tropical diseases. risk factors for non-communicable diseases such as trans fats, and regional nominations for the World No Tobacco Day Awards. May I request the Director General to please come down to the podium to give away the certificates. We begin with the elimination of trachoma. May I call upon Algeria. Australia. Burundi. Fiji. Libya. Senegal. Tunisia. Tunisia, please. And last, Egypt. Sorry, there's one more. Next, we move to elimination of leprosy. May I call upon Chile? Next is elimination of human African trypanosomiasis. May I call upon Kenya? Next, we move to elimination of malaria. Suriname, please. Suriname for malaria. Followed by Timor-Leste. Timor-Leste, please. Next, we move to elimination of mother-to-child transmission of HIV, hepatitis B, and syphilis. Anguilla. Anguilla. If not, Anguilla, please. Okay, so we move to Bahamas. If not, Bahamas, there. Followed by Brazil. Cuba. Cuba, followed by Denmark. Maldives. Maldives, please. Followed by Montserrat. Next is Oman. Followed by Sri Lanka. Sri Lanka, followed by Turks and Caicos. Next, we move to elimination of trans fats, Portugal, followed by United Arab Emirates. Next, we move to World No Tobacco Day Awards. May I request Honorable Minister of Health of Liberia, Dr. Louise Maple Poto. No, we have World No Tobacco Day Awards, Liberia. Okay. I don't see Liberia. May I now request Minister of Health, Spain, Dr. Monica Garcia Gomez, please? Oh, sorry, we have Liberia. My apologies. Tobacco, no tobacco. Now we have Honorable Minister of Health of Spain, Dr. Monica Garcia Gomez. Next, we have Honorable Minister of Public Health of Uruguay, Maria Lustenberg Haro. Yeah. And a final award is for the Department of Legislation of Vietnam. Congratulations to all the recipients. Thank you, DG. This concludes the session on recognition of public health achievements. May I now hand over the floor back to the President of WHA.
Muchas gracias, doctora.
Thank you very much, Dr. Pensy. I'd like to take this opportunity at this juncture to propose certain arrangements for the exercise of the right of reply, with a view to ensuring a fair, predictable and orderly flow of the conduct of business at our meetings. In particular, I would propose to reserve a time at the end of each day to allow the exercise of the right of reply by those delegations having requested it during the course of the day. In delivering the right of reply, delegations are kindly requested to limit their first interventions to 2 minutes. In the event of subsequent requests by delegations for additional spoken rights of reply concerning the same matter as previous replies, I kindly request delegations to limit such spoken statements to 30 seconds or less. I will apply this practice not only to the right of reply, but also to all debates and discussions. It's a necessary and essential measure, and we trust that this is acceptable. As I see no objection, it is so decided. And we now turn to the general discussion under item 3. I'd like to inform distinguished delegates that the order of interventions will be determined by the list of speakers, which can be accessed on the organization's website and the World Health Assembly 79 application. Regional and group statements shall be no more than 3 minutes and will precede national statements, which will be limited to 2 minutes. A traffic light system will be used. Statements exceeding the allocated time may be shortened. Following interventions by member states, the floor will be given to observers, United Nations agencies and international organizations who shall have 1 minute each for their statements. I would seek the kind indulgence of delegations to respect this time allocation. So the discussion on item 3 is now open. I will call on 2 speakers, one who will come to the podium, the other will come to the platform to await their turn, which will guarantee a smoother flow to proceedings. And that will enable us to save time and make progress. The 2 first speakers on the list are Mali and Kuwait, who will speak on behalf of AFRO, the WHO African region, and the WHO Eastern Mediterranean region. So I would invite the first speaker to come to the podium and to Q8 to please wait to speak next.
President, Director General, ladies and gentlemen, it is my honor to take the floor on behalf of the 47 member states of the WHO Africa region. Allow me at the outset to warmly congratulate you, Mr. President, on your election, as well as the members of your Bureau. The African Group expresses its profound gratitude to the Director General and his team for their unwavering commitment and exemplary leadership. President, the African Group fully endorses the theme of this Assembly, Reshaping Global Health, a Shared Responsibility. This theme imposes a change of paradigm on us. For Africa, reshaping global health requires embracing a true logic of health sovereignty. This means for us to move from a status of a passive consumer to one of a producer and an active innovator. This sovereignty must be based on the acceleration of local production of vaccines and drugs under the aegis of the African Drug Agency, securing our supply chains and promoting our own scientific expertise. The African Group welcomes the success of the deployment of the malaria vaccine in several countries of the region. President, the African Group recalls that equity cannot be a simple moral ideal or an ad hoc commitment. It must be the legal and operational pillar of the entire global health architecture. Shared responsibility must not be a simple distribution of costs, but rather sharing of solutions. For the African Group, this responsibility must be mutual. Africa is committed to rigorous governance of its health resources as a counterpart of a global commitment to never allow market mechanisms to be dictated or overlooked. Shared responsibility requires sustainable, predictable, flexible funding. The African Group supports the gradual increase of assessed contributions. We call on the organization to continue its efforts of transformation to guarantee that each dollar invested serves the health of the most vulnerable. We call for a strategic, equal partnership that is based on the recognition of our values, support for our local production capacities, and the promotion of the expertise of our researchers. Thank you.
Ahora cedo la palabra a Kuwait.
I now give the floor to Q8 on behalf of the Eastern Mediterranean region, and I would ask the Maldives to come up to the platform.
سيد الرئيس، أصحاب المعالي والسعادة، سيد المدير العام، سيد.
Ladies and gentlemen, Director General, I have the honor to make this statement on behalf of the member states of EMRO. We'd like to warmly welcome the Director General for his report, and we welcome his leadership in addressing the most and increasingly complex health issues. We support the theme of this WHA, Reshaping Global Health, a Shared Responsibility. This theme reflects the EMRO reality and that of the entire world. EMRO continues to face complex health crises, including wars, conflicts, health emergencies, epidemics, and climate change. This means an increasingly complex reality for it in terms of health and hinders progress towards the implementation of the universal health coverage and the SDGs. EMRO states that the protection of health is not limited to hospitals, drugs, and treatment. It also includes the protection of vital civil infrastructure, including water, energy, transport, and safe supply chain. We are very concerned about the conflicts in a number of countries in our region. In the occupied Palestinian territory, including Gaza, vital health infrastructure is being targeted. And this is a very serious humanitarian crisis. In Sudan, Lebanon, humanitarian crisis and health crises continue to be exacerbated with the displacement of populations and difficulty in terms of provision of humanitarian aid. This puts pressure on the health system, and this requires the joint efforts in order to strengthen resilience. We reiterate our support for the pandemic agreement. It's important to implement its various aspects in order to enable access to medical products and technical expertise and knowledge. Preparedness cannot wait, and justice must be at the heart of the health system. Thank you.
Ahora cedo la palabra.
I now give the floor to the Maldives on behalf of the Southeast Asia region, and I would ask Libya to come to the podium to speak on behalf of the League of Arab States as the following speaker.
Bismillahirrahmanirrahim. Excellencies, distinguished colleagues, I have the honor to deliver this statement on behalf of the member states of the Southeast Asia region. We meet at a critical and challenging, soul-searching, consequential moment for global health. The current landscape, marked by increasing financial constraints, worsening geopolitical complexities, and uneven progress, calls for renewed collective commitment to strengthening how we work together. Ongoing discussions on the global health architecture reform, the UN80 initiative, and WHO's internal prioritization efforts reflect a shared recognition of the need for a more coherent, efficient, and responsive multilateral system. At the same time, persistent challenges related to fragmentation, duplication, and resource pressures continue to negatively affect the outcomes of our collective efforts. Mr. President, despite these challenges, the countries of the Southeast Asia region, individually and collectively, have been able to make remarkable progress in key priority areas, from pandemic preparedness to disaster risk reduction and mitigation, real-time disease surveillance to better data generation through digital health, accelerated disease elimination milestones with many global firsts, improved UHC through wider insurance coverage and PHC, stronger political commitments for combating NCDs with global first in implementing generational ban policies on tobacco, the region has able to demonstrate resolve and tangible progress. Our work and the sharpened focus on prioritization have been fully aligned with and guided by the GPW14 and the region's Banyan framework. In our shared commitment, resolve, and responsibility to promote, provide, and protect health within the confines and constraints of the new global realities, it is paramount that we shift to new paradigms, learning to stand on our own while joining hands to stand taller and stronger. In this context, and as we embark on reforming our approaches, the region underscores three key priorities. First, country leadership must remain central. Strengthening national capacities, particularly in evidence-based decision-making, is essential to ensure that global commitments translate into meaningful outcomes at country level. Second, there's a need to secure predictable and sustainable financing grounded in equity and solidarity to safeguard progress towards universal health coverage and health security. Third, we must enhance effective multilateral cooperation, including improved coordination across institutions, regions, sectors to address the shared challenges. As we advance these reforms, the region highlights the importance of strong, stable and responsive leadership at all levels of the organization. The Southeast Asia region remains committed to work constructively with all partners, guided by the principles of equity, transparency and shared responsibility. Let us move forward together from fragmentation to coherence and to turning our shared commitments to tangible impacts across nations. I thank you.
And I give the floor to Libya, speaking on behalf of the League of Arab States, and I would invite Cyprus, speaking on behalf of the European Union, to come to the podium.
السيد الرئيس، السيد مدير عام منظمة الصحة العالمية، أصحاب المعالي والسعادة.
President, Director General, ladies and gentlemen. I have the honor to make this statement on behalf of the Ministers of Health of the League of Arab States. We appreciate the efforts of WHO to strengthen health and to strengthen the preparedness of states in the face of various challenges faced by health systems. We continue our work aimed at supporting countries' health policies and to bolster their services. The statement of Bahrain of the Arab Summit highlighted the importance of health care in the regions that are suffering as a result of conflict and ensuring treatment and vaccination in coordination with the League of Arab States and WHO. This reflects our commitment to adapting regional Arab efforts and international efforts in order to implement the SDGs. Mr. President, Iranian attacks that have targeted Gulf countries and some Arab countries are a violation of international law and the UN Charter. They weaken good neighbor relations and threaten the sovereignty of countries and regional and international peace. This has affected lives and vital services and drinking water networks and transport networks. And this has affected the supply chains at the national and international levels. This has also affected production of vaccines and drugs and threatened regional and international stability. Mr. President, health services in the occupied Palestinian territories, in particular in Gaza, are exceeding their capacity. We must ensure that assistance is provided to Gaza. Other Arab countries are also facing similar challenges, in particular in the occupied Syrian Golan. WHO is having trouble evaluating health status in this region. The situation is also very dangerous in Sudan. Health centers have been targeted, and there have been difficulties in terms of ensuring treatment and provision of medical products. Thank you.
Ahora cedo la palabra.
And I give the floor to Cyprus, speaking on behalf of the European Union, and I invite China on behalf of the group of friends of global governance in Geneva to approach the podium.
Mr. President, Director General, Excellencies, colleagues, I'm delivering this statement on behalf of the EU and its 27 member states, the candidate countries North Macedonia, Montenegro, Serbia, Albania, Ukraine, Republic of Moldova and Georgia, as well as Armenia, align themselves with this statement. We meet amid intense global instability. The impact of conflicts, humanitarian health emergencies, climate change and growing inequalities strain health systems and the resilience and coherence of the global health architecture. We thank the organization's leadership and staff for advancing reforms and for the reprioritization in order to meet the challenges faced by WHO. It is essential that WHO continues this transformation to further strengthen efficiency, renew its focus on its constitutional mandate, and remain independent, sustainably financed, and fit for purpose in a highly constrained resource environment. We fully recognize the importance of national responsibility and ownership related to health policies, as well as of international cooperation. In line with this, we attach great value to WHO's constitutional mandate, role and functions, including norms and standard setting, advancing health equity, universal health coverage, and global health security. WHO should continue supporting countries in strengthening their health systems, including through health promotion, health emergency prevention, preparedness, and response. These functions remain critical to delivering on the 14th General Programme of Work. We support a lean WHO-hosted process for reform of global health architecture, enhancing coherence and coordination and reducing gaps, fragmentation, duplication, and inefficiency among global health actors. We need a future-proof system that focuses on the core functions and a strong WHO at its center. Reform is urgently required, and the time to act is now. We remain committed to work with all partners to find consensus. We underline the importance of pandemic prevention, preparedness, and response. We recognize the progress in the development of PAPS Annex to the agreement, and we remain committed to develop an effective and equitable PAPS system that will make a real difference on the ground. We are dedicated to continuing our important work and aim to finalize the negotiations by the next WHA. The EU and its member states remain firmly committed to multilateralism and stand ready to work with WHO and all partners to strengthen global health outcomes while ensuring no person, country or region is left behind. Thank you.
I now give the floor to China, speaking on behalf of the Group of Friends of Global Governance in Geneva. And I would ask Kiribati, on behalf of the Pacific Island countries, to approach the podium.
Mr. President, I have the honor to deliver this joint statement on behalf of 46 countries of the Group of Friends of Global Governance, GFGG. Global health governance today faces multiple challenges. The cross-border spread of infectious diseases, insufficient access to medical products, and uneven development in the health sector are increasingly intertwined. Strengthening global health governance is not a matter of choice. It is a shared responsibility for all countries in protecting people's health and promoting sustainable development. Against this backdrop, we believe that three principles should guide our efforts. First, we should ensure equal participation. Countries differ in national conditions, levels of development, and health systems, but they have an equal right to participate in global health governance. Relevant reforms should remain member state-led, fully listen to the views and concerns of all parties, especially developing countries, and ensure that the benefits of global health governance are shared more equitably by people of all countries. Second, we should strengthen multilateral cooperation. We support WHO in playing its central coordinating role in global health governance. All parties should, on the basis of mutual respect and practical consultation, expand consensus, advance positive progress in negotiations on the PAPS Annex to the pandemic agreement, and strengthen the International Committee's capacity to prevent and respond to future public health crises. Third, we should uphold the people-centered approach. Efforts should focus on universal health coverage, accessible and affordable health products, and sharing of technologies and experience. Particular attention should be paid to the needs of people in developing countries, and support shall be provided to help them build more resilient health systems and strengthen their own capacity for disease prevention and control. New technologies, including AI, should also serve people's health and empower health governance in a safe, responsible, and inclusive manner. Mr. President, global health governance needs consensus, but further, it needs action. The GFGG stands ready to work with all parties to uphold equality, openness, cooperation, and pragmatism, to build a fairer, more inclusive and effective global health governance system, and to make joint efforts to advance health and the well-being of people in all countries. Thank you, Mr. President.
Ahora cedo la palabra.
And I give the floor to Kiribati, speaking on behalf of the Pacific Island countries, and I invite Portugal, on behalf of the community of Portuguese-speaking countries, to approach the podium.
Esteemed President, Director General, Excellencies, Honorable Ministers and colleagues, warm Pacific greetings. It is an honor to address you on behalf of 22 Pacific Islands, island countries and areas. We are pleased to announce that in October last year, after reflecting on 30 years of progress, Pacific Health Ministers came together and endorsed a new Healthy Islands Vision 2050. Climate change reminds us that human health and planetary health are inseparable. The Healthy Island Vision 2050 is our response. It is our shared commitment and a more resilient and healthier Pacific, and to deliver on the 2050 strategy for the Blue Pacific continent. The Pacific Ocean spans a third of the Earth's surface and connects over 25,000 islands. Kiribati alone is made up of 33 islands, dispersed across the ocean area, larger than India, yet with a landmass no bigger than Singapore. Despite the vast distances between our islands, the vision weaves together our shared identity and independence. Our journey toward 2050 can be compared to building and sailing the Wa, traditional canoe of Kiribati that has long connected people, enabling communication and survival. The Wa is built without screws and nails, but bound together by rope woven from coconut fiber. In balance, trust, and shared purpose. Its strength lies in how all elements work together. This is how our health system and partnership should be built, bound together by trust and guided by shared purpose. As we sail forward, we call for a continued strong support from WHO, from our development partners, and from our donors, to strengthen the Pacific health system and workforce capacity. As an example, this investment has supported Kiribati to pass in the law in April to establish a health promotion foundation to address non-communicable disease. Brothers and sisters, the Wa is our canoe. We must take our oars, navigate together, and ensure that our shared journey leads to health and dignity for generations to come. Let us embrace the spirit of reshaping global health, a shared responsibility as our call for action. This means recognizing health impacts of climate change as a global priority and strengthening solidarity and partnership so that we remain united in facing defining challenges before us. As leaders, we can reshape a world where every island, every community, and everybody's health thrives. Thank you. Kamdaba.
Ahora cedo la palabra.
And I give the floor to Portugal on behalf of the community of Portuguese-speaking countries. And I would ask Armenia on behalf of the group of states of the International Organization of the Francophonie to approach the podium.
Mr. Chair, Excellencies, I have the honor to deliver this statement on behalf of the Member States of the Community of Portuguese Language Countries, CPLP. We are living through a moment of profound transformation of the international order, which reinforces the need to preserve effective, inclusive multilateralism based on cooperation. In the context of rapid transformation of global health, the theme of this Assembly, Reconfiguring Global Health, a Shared Responsibility, reminds us that no country can face current challenges alone and that international cooperation remains essential for effective, solidarity-based and equitable responses. The current international context reinforces the importance of preserving strong, credible multilateral institutions capable of responding to global challenges in a coordinated manner. Health cuts across the three pillars of United Nations system: peace and security, sustainable development, and human rights. Resilient and accessible health systems are essential for social cohesion, stability, and sustainable development. The current situation demonstrates the need to strengthen international cooperation mechanisms capable of responding to complex crises and their impacts on populations. In this context, it is essential to preserve and strengthen international normative frameworks, in particular international humanitarian law, and to ensure the protection of civilian populations as well as hospitals and infrastructure essential for the provision of health services. We recognize that the social and economic inequalities remain among the main determinants of health vulnerabilities, and the promotion of equity must pay particular attention to vulnerable groups, ensuring universal and non-discriminatory access to health care. We also recognize the central role of WHO within the global health architecture and in supporting policy implementation, strengthening national capacities, and promoting coordinated responses adapted to regional and local realities. Health security constitutes an essential component of global health. In this regard, we highlight the importance of the negotiations on the pandemic agreement, including with regard to the pathogen access and benefit sharing scheme system, as an instrument to promote greater equity, solidarity, and predictability. We further emphasize the fundamental nexus between health and climate change, whose impacts directly affect health conditions and increase vulnerabilities. Only through international solidarity and coordinated response we will advance towards a more resilient and sustainable global health. Mr. Chair, in a world where uncertainties are deepening, multilateralism must continue to be reaffirmed as a space for dialogue, cooperation, and the construction of common solutions. Investing in global health is investing in peace, human dignity, and international stability. Thank you very much.
I now give the floor to Armenia, speaking on behalf of the OIF, and I'd invite Israel to approach the podium, speaking on behalf of the Southeastern European Health Network.
Merci, Monsieur.
Thank you, President. Ladies and gentlemen, Ministers, Excellencies, it is my honor to make the statement on behalf of the group of French-speaking ambassadors. The group welcomes the theme of the 79th WHA, Reshaping Global Health, a shared responsibility that highlights the need for increased collective commitment to complete the necessary reforms to achieve the global health objectives. The current geopolitical context, the challenges the global order and multilateralism are facing, health, humanitarian and budgetary crises, the impact of these changes on world health and the UN institutional system, the current reform in the WHO, changes in the global health architecture, challenges linked to technological developments or threats of other international health crises are some of the factors that affect the global health scenery. These major challenges mean that we must bring together complexity and coordinated action. It's not just about managing crises, but about building resilient systems that can anticipate, prevent, and collectively respond to often cross-border health crises. Within this framework, international cooperation, which is multilateral, appears more necessary than ever, making it possible to go beyond national interests in order to move towards solidarity, transparency, equity in terms of access to health care, medication, and vaccines. These are the objectives of the pandemic agreement adopted in 2025. While deploring the results of the last negotiations on the annex, we welcome the efforts that have made significant progress possible. The achievement objectives need more compromises and by placing equitable access to health at the heart of negotiations. The group welcomes the results of the One Health Summit and the Global Forum of the WHO Collaborative Centers held last April. They recalled the importance of science at the service of health, highlighting the importance of international cooperation, scientific partnerships, and mobilization of practical solutions in favor of global health. Aware of this vital role of science and technology for health, the group highlights the importance of the mRNA technology transfer program in beneficiary countries. It welcomes the joint advocacy of WHO and OIF in favor of strengthening ecosystems that are needed to ensure the implementation of these technologies in the French-speaking area. While highlighting the importance of the mechanism of universal review of the state of health and the need to mobilize highest political commitment and mobilize financing for health systems, the group encourages states to support this process to a great extent and act to strengthen it. Lastly, we recall the importance of multilingualism in favor of the inclusiveness of WHO work and equitable access to these resources. We call on the organization to continue the respect and promotion of this vital value. Thank you.
Ahora invito a Israel.
I now invite Israel, speaking on behalf of the member states of the Southeastern European Health Network, to speak, and I'd ask Heidi to approach the podium on behalf of CARICOM.
Mr. President, Director General, Excellencies, ladies and gentlemen, I have the honor to speak on behalf of 9 member states of the Southeastern Europe Health Network: Albania, Bulgaria, Bosnia and Herzegovina, the State of Israel, Republic of Moldova, Montenegro, the Republic of North Macedonia, Romania, and the Republic of Serbia. Under the active presidency of the State of Israel, SIN has continued to strengthen regional cooperation through target initiatives focused on health system resilience, digital health, workforce capacity, and demographic transition. The key achievement was the regional workshop on healthy aging in SIN member states and beyond, held in Bar, Montenegro in September 2025, in partnership with WHO Euro and with the support of the Central European Initiative. The workshop addresses the fiscal and policy implementation of aging, promoting sustainable health financing, integrated care models, and evidence-informed decision-making through the application of analytic tools. Complementing these efforts, the regional workshop on strengthening health workforce capacity through trauma-informed care as a system competency held in Bucharest, Romania in April 2026, advanced a system approach to workforce resilience. It highlights the importance of leadership, governance, and particular implementation of supporting both health professionals and patient safety. These initiatives reflect the shared common to people-centered resilience and forward-looking health system, while reinforcing a SIN rule as a platform of regional knowledge exchange and joint action. The outcomes of this engagement will inform the upcoming 29th SIN plenary meeting, concluding the Israeli presidency under the soft power and innovation. The meeting will highlight a regional priority, including digital health, innovations ecosystem, advanced nursing rule and partnerships, and emergency preparedness. In parallel, SIN countries to promote evidence-informed policy and academic collaboration. Together, these efforts contribute to SIN vision, action together for better health for all. We express our sincere appreciation to the World Health Organization, particularly to the WHO Regional Officer for Europe and Regional Director Dr. Hans Kluge for their continued and valuable support. Thank you.
I now give the floor to Haiti, speaking on behalf of CARICOM, and I would invite the Russian Federation, speaking on behalf of the Union State of Russia and Belarus, to approach the podium.
Monsieur le Président, Monsieur le Directeur.
President, Director General, Your Excellencies, it's an honor for me to be able to take the floor on behalf of the member states of CARICOM. As small island developing states, the members of CARICOM still recognize the essential role of the WHO in protecting global health, and we would express our gratitude to the Director General and the entire staff for their constant leadership and untiring commitment. In the face of geopolitical developments and rapid changes in ongoing conflicts, which are only intensifying, CARICOM would underline the importance of sustainable multilateralism in international cooperation to address pandemics which respect no borders. We take note of the progress made in negotiating the PABS Annex of the Pandemic Agreement, while fully recognizing the importance of the unresolved issues such as equity. We believe that the Global South should continue to strengthen its coordination based on our shared experiences in order to guarantee that this legally binding instrument functions fairly, equitably, transparently and sustainably. At the same time, CARICOM is fully attached to a constructive dialogue with all stakeholders in order to seek practical and effective solutions for the implementation of the agreement. CARICOM has played a leading role in the promotion of action against non-communicable diseases, and we are deeply concerned by the slow progress towards achieving Goal 3.4 of the SDGs, recognizing that many member states are not on the right track to reducing early mortality due to NCDs. So we call for an accelerated implementation of the global commitments in the area of control and prevention of NCDs, supported by sustainable finance and measurable accountability mechanisms. Our members are continuing to invest in strengthened human resources for health through education and training. Initiatives for retention and improvement of work conditions are underway. However, we still have a deficit in healthcare personnel, exacerbated by external migration, which threatens the resilience of our healthcare systems. We welcomed the report of the Expert Advisory Group on the WHO Code of Practice on the international recruitment of health personnel and support its recommendations, including the review of legally binding elements and their consideration as part of the text. Now, despite these challenges, CARICOM would reaffirm its ongoing commitment to work with global and regional partners to preserve our successes in the area of global healthcare and accelerate progress towards the achievement of the Sustainable Development Goals as we look towards 2030. Thank you very much.
Ahora cedo la palabra a la
I now give the floor to the Russian Federation, speaking on behalf of the Union State of Russia and Belarus.
Уважаемый господин председатель.
President, Director General, colleagues, Our thanks go to the Director General for the report. We support the coordinating role of the WHO in international coordination of global healthcare, and we support strengthening here. The cooperation between the Russian Federation and the Republic of Belarus has set a positive example for the professional dialogue and cooperation. Our countries have systems which are characterized by high levels of access and economic effectiveness, most up-to-date medical support. The access of a freely accessible basic healthcare system is one of the priorities of the Union State. We see that the level of citizen satisfaction with the system is growing each year, growing by 8% each year. The state programs are working to increase access to primary healthcare, inpatient care, a modern healthcare infrastructure, the implementation of modern methods of treatment and rehabilitation, and we are working to digitalize the healthcare system using AI-based tools. Remote medical consultations totaled 24 million last year. We are also working to train medical specialists. We have students from 150 countries. The growth over the last 3 years of medical staff has been significant, and we believe that we will continue on this path. The level of maternal and infant mortality is less than 3.4 per thousand. Child mortality up to the age of 10 has dropped by 25% over the last few years. That shows that we have a healthcare system which is functioning effectively. The Union State is open to cooperation, the exchange of experience, and shared work in achieving the interests of international healthcare. Our joint efforts will lead to developing the scientific potential of our countries and improve healthcare indicators throughout the territory. Thank you very much for your attention.
Eso concluye.
That concludes the speakers speaking on behalf of groups. And we will begin with the delegations from member states. Allow me to recall that the time for speaking is 2 minutes. The traffic light system will be used as well. And that anyone running over time might have their statement shortened. So we will start by inviting Indonesia to come to the podium to speak and Germany to approach the rostrum.
Cedo la palabra a Indonesia.
I give the floor to Indonesia.
President Digi Tedros, Excellencies, in 1944, amid the economic crisis following World War II, leaders gathered in Bretton Woods to reshape the global finance architecture. History has shown us that crises bring opportunities for reform. Today, we face a global health financing crisis, but also a historic opportunity to reshape the global health architecture. For Indonesia, first reform must uphold country ownerships. Global health architecture should support countries in developing their own health programs, health financing, and health equity and resilience through strengthening local manufacturing and R&D capacity. Second, we must address the sustainability of health financing. Countries need to have a clear financing pathway to gradually transition from donor dependence towards stronger domestic financing, complemented by concessional loans from development banks. Third, global health actors and institutions need to be better aligned, reduce duplication and fragmentation, improve efficiency, and channel defunding according to country needs and priorities. Fourth, we need a stronger and more focused WHO, and it should remain focused on their core mandates. And to do it effectively, WHO also needs predictable and sustainable financing. Mr. President, Indonesia supports the joint process to support reforms of the global health architecture, and through this crisis, let us seize this opportunity together to deliver meaningful global health reform for future generations. Thank you.
I now give the floor to Germany, and I'd invite Ukraine to approach the rostrum.
Mr. President, Director General, dear colleagues, Germany aligns itself with the statement delivered on behalf of the European Union and its 27 member states. Global health continues to face significant challenges. However, as emphasized by the recent outbreaks of Ebola and hantavirus, national health depends on multilateral solutions and cooperation, with WHO at its center. Without WHO structures and activities, including in health security and AMR, national health systems are at risk. In order to lead by example, WHO must focus on its core mandate and comparative advantage. More than ever, we need to avoid duplication and fragmentation. This also means building new and efficient ways of collaboration with our partners in the global health architecture. We, as member states, share the responsibility to support, guide, and strengthen WHO. We need everyone's expertise and participation, including Taiwan's. Dear Dr. Tedros, please rest assured that Germany remains a reliable partner. We will continue to support WHO in every way we can, politically, technically, and financially. Therefore, I am pleased to announce today that Germany will support WHO with an additional €25 million this year, because now is the time for strong leadership and for a clear focus for strategic and bold decisions. The ongoing reform brings not only challenges but also opportunities. It is our chance to demonstrate why global collaboration and multilateralism matters. Thank you.
Ahora cedo la palabra a Ucrania.
I now give the floor to Ukraine, and I invite the Marshall Islands to approach the rostrum.
Excellencies, for more than 4 years, our healthcare system has been operating under full-scale aggression. Hospitals, ambulances, and energy infrastructure continue to be under attack. Yet Ukrainian doctors and healthcare workers continue saving lives every day during blackouts, missile attacks, and constant security threats. We are deeply grateful to the WHO, Dr. Tedros, to the country office in Ukraine, led by Jarno Habicht, and to all partners supporting Ukraine throughout these years. Today, Ukraine is focusing not only on responding to the challenges of the war, but also on the further transformation of its healthcare system. The combination of resilience and development is embedded in the health strategy of Ukraine 2030, which defines key priorities including rehabilitation, mental health, healthcare worker development, and equal access to healthcare services. Recognizing the long-term impact of war on society, Ukraine is also advancing a nationwide mental health initiative under the leadership of the First Lady of Ukraine, aimed at making mental health support accessible, community-based, and integrated into everyday life. The war has profoundly changed healthcare realities. Ukraine has gained unique experience in trauma care, rehabilitation, and maintaining healthcare services under conditions of war. At the same time, one principle must remain the absolute. Attacks on healthcare must never become normal. The decision adopted by this Assembly regarding the health emergency in Ukraine in 2022 remains critically important. Their continued implementation, sustained international attention to the health consequences of the war against Ukraine are essential. Because when hospitals are attacked, global humanitarian principles are also attacked. Healthcare workers must never become targets. Access to healthcare must never depend on security conditions. Attacks on healthcare must face consequences, and international organizations must continue defending the principles of humanitarian law, transparency, and responsible international cooperation. Ukraine highly values its partnership with the World Health Organization, and together we will build a stronger global health resilience in the future. I thank you.
I now give the floor to the Marshall Islands, and I'll invite Vietnam to approach the rostrum.
Mr. President, Director General, Honorable Ministers, Excellencies, distinguished guests, and delegates. Reflecting on the theme of this Assembly, Reshaping Global Health, a shared responsibility, we in the Marshall Islands are guided by the motto, Tibet-Bilin Gejugan, which means accomplishment through joint effort. It is this call that we want to be heard from the distant shores of our atoll nations, to advance global health efforts in a collaborative, fair, and inclusive manner. Together with other small island developing states, the Marshall Islands face distinct health threats and carry a disproportionate burden relating to impacts of climate change on health, nutrition, and prevention of NCDs. These health threats place a considerable strain on SIDS health systems, which are already challenged with a plethora of technical and capacity constraints. In turn, this undermines our economic resilience and deepens existing structural vulnerabilities. To effectively and fairly improve global health security, our shared responsibility should not only be about doing more for those who have less, but also about doing better and more, most importantly, together. In this regard, we urge member states to hear the voices of SIDS, including across the Pacific, and acknowledge our special circumstances. Support must be provided to SIDS to strengthen our capacity to respond to health emergencies, including those resulting from climate change, and safeguard the fundamental human rights of health for our people. Finally, Mr. President, we must further emphasize that a recognition of the shared responsibility to reshape global health and underscore the importance of comprehensive global health cooperation. In this regard, Marshall Islands reaffirms that this cooperation must include the 23 million people of Taiwan, as it did by inviting them to participate as observers in the WHA prior to 2017. Thank you, Komol Tata, and Mr. President.
And I give the floor to Vietnam, and I'll invite Peru to approach the tribune.
Dr. Tedros, Director General of the World Health Organization, Honorable Minister, distinguished delegates, it is a great honor for me, on behalf of the Vietnamese delegation, to speak at the 79th session of the World Health Assembly. We are living in an area where health challenges know no national border. From the emergence of new pathogens and the devastating impact of climate change to the growing burden of non-communicable diseases, this reality demonstrates one core truth. Global health is not concern of any single nation. The Assembly theme this year is an urgent call to action. In this context, Vietnam would like to emphasize three key pillars. First, primary health care, universal health coverage must be built on a strong foundation. We are determined to reform primary health care to ensure all people, including those in remote areas, have access to comprehensive quality services. Second, global health security. We need fairer international health architecture as enabled by the pandemic agreement. Having shared responsibility, we need to greater data sharing, transparency, access to vaccine and treatment. The third, climate change. Vietnam is among the countries most vulnerable to climate change. We are transforming our health system to adapt and mitigate threat, efforts that will benefit from international support. Reshaping global health is not merely about changing legal text, but about changing mindset. We must shift from passive response to proactive prevention, from competition to cooperation. Vietnam is committed to contribute our experience and resources to collective effort. We call to continued support from developing nations and more sharing information, material, and technology. By sharing, we can build a safe world. I wish this session great success. Thank you very much.
Ahora cedo la palabra a
And I give the floor to Peru, and I would invite Ireland to approach the rostrum.
Excelencies, distinguidos
Excellencies, distinguished delegates, it's an honor to speak to you today at this assembly on behalf of Peru at a moment that is key for multilateralism and global public health cooperation, a world marked by social, economic, and environmental challenges, as well as armed conflict, which are having a detrimental impact on access to healthcare, quality of life, general well-being, in particular for the most vulnerable populations. We welcome the commitment to strengthening healthcare systems focused on resilient, integrated systems focused on people, and moving towards a more equitable and fairer system to be able to deal with external extreme events such as El Niño. We are driving reform to stop the fragmentation of the system, increase primary healthcare effectiveness, and accelerate digital transformation and interoperability. For a country like Peru, public health is a daily challenge, which calls on us to balance urgent needs with limited resources. We need to prioritize healthcare throughout life, reduce infantile anemia, recover the coverage of vaccines, strengthen chronic disease control, and broaden our response to mental health, as well as improve preparedness for health emergencies. Peru is implementing the international health regulations, continuing the annex on negotiations on PABs, which will guarantee fair access to benefits. We also very much need to focus on the material information for sharing digital sequencing information on pathogens, which is the core of current negotiations. Thank you very much for your attention.
Ahora invito a
I now give the floor to Ireland and would invite Finland to approach the rostrum.
Honourable Chair, distinguished Director General and delegates, Ireland remains committed to the rules-based multilateral system and to the mandate of the World Health Organization. We meet at a time of profound challenge for global health arising from climate change, from conflict and the impact on food production and the impact of geopolitical uncertainty. That is why the World Health Organization matters more than ever. But we know that scientific progress, innovation and continued international cooperation gives us great grounds for optimism. Ireland's belief that global health must remain grounded in solidarity, equity, and equity must remain at the centre of what we do. This includes sexual and reproductive health and rights, ensuring that health systems are inclusive. Delivering on global health requires investment in health workforce through education, fair recruitment practices, international cooperation on workforce planning, and we're working to achieve that not just domestically, but embrace our wider responsibility as members of the international community. We must continue to implement lessons learned from our response to COVID-19, which demonstrated the vulnerabilities in the global health systems, but also the potential of scientific collaboration. The operationalisation of the international health regulations and the ratification of the pandemic agreement is so important, and we must be further than we were before COVID-19. We need only to look at the cluster of hantavirus infections and Ebola outbreak in the past 2 weeks to be confident of this. Ireland will continue to work with partners to deliver a stronger, fairer and more resilient global health system. I would like to conclude by paying tribute to Dr. Mike Ryan, who earlier yesterday received a thoroughly deserved Lifetime Achievement Award. We are so proud of Mike and so proud to call him one of our own and wish him continued success. Thank you.
I now give the floor to Finland, and I would ask Luxembourg to approach the rostrum.
Well, President, Director General, dear colleagues and delegates, Finland aligns itself with the EU statement. Global collaboration is undergoing fundamental changes, some overdue and necessary in the long run. In this evolving landscape, we must safeguard the mechanisms for multilateral cooperation, dialogue and collective action. In global health, systems must work and diseases do not respect borders. WHO's measured response to the hantavirus, emphasizing the low likelihood of broader transmission, underscores the continued relevance of these strong and well-functioning structures. We highly value the role of WHO in humanitarian crises and settings. We are extremely concerned about the continued attacks on healthcare and civilians, a clear breach of international humanitarian law. WHO's role in documenting them for posterity is crucially important. Finland would like to reiterate its full and continued support to Ukraine, both political and material support, including through WHO Europe. WHO's core mission as a convener and leader in global health and health security, as well as in setting science-based standards and norms, is important to us. We appreciate WHO's adjustments to the new situation and the reforms that will continue to fine-tune its governance. Mr. President, political commitment to health is a strategic economic decision. Finland emphasizes the relevance of economics of health for all, underlining the mutually reinforcing nature of well-being and economic growth. Thank you.
And I give the floor to Luxembourg, and I would invite Japan to approach the rostrum.
Monsieur le
President, Director General, ladies and gentlemen, dear all. Luxembourg fully supports the statement of the European Union. We thank the Director General and WHO staff for their unwavering commitment to health for all. Strengthening prevention while investing in more robust surveillance systems, supporting scientific research to guide our decisions, and guaranteeing equitable access to treatment. These are vital tasks that are fully within the mandate of WHO. Likewise, innovations, including those linked to artificial intelligence, must be of benefit to all. This is why it's crucial to conclude negotiations on the PAPS annex of the pandemic treatment without delay. President, rethinking global health means renewed cooperation between states, international organizations, civil society, and private actors. We recall that all technical expertise must be mobilized. For this reason, we will continue to support the participation of Taiwan in technical meetings of WHO as an observer. This year is the 10th anniversary of the Health Emergencies Program, which is more necessary than ever given the current context. We express our concern in the face of the rapid spread of the Ebola epidemic in the Democratic Republic of Congo due to a strain for which no vaccine is currently available. We welcome the precautionary approach adopted by the Director General by declaring this epidemic as a health emergency of international concern and we welcome the rapid release of funds from the Contingency Fund for Emergencies. Thank you for your attention.
And I give the floor to Japan, and I would invite Spain to approach the rostrum.
Excellencies and distinguished delegates, I am honored to make this address on behalf of the government of Japan. Given the increasingly severe challenges to global health, there is an urgent need to advance WHO reform and to rebuild the global health architecture. Japan expresses its respect and support for the efforts of the WHO Secretariat, led by Director General Tedros. Japan will contribute actively to these discussions. In advancing its reform, WHO must return to its core mandates, namely the evidence-based norm-setting role, the leadership and convening role in global health, and the coordination and guidance role in infectious disease emergencies. And WHO should also be turning this crisis into an opportunity. This is essential. Last year, Japan hosted the UHC High-Level Forum and has contributed to strengthening health financing in developing countries through the UHC Knowledge Hub established in Tokyo in collaboration with WHO and the World Bank. Japan is also planning to host the UHC High-Level Forum again on December 12th this year in Tokyo, continuing to contribute to the achievement of UHC worldwide. In the response to health emergencies, including pandemics, there should be no geographical vacuum. We should draw upon the experiences of regions that have achieved notable public health outcomes, such as Taiwan. On the pandemic agreement, Japan will continue to engage constructively in the discussions to ensure that the system for pathogen access and benefit sharing is operational and meaningful in practice. We strongly condemn Russia's aggression against Ukraine as a clear violation of international law. Japan will continue to support the Ukrainian government's efforts to protect its people from public health threats. Conflicts break out over the world. Japan is resolutely against any attacks against medical personnel facilities and calls for protection for healthcare in situations of armed conflict in compliance with international humanitarian law. Japan reaffirms its unwavering commitment to achieve health for all, together with WHO. Thank you very much.
Ahora cedo la palabra a España.
And I give the floor to Spain, and I'd invite Australia to approach the rostrum. President, Director General, colleagues, Spain aligns itself fully with the statement made on behalf of the European Union and its member states. The 79th World Health Assembly arrives at a decisive moment for global health. We're going to discuss here, amongst other things, the pandemic agreement, global health architecture, digital health, climate change, and mental health. And behind all of these discussions, there is a common thread. What kind of world do we want to build for the next 10, 20, or 30 years? One based on cooperation and mutual care, or one that is marked by fear, inequality, and an approach of everyone for themselves? Spain is absolutely clear on the answer. We believe in a global health system based on science, strong public health systems, and cooperation between countries, and human dignity. Viruses know no borders, so nor should solidarity, scientific evidence, or the protection of life. A few days ago, as you know, Spain and the international health authorities had to grapple with a health care alert with the outbreak of hantavirus. And we acted as we believed we should, with the international community, facing a very serious crisis, coordinating with dozens of countries, coordinating our logistic and health resources at the disposal of individuals from multiple countries. We didn't ask where they came from or who they were. We understood that at a time of crisis, the only possible priority is that of humanity. We've demonstrated that Spain's commitment to the negotiation of the pandemic agreement is not just rhetoric. We have shown our commitment to global health and multilateralism. And with the new outbreak of Ebola in the Democratic Republic of Congo, we have to be guided by the same principles. We have a new opportunity to show the value of international cooperation. But we cannot talk about global health and ignore the suffering in the world. Spain would strongly condemn the suffering experienced by the people of Gaza, and also acknowledge the deeply concerning situation in Iran and the Persian Gulf. There can be no health under bombs, no health but amongst the ruins, and there cannot be global peace without human rights. We need more WHO, less denialism, more cooperation, less egotism, more science and less indifference. Let's do it. Thank you.
Ahora cedo la palabra a Australia.
And I give the floor to Australia, and I invite Denmark to approach the rostrum.
Australia is honoured to address the Assembly at a pivotal moment for global health. As outgoing Chair of the Executive Board, I thank you for your trust and partnership. Global health is a shared responsibility. The World Health Organisation's essential role is clear. Only WHO can unite nations around shared rules, trusted evidence and coordinated health action, part of an ecosystem of trusted multilateral institutions that underpin global stability. When WHO is strong, the world is safer, better prepared for future crises. Strengthening health security and pandemic response is crucial. Australia remains deeply concerned about the safety of humanitarian and health workers in conflict zones, and we are committed to the implementation of the Declaration on the Protection of Humanitarian Personnel. Those who save lives must be respected and protected, able to operate safely without fear. Australia also remains firmly of the view that global cooperation for health should engage all partners, including Taiwan. As member states, this is our organisation. The governance reforms we have all advanced will ensure meaningful engagement by small and large countries alike and ensure WHO remains responsive to all of us. We urge all member states to sustain this momentum on reform. At home, Australia is reforming health, aged care and disability systems, tackling chronic disease, closing the gap for First Nations peoples and strengthening prevention, mental health and innovation. Our focus is on a sustainable health system that works for everyone. We remain firmly committed to advancing equity and inclusion to ensure healthcare remains accessible and affordable for all, regardless of income, location, age, gender identity, sexuality or disability. And we are also committed to helping our next generation. Our world-first reforms to limit social media access for under-16s will keep our young people safe and support their mental health and well-being. Australia reaffirms its unwavering commitment to the World Health Organization. Thank you.
And I give the floor to Denmark, and I'd invite Chile to approach the rostrum.
Thank you, Chair. Director General, dear colleagues. Denmark aligns itself with the statement made on behalf of the EU and its member states. We reaffirm our strong support for the WHO as a central coordinating, convening and guiding organization in global health. WHO's normative, evidence-based and standard-setting role forms the foundation of the global health system. In a changing and complex landscape, our institution must evolve to remain effective, responsive and relevant. Reforming the WHO, the global health architecture, as well as the UN80 initiative are essential for building a more flexible, sustainable and adaptive system fit for today's needs and the challenges of tomorrow. As reforms move forward, one principle must remain clear. WHO's normative authority must be protected. The world needs an independent institution capable of delivering evidence-based guidance rooted in science, equity, human rights and the shared goal of health for all. Denmark welcomes a joint process hosted by WHO to support reforms of the global health architecture. We remain fully committed to the UN, to effective multilateralism and to bringing together current reform efforts to improve health for all. Bringing us together as colleagues is the true superpower of the WHO, allowing us to speak with one another, meeting us, listening, learning from each other. The relationship we build and the conversation we share form the foundation for sustainable healthcare solutions for the future. This is valuable, and I look forward to continuing our collaborations with you all. Thank you.
Cedo la palabra a Chile.
I now give the floor to Chile, and I'd invite Nigeria to approach the rostrum.
Señor Presidente,
President of the World Health Assembly, Director General, health ministers, officials, delegates, we welcome the opportunity to participate at the 79th World Health Assembly. It is a space of fundamental importance to renew our commitment to international cooperation, multilateralism, and the healthcare of our populations. We meet at a time of huge challenges, but also enormous opportunity. The recent experience we have seen demonstrates that when countries cooperate, when science focuses on decisions, and when healthcare systems incorporate innovation with a view to public well-being, we can respond better, protect more lives, build more resilient societies. We reaffirm our commitment to the role of the WHO and welcome the progress towards a more robust international health architecture, including the pandemic agreement and the implementation of the international health regulations. Being better prepared for future emergencies is a shared responsibility and an investment in safety, well-being and trust. In this context, Chile is driving a person-focused health agenda. Digital transformation is at its heart. The interoperability of systems, telehealth, artificial intelligence, data governance, and the safe use of health information are fundamental tools to enhance opportunities for healthcare and take better public health decisions. This is a transformation that should be carried out with responsibility, data protection, transparency, and trust from our citizens, always serving a more person-focused, timely, integrated approach. Together with this, Chile has identified cancer as a healthcare priority. As is the case in many countries, we are encountering an increased oncological disease burden associated to an aging population, risk factors, and the ongoing gaps, particularly in the area of timely diagnosis. And that's why our country is strengthening a holistic approach to cancer with the emphasis on prevention, early detection, and ongoing care. This is a priority which reflects our central belief that making progress in this area is an improvement in our system by early diagnosis, better care, and reducing health gaps. We have clear priorities on chronic diseases. President, we come to this assembly with a willingness to dialogue, a constructive spirit, and a commitment to a global agenda based on equity, evidence, innovation, and cooperation. We reaffirm our readiness to work together with the WHO and PAHO. Thank you very much.
Ahora cedo la palabra.
I now give the floor to Nigeria, and I'd invite Poland to approach the rostrum. And I'd ask you to stick to your speaking time. It's important. Thank you.
President, Director General, Excellencies, distinguished delegates, we meet at a moment of profound transformation in global health. The financing landscape has narrowed. Geographical instability has displaced more people than at any point in recent memory. Pandemic and outbreak remains ever present, and yet the multilateral system we built to confront them is being tested as never before. The provisional theme of this assembly, to provide, protect, promote health, could not be more timely. Nigeria believes that this is not a moment to retreat from global solidarity, but to reaffirm on its terms that a country-led, equitable, and sustainably in spirit of Lusaka agenda. On the substantive items of this assembly, Nigeria takes the following position. On the economics of health for all strategy 2026 to 2030, we strongly endorse the framing that domestic investment in health is the foundation of sustainability. We call on partners to align their support with country-led defined priorities. On the pandemic agreement and its pathogen access and benefit sharing annex still being negotiated, Nigeria's position is clear and unwavering. The agreement is a historic instrument, but it will be more measured not by elegance of its preambles, but by the fairness of its operational core. Nigeria will only support a system that addresses all inequalities so that the agreements can enter into force and protect the world's vulnerable population. On the international health regulations and WHO work in health emergency, we reaffirm our commitment to full implementation and to strengthening regional manufacturing vaccines and domestic therapeutic through African Partnership for Vaccine Manufacturing. Before I conclude, permit me to announce that Nigeria has the honor of hosting the 5th Global High-Level Meeting Conference in Antimicrobial Resistance in Abuja from 28 to 30 June 2026. This conference will convert the commitment of the 2024 United Nations High-Level Meetings into concrete country-led actions and to extend personal invitation to all member states and to partners to join us in Abuja as we stand ready to welcome the world. I thank you.
Ahora cedo la palabra.
I now give the floor to Poland, and I'd invite Monaco to approach the rostrum.
Dear President, dear Director General, dear Ministers, dear colleagues, Poland aligns with the EU statement. I thank the Director General for his speech. I also thank him and the entire WHO staff for their dedication and ongoing efforts to promote health for all. Nowadays, international cooperation is becoming more and more challenging. Many people have limited access to medical help. The global health system is also changing. We thank the WHO for its quick and strong reaction to this. We must work harder and in cooperation so that everyone can enjoy good health. Poland reminds that armed conflicts cause great suffering of people and destroy health systems. We call for an end to all wars, including the unprovoked Russian aggression against Ukraine. We need stronger humanitarian and medical response to such crises and long-term strategy to rebuild health systems. We should focus even more on health systems resilience and international support in conflicts and crises. There are also other important topics on our agenda for this week. Mental health is a big challenge, especially for children and young people. We must protect the health of our children and support their development. Our society is getting older. This happens in many WHO regions. We must adapt our health system to this change. In this context, shortage of medical personnel is a huge challenge for us. New technology brings chances but also risks, so we must act wisely and responsibly. I wish to thank WHO for its ongoing support and leadership in global health. Thank you.
Cedo la palabra a Mónaco.
I now give the floor to Monaco, and I would invite Iran to approach the rostrum.
Monsieur le Président.
President, Director General, Excellencies, ladies and gentlemen, dear colleagues. Reshaping global health today raises profound questions. How to move forward together in a more fragmented, constrained, and uncertain world. Geopolitical tensions are getting worse. Funding is reduced. There are more weaknesses, while the expectations vis-à-vis our institutions continue to increase. In this context, a shared responsibility, the topic of our debate, cannot just be a simple formula. It is linked to political requirements and must be a method which links to the international cooperation and national sovereignty. For WHO, this means a determined return to the basics. Its normative mandate is irreplaceable and must be strengthened. This recentering also calls for greater consistency in terms of collective architecture, greater streamlining of actions, more synergy between institutions and agencies, greater complementarity and efficiency in our systems at the service of the high interest of populations. This requirement also applies to governance. An ambitious reform is necessary to enable organizations to respond more clearly and flexibly and efficiently to the needs of one and all. It's by pursuing this aim that we can make progress on the major challenges that remain, such as universal health coverage, strengthening health systems and prevention, including in the spirit of the One Health approach. Regarding our normative work, which is ongoing, in particular negotiations regarding the pandemic agreement, Monaco calls for further efforts with responsibility in order to ensure a rational and realist and useful framework. We reassert our commitment to WHO, a constant commitment at the service of efficient, demanding multilateralism, which is very faithful to its raison d'être. Thank you.
I now give the floor to Iran and invite Burkina Faso to approach the podium.
Mr. President, Director General, Excellencies, distinguished delegates. Today, I speak from a nation under unprovoked attack, not only against its army, but against its civilians, its children, its environment, and its health infrastructure. Just days ago, a school in Minab was struck. 168 students and teachers were killed at their desks. These were not competent. They were children with dreams. The numbers are horrifying. 376 under 18 years are killed and more than 33,000 civilians are injured, a clear evidence of indiscriminate attacks on civilian targets. 63 hospitals and 195 other health infrastructures are damaged. Let us recall the words of WHO Director General himself, Dr. Tedros. Bombing a hospital or a school is not a miscalculation. These are war crimes, full stop. And let me be clear, the Pasteur Institute of Iran, a pillar of our country's health system for over 100 years, has been directly hit. Excellencies, attacking a school or hospitals is attacking the future and ethics fundamental. Iran's call on this assembly to condemn an attack on civilians and civilian health infrastructure. Yet, despite all these attacks, our health systems continue to function with pride. We will not be broken. We will not be broken. And our national team of health stands with the people of Iran in any condition. Health can and must remain a bridge of peace.
I now give the floor to Burkina Faso and invite Cuba to come to the rostrum.
Monsieur le
President, Director General, distinguished delegates. The pragmatic vision of President of Burkina Faso, Head of State, Comrade Captain Ibrahim Traoré, to build a health system which is equitable, resilient, inclusive, and sovereign, is clearer and more concrete than ever. As an example, we can mention the following achievements: 12% of the state budget allocated to the Ministry of Health, and the manifesto of the Popular Progressive Revolution even announces a gradual increase of this level of funding in the coming years. Recruitment and specialized training in 2025 of 1,970 doctors, pharmacists, dental surgeons within the framework of the Plan 1,000 times 5, a historic, unprecedented reduction of 32% in cases and 44% of deaths linked to malaria as compared to 2024. Access to a package of vital health and nutritional services to more than 10,000 children under the age of 5. Thousands of women that have benefited from precancerous cervical lesion screenings, more than 42,000 mammographs carried out free of charge, mostly for women in rural areas. kidney transplants that are now available, implementation of surgery, heart surgery, placing us at the in the fourth place in Southern Africa and in countries south of Sahara in terms of intensity. Ladies and gentlemen, our country remains committed to multilateralism, which is focused on our health objectives. To conclude, Burkina Faso reasserts its support for One China principle in line with international law. I thank you.
Cuba has the floor, and I invite Singapore to come to the rostrum. Thank you. President, Cuba comes before this World Assembly to denounce a serious situation. Our country is under a direct military aggression and threat from the government of the United States under false pretext. Nothing could justify such a brutal act and uncivilized act by the superpower. We call on all nations who love peace and defenders of just causes to mobilize to prevent this aggression should it happen. Cuba is undergoing a full blockade of fuel, and this has an effect which is extraordinary on each and every Cuban family, our children, our elderly, and the sick. Despite our efforts, neonatal mortality has reached 9.9%, 9.9 per 1,000 live births. The survival rate of children with cancer has reduced from 85% to 65%. Today, the waiting list for surgery in the country exceeds 100,000 patients. 12,000 of them are children. 16,000 require radiotherapy, and 12,000 need and 3,000 need hemodialysis, provoking shortages and extreme penury to many people is extreme and should be condemned by all members of the WHO. Despite these major challenges, the national health system has not collapsed. We'll continue to reorganize based on resilience and optimization of resources. Cuba will resist. We extend our extreme gratitude to all those who support us and express their solidarity at these difficult times. We'll never give up on our humanist principles, as we've shown that with our sending of medical brigades to combat Ebola in 2024. And we'll continue to help countries in the south that need it. We will always make efforts to make human right to health a reality. Thank you. Singapore has the floor, and I invite Nepal to approach the rostrum.
President, Excellencies, ladies and gentlemen, I deliver this national statement on behalf of Mr. Ong Ye Kung, Minister of Health and Coordinating Minister for Social Policies. We are gathered at the World Health Assembly today when the WHO has undergone steep budget cuts. Yet, being leaner can also be an opportunity if the WHO reshapes itself decisively. Today, I put to you just one idea. More than ever, the WHO must further develop partnerships. When resources are tight, we must better leverage the expertise and capital of others. Over the decades, the WHO has built important partnerships. For example, CEPI fills up an important gap in developing life-saving vaccines when market incentives are weak. Gavi complements this by advancing equitable vaccine access. Their work today is made possible through the contributions of philanthropic organizations such as the Gates Foundation, Wellcome Trust, and Bloomberg Philanthropies. Looking ahead, our challenges call for a new generation of partnership suited for the times. These include partnerships with organizations with strong networks and surveillance capabilities to spot the emergence of pathogens that may spark the next pandemic. Partnerships with technology companies to harness the power of AI can predict the onset of non-communicable diseases, and strengthen preventive care and healthy aging. Partnerships, perhaps with a panel of reputable regulatory jurisdictions around the world, to establish international benchmarks, expedite regulatory approvals, and time-to-market medical countermeasures in support of the WHO's mission. Singapore is honoured that WHO has awarded Singapore Health Service the prize for research in healthcare for elderly and health promotion, and accorded Health Services Authority of Singapore the highest maturity level for recognition for medical device regulation. Singapore is happy to contribute to the work of the WHO beyond monetary contributions. Thank you.
Nepal
has the floor, and I invite France to come to the rostrum.
Mr. President, Director General, Excellencies, and distinguished delegates, Namaskar. On the behalf of the government and the people of Nepal, I extend warm greetings to this assembly. Today's interconnected crises demand global action, equitable access to medical resources, and robust pandemic preparedness. Nepal reaffirms that a strong, adequately financed WHO is essential to coordinate this shared responsibility. Excellencies, despite the limited resources and challenging geography, Nepal is advancing robust primary health care. We have sustained strong immunization, improved maternal, newborn, and child health, and introduced HPV vaccine into routine care. 8 hurdles remain. We faced rising non-communicable diseases, antimicrobial resistance, and solve climate-induced health threats, despite our minimal global emissions. Health is a fundamental human right, not a privilege. Driven by this, we are restructuring our national health architecture and health insurance system. We are enforcing nationwide basic health standards and leveraging telehealth to bridge geographical divides. We are redefining inclusive care by integrating disability rehabilitation into primary health and making mental health a strategic pillar. Recognizing our heritage, we are scientifically institutionalizing Ayurveda, yoga, and natural therapies while promoting the global health tourism to share these traditions with the world. Nepal calls for an equitable global health system that truly responds to country needs. Let us act together, ensuring everyone, everywhere realizes their right to health. Dhanyavad, thank you, and once again, namaste to everyone.
Cedo la palabra.
France has the floor, and I invite Lithuania to come to the rostrum.
Monsieur le Président.
President, Director General, dear Dr. Tedros, dear colleagues, France fully aligns itself with the statement of the European Union antivirus and the Ebola public health emergency that has been called show the absolute necessity of multilateralism, which is strong. So I would like to welcome the extreme reactiveness of the WHO and our peers in dealing with this. It is time, and we need to strengthen our work with the WHO. That is France's commitment. We have 3 major priorities. First of all, the reform of the global health architecture. The joint process, which is hosted by the WHO, is a decisive opportunity to ensure that we guarantee universal health coverage. France welcomes the courageous efforts and productive efforts that Dr. Tedros mentioned. This ambitious and pragmatic process must be adopted by the Assembly. Secondly, the One Health approach is something that we must capitalize on, looking at the One Health Summit in Lyon. And the WHO, as chair of the quadripartite, will play a key role. Thirdly, the pandemic agreement. We repeat our desire to adopt rapidly the PABS Annex. This agreement is essential to strengthen our collective efforts to face the next pandemic. France will be fully mobilized to ensure negotiations conclude at the latest by our next assembly. France has a clear vision. We need to ensure that we have shared responsibility, effective solidarity, and reinforced equity. And France calls on all to participate. Thank you.
Cedo la palabra.
I now give the floor to Lithuania, and I invite Turkey to come to the rostrum.
Chair, Mr. Director General, Excellencies, distinguished colleagues. Lithuania fully aligns itself with the statement made by Cyprus on behalf of the EU and the Member States. The theme of this Assembly reflects the health threats transcend borders. Geopolitical instability, pandemics, and climate change have shown the need to move from crisis response to collective resilience. Lithuania believes this evolution begins with the establishment of resilient, strong, and equitable national health systems. To this end, we are actively strengthening primary care, improving accessibility, and leveraging digital health innovations to build more responsive systems. We also emphasize that mental health must remain a central public health priority, particularly as we address the growing challenges facing young people in the digital age. In addition, Lithuania continues to strongly condemn the Russian war of aggression against Ukraine, as the deliberate targeting and destruction of healthcare infrastructure are direct attacks on the stability of the international community. Additionally, we must ensure that no gaps are left in our global network. Therefore, we urge the WHO to invite Taiwan as an observer to the WHO and to facilitate its meaningful participation. Looking ahead, reshaping global health requires a strengthened workforce and multi-sectoral cooperation. We must reinforce the WHO as the leading authority, and to this end, we support the ongoing negotiations on the pandemic agreement and PAP system. Lithuania remains committed to advancing a global health architecture that ensures collective resilience for the future. Thank you.
Cedo la palabra.
I give the floor to Turkey, and I invite Sri Lanka to come to the rostrum.
Yes. Esteemed Director General, honorable ministers, distinguished delegates, I am pleased to join you at this important gathering of global health governance. This assembly once again addressed a broad and critical agenda, from communicable and non-communicable diseases to health emergencies. Under the normative and technical leadership of the WHO, we believe important outcomes for global health will emerge from our deliberations. We are all aware that regional and global political concerns increasingly shape the international health agenda. Turkey approached international cooperation with the understanding that health is the foundation of all aspects of human life. In this spirit, we share the experience of our health system as a common global value and approach conflicts and wars primarily through the lens of human health. This also guides us toward all peoples deprived of their right to health, especially in Gaza. Distinguished participants, the theme of this assembly placed a shared responsibility upon all member states to strengthen constructive cooperation in reshaping the global health architecture. Turkey will continue to contribute constructively to global health governance, including international negotiations such as pandemic agreement. We remain fully committed to international cooperation with our new health model centered on research, development, and production. Distinguished delegates, with this opportunity, I would like to kindly invite you to the COP31 Health Day and the International Traditional and Complementary Medicine Congress to be hosted by Turkey this year. I thank you.
I give the floor to Sri Lanka and invite Kenya to come to the rostrum.
Honorable Chair, Director General, Excellencies, distinguished delegates, Aibowan. This year holds special significance for Sri Lanka as we commemorate 100 years of our public health system, a century of community-centered public health services, that has become a cornerstone of our nation's health achievements and social progress. Despite limited resources, my country has achieved remarkable health outcomes through strong public health leadership, preventive care, and community outreach. We have significantly reduced maternal and child mortality, eliminated malaria, controlled communicable diseases, and achieved high immunization coverage and long life expectancy. However, we now face new and complex challenges, including the rapid rise of NCDs, population aging, and increasing mental health needs. In response, Sri Lanka has embarked on an ambitious primary care reform agenda through our Arogya Health and Wellness Centers. These community-based, family doctor-led multidisciplinary teams focus not only on treating illness, but also on promoting health, preventing disease, identifying risks early, and providing continuous people-centered care close to where people live. 41 centers have already been established, with plans to expand 300 by the end of this year and 450 centers in next year. The reform prioritizes early detection of NCDs and common cancers while strengthening elderly care, rehabilitation, palliative care, home-based services, adolescent health, and primary mental health care. Guided by our national policy on health and well-being and the National Health Strategic Master Plan, Sri Lanka is building a modern, wellness-oriented primary health care model founded on a life course approach to health. Sri Lanka remains committed to working with all member states and partners to build resilient, inclusive, and people-centered health systems that leave no one behind. Thank you very much.
Cedo la palabra.
I give the floor to Kenya, and I invite Colombia to come to the rostrum.
Thank you, Mr. President. Dear friends, at this very moment, the World Health Organization staff are saving lives on the front line of crises, responding to public health challenges like Ebola, and are often working in the world's most dangerous and demanding conditions. Whether in Ukraine, Sudan, Palestine, their work embodies what this organization stands for: science, solidarity, and service. It also serves as a powerful reminder of our shared responsibility to protect everyone and the essential civilian infrastructure that makes that care possible. I reiterate that the United Kingdom unequivocally condemns all attacks on civilian infrastructure. It is precisely because of these realities that the World Health Organization remains indispensable. At a time of profound and intersecting global challenges, its leadership, grounded in science, technical expertise, and evidence-based action, has never been more important. We saw the power of that global technical expertise and collaboration in the response to the hantavirus. The WHO's role in convening countries, setting global standards, and providing impartial advice is fundamental to strong health systems worldwide, and the UK is proud to support it. To meet the demands of today's crises and those ahead, the WHO must continue to uphold the highest standards of technical excellence. In that spirit, like others, we call for Taiwan to have meaningful access to all relevant technical WHO meetings and to observe the World Health Assembly as it did from 2009 to 2016. The United Kingdom is committed to translating science and innovation into real-world impact, including through our 66 WHO collaboration centres. We also commend Member States working to agree an effective, equitable pathogen access benefit sharing annex to the pandemic agreement. We must act now and urgency on antimicrobial resistance and also on the destructive power of nicotine, where the UK is taking bold steps to create our first smoke-free generation. Mr. President, the UK remains steadfast in our commitment to the WHO. Together we can strengthen an effective global health system that delivers for those who depend on it the most. Thank you.
Cedo la palabra.
I give the floor to Kenya, and I invite Colombia to come to the rostrum.
Mr. President, Kenya aligns itself with the statement delivered by Mali on behalf of the member states of the African region. and we appreciate the Director General for his comprehensive report and for the pragmatic reforms proposed to strengthen this organization. In the light of the prevailing global health challenges, and in line with this year's theme, Reshaping Global Health, Kenya is undertaking a very comprehensive reforms to strengthen its health workforce, health delivery, and digital health structures. Colleagues, healthcare workers and health institutions must be protected from any ongoing conflicts. We continue to advocate for the access of health service and commodities to all citizens. In today's world, the question before us is no longer whether the global health requires reforms. It is whether we possess the collective resolve to build a global health order that is equitable, representative, resilient, and fit for contemporary realities. Kenya supports the redefined global health architecture anchored on 4 strategic imperatives. Equity must become the organizing principle of global health governance. Kenya is deeply concerned by the ongoing Ebola virus disease outbreak in DRC and Uganda, and calls for urgent need for equitable and coordinated global response. Outbreaks affecting African countries must receive the same level of urgency, solidarity, financing, research, and international support as emergencies occurring elsewhere in the world. Second, resilient regional manufacturing and supply systems must become very central pillars of preparedness. Africa is moving from dependency to sustainable production, technology transfer, and strategic investment. Multilateral institutions must evolve to reflect present global health realities. Legitimacy, fairness, inclusivity, and trust must be our guiding principle. The World Health Organization and Africa Center for Disease must therefore both remain indispensable to global health governance and must be adequately empowered. Just to finish, and very important, sustainable financing for health remains essential. Global financing frameworks must be responsible to and support domestic resource mobilization. Country ownership and long-term health system resilience is key to global health. Thank you very much.
Cedo la palabra.
I give the floor to Colombia and invite Mongolia to come to the rostrum.
Señor
President, Director General, distinguished delegates, Colombia participates in this important global space on the reconfiguring of global health with the belief that health is a right and a global public good that cannot continue to be subordinate to market logic. Our country has decided to turn the page on neoliberal policies that reduced state presence and deepened inequalities in order to move towards a model which is preventive, territorial, and people-centered, where the state fully assumes its responsibility to guarantee the right to health. Under this premise and the leadership of President Gustavo Petro, Colombia has strengthened historically its presence in our territories. We have more than 12,000 basic health teams and more than 100,000 health workers throughout the country, showing that health is built from the communities and not through financial intermediation. This transformation, backed by investments of more than $2.2 billion, shows that the state, which is strong, saves lives and reduces inequalities. The results confirm it. We have reduced by half infant mortality and reduced by 20% our maternal mortality. And also, we've set up a hospital ship which will take basic and integrated services to river populations which were historically set aside. The reconfiguration of global health also needs us to face up to inequalities in equitable access to medicines, guaranteeing fair prices, regional production, and transfer of technology. That is why we are setting up a Latin American and Caribbean Agency for Medicines. We call for a global health, which is fairer, based on cooperation, health sovereignty, and presence of the state. Thank you. I now give the floor to Mongolia and call on Jordan to come to the rostrum.
Excellencies, distinguished delegates, on behalf of Georgia, I would like to congratulate the World Health Organization and thank the Director General for his leadership at a time when global solidarity and resilient health systems are more important than ever. Georgia remains firmly committed to the principle that health is not a privilege, but a fundamental human right. Over the past decade, we have continued to strengthen our health system through reforms aimed at improving access, quality, and financial protection for our population. Since the launch of the Universal Healthcare Program, more than 95% of the population has gained access to publicly financed health services. Access to essential health services has significantly expanded, while out-of-pocket expenditures have substantially decreased. In recent years, we introduced important pharmaceutical reforms, including reference pricing and managed entry agreements, with improving affordability of medicines and enabled us to remove annual ceilings on cancer and chronic disease medicines under the state programs. We are also advancing comprehensive primary health care reform to build a stronger, prevention-oriented and people-centered system. This includes new financial mechanisms, digital transformation, quality standards, and performance-based approaches to improve continuity and effectiveness of care. At the same time, we recognize that many challenges remain: demographic challenges, non-communicable diseases, mental health needs, climate-related risks, and growing financial pressures required stronger international cooperation and sustained investment in health system. Georgia remains committed to working closely with WHO and all partner countries to advance universal health coverage, equitable access to quality services, and healthier lives for all. Thank you very much.
I'd like to remind everyone that at 1 p.m. we will stop our statements because of other commitments, and then we'll continue in the afternoon. Now we continue and we give the floor to Jordan, and we invite Algeria to come to the rostrum. Thank you.
بسم الله الرحمن الرحيم. السيد الرئيس يشرفني.
President, I have the honor to speak from the Hashemite Kingdom of Jordan at this assembly under the subject of redefining global health, a shared responsibility, a subject that will only be fruitful if we have greater efforts to apply immediately our work in the face of the many challenges throughout the world. The challenges the world has faced in the last year: epidemics, conflicts, and humanitarian crises, economic pressure, climate change, has all shown that health is no longer a local matter that only concerns a single country, but it confirms the collective and joint responsibility. Jordan believes that redefining or reforming the global health architecture needs real partnership based on solidarity, the sharing of responsibility, sustainable development. And so Jordan welcomed the health ministers of the Islamic Cooperation Organization recently, and in our region, the catastrophic consequences are such that we are following our role to continue with shared responsibility. We host a number of refugees from brother countries and groups who are seen as vulnerable. We follow our national efforts to improve health services, and these have been well noted by the Director General during his visit to the Kingdom in February. based on the reform of the global health architecture, we have priorities such as the promotion of sustainable financing of health, the expansion of digital work, and the fairness in access to healthcare. We would like to highlight the importance of moving from a temporary response to long-term partnerships which allow us to promote the strategic planning and international cooperation. The future of global health depends on our capacity to work jointly with a spirit of shared responsibility. Jordan will always be a committed partner to ensure we have a fairer future. Thank you.
Cedo la palabra.
I give the floor to Algeria, and I invite Latvia to come to the rostrum. Thank you.
Algeria. Bismillah ar-Rahman ar-Rahim wa salatu.
In the name of God, the graceful and the merciful. President, Director General, Excellencies, ladies and gentlemen, ministers and delegates, it's my pleasure to take the floor on behalf of my country at this assembly at an unprecedented moment for health and in a framework of pandemics, climate emergencies, tensions and disparities in access to health services. Policies adopted by Algeria have enabled us to improve significantly our health indicators, for example, average life expectancy of 80 and implementation of the SDGs relating to maternal and infant health, and responding to health needs with respect to medicines and eliminating certain communicable diseases. We've reformed our health architecture through developing digital responses and training staff, and we've promoted community care. We've focused in particular on free care. Algeria reiterates then that the right to health is a fundamental right. It's inalienable. We are concerned about the health situation and the humanitarian situation in Palestine and in the occupied territories following the continued attacks which are affecting civilians, health facilities and health workers. So Algeria notes it's important to guarantee urgent care and access to medical services in an unhindered manner. We'd like to reiterate our commitment to the African policy on the basis of solidarity and shared development through cooperation on effective health. This is part of our South-South cooperation vision. We need international cooperation to ensure health and development, and this is the vision of our President. This Assembly is invited today more than ever to promote action, collective action, and to promote mutual trust between member states. And this is because the decisions we take today will guarantee the future of the global health security and our ability to face crises. Finally, I'd like to commend the devotion of health workers around the world because they are on the front lines to upholding human health. Thank you for your attention.
I give the floor to Latvia, and I invite Malawi to approach the rostrum.
Dear Director General, dear President, Latvia aligns with the statement of the European Union, and thank you for your report and presentation and for your leadership of this organization. Excellencies, dear colleagues, first and foremost, I reaffirm Latvia's full support for Ukraine's independence and territorial integrity within its internationally recognized borders. Latvia condemns all attacks on healthcare facilities and personnel and the grave humanitarian impact of Russia's ongoing strikes against Ukraine's infrastructure. I welcome and encourage WHO's effort in strengthening the health system in Ukraine under extremely dangerous circumstances. I also hope for and call upon termination of all attacks on healthcare workforce and hospitals in other conflict zones around the globe. Second, this organization and multilateralism itself is under attack, and there is a certain amount of doubt regarding the benefits of coordinating health issues at the global level. It's very important that we members of the science-based healthcare community remain highly committed to the core mandate of the organization and its leadership. I know that my country's region, the Euro region, has already made some painful but effective cutbacks. I sincerely appreciate Dr. Krug's leadership in this regard. Latvia itself operating under tight budget conditions, but I am proud to note we are doing our best to maintain a high level of healthcare protection for our citizens, for example, by actively implementing digital solutions and by executing a hospital coverage reform. Latvia remains fully committed to the finalization of the PABS Annex of the pandemic agreement, and this recent outbreak of the hantavirus is just another example that proves we need to render the WHO leadership more tools and coordinate our common effort to ensure health security. Finally, Latvia would like to reiterate its repeated call for inclusiveness at this organization. Thank you.
Cedo la palabra a Czechia.
I give the floor to Czechia, and I invite Malawi to approach the rostrum.
Dear President, distinguished delegates, Czechia aligns itself with a statement delivered by Cyprus on behalf of the European Union and its member states. The focus of today's theme, Reshaping Global Health, a Shared Responsibility, reflects key insights gained in recent years. The issue of global health has transcended borders and benevolence, becoming fundamentally linked to collective security, solidarity, and trust. No nation can effectively confront pandemics, climate-related health threats, armed conflicts, or growing inequalities in isolation. These challenges underscore our need for robust multilateral cooperation, resilient health systems, and a renewed dedication to prevention and preparedness. The World Health Organization continues to serve as a vital convening platform and normative authority in this regard. In order to address contemporary challenges, it is imperative that all entities involved in global health architecture reinforce governance, transparency, and financial sustainability. Through modernization and adaptation to emerging risks, we can establish a more resilient and equitable global health framework. True shared responsibility must be demonstrated through coordinated actions and partnerships informed by local priorities. Ensuring that no one is left behind, we support the granting of observer status to Taiwan at the World Health Assembly, as global health threats do not know borders. Furthermore, we would like to appeal for strengthening the cooperation with all non-state actors. Regrettably, there remain actors who have not chosen the path of collaboration and partnership. The unprovoked, unjustified and illegal Russian war of aggression against Ukraine persists, as well as many other armed conflicts resulting in tragic loss of lives and continued attacks on civilian and healthcare infrastructure. Let us seize this opportunity at the Assembly to translate our commitments into measurable and meaningful progress. Thank you.
Cedo la palabra a
I give the floor to Malawi, and I invite Canada to come to the rostrum.
Thank you, the President, Excellencies, distinguished ladies and gentlemen. Malawi welcomes the Director General's opening address, particularly the strong emphasis on primary health care, and reaffirms that robust primary health care systems remain the cornerstone of universal health coverage, health security, and resilient, equitable, people-centered healthcare systems. Malawi's Health Sector Strategic Plan 3, under the theme Reforming for Universal Health Coverage, reflects our firm commitment to the primary healthcare operational framework, the Sustainable Development Goals, and the collective global pledge to leave no one behind. Malawi continues to increase investment in primary health care with primary healthcare expenditure rising from 39.7% in 2019 to 42.7% in 2022. However, persistent challenges include health workforce shortages, financing gaps, donor dependence, and stockouts of essential medicines and vaccines underscore the urgent need for sustained investment, stronger coordination, and more resilient supply chains. In line with the theme of this assembly, reshaping the future of global health, a shared responsibility, we firmly believe that this vision is both achievable and urgent, and that we all share a responsibility for safeguarding the health of present and future generations. In conclusion, we reaffirm our unwavering commitment to strengthening primary health care as a bedrock of universal health coverage, resilient health systems, and global health security. In an era marked by climate change, pandemics, and growing public health threats, investing in primary health care is not an option, it is essential. Thank you.
I give the floor to Mongolia, and I invite China to come to the rostrum.
Mr. President, it's a great honor to address the 79th World Health Assembly on behalf of the government of Mongolia. Mongolia warmly welcomes this year's theme, which powerfully reflects the importance of solidarity, multilateralism, and collective action in responding to today's increasingly interconnected global challenges. According to the WHO statistic, nearly 4.5 billion people are still lack to access to essential health service. These figures remind us that public health, environmental sustainability, and economic resilience are deeply interconnected and must be addressed through coordinated action plan. For Mongolia, those challenges are both immediate and tangible. It's a country increasingly affected by desertification, harsh climatic conditions, and air pollution. We recognize the importance of building resilience, inclusive, and people-centered health systems. In this regard, Mongolia remains firmly committed to strengthening primary health care, expanding digital health and telemedicine services, and improving equitable access to health care, particularly for rural and vulnerable populations. Mongolia continues to advance evidence-based traditional medicine is an integral component of its national health system. In this regard, the President of Mongolia issued a decree in January 2026 on the development of traditional medicine, further complemented by the government adoption of the action plan for the development of Mongolian traditional medicine for 2026 to 2030, aligned with the WHO global strategy on traditional, complementary, and integrated medicine. Distinguished delegates, Mongolia remains firmly committed to working closely with WHO and member states and partners to build a healthier, safer, and more resilient future for present and future generations through solidarity, multilateral cooperation, and shared responsibility. I thank you, Mr. President.
I give the floor to China, and I invite the Republic of Moldova to come.
尊敬的大会主席、女士们、先生们，
Ladies and gentlemen, China believes that the reform of global health system must uphold the approach which is led by member states and should value the interests of developing countries so that we can have balanced global development. Firstly, we must give due attention to health on political agenda, integrating health into all policies, promoting multidimensional from perspectives of conception, planning, investment, key elements, guarantee, performance, outputs, among others. China has been implementing a health-first development strategy, continuously improving people's health, and striving to achieve decisive progress in building a healthy China by 2030, with life expectancy of Chinese people increasing from 79 years old to 80 years old. Second, increasing global health development investment to achieve health equity. Developed countries should honor their commitments and fulfill their obligations. Over the last 60+ years, China has dispatched more than 31,000 health workers abroad, where they have treated more than 300 million patients, and invented artemisinin, which cures malaria, making a Chinese contribution to promoting global health equity. Thirdly, firmly supporting multilateralism. China is a staunch supporter of the central coordination role of the WHO in global health governance. We will work with all parties to promote an equitable, reasonable, and efficient global health system. China stands ready to join forces with all member states to advance the negotiation process of the annex of the pandemic agreement in order to build a global community of health for all. Mr. President, there's only one China in the world. Taiwan is an inalienable part of China. The UNGA Resolution 2758 and WHO Assembly Resolution 25.1 has already recognized this fundamental principle. China decided not to approve the Taiwan region's participation in this year's assembly, which has been supported by most of the member states. Certain countries have made remarks on this issue, which has violated international law. China urges these countries to stop politicizing health issues and should not hurt the emotions of people. Thank you.
Cedo la palabra.
I give the floor to the Republic of Moldova and invite Ethiopia to come to the rostrum.
Honourable President, Your Excellency, Director General, distinguished delegates. We are living in an increasingly complex global context marked by ageing populations, rising non-communicable diseases, climate risks, and overlapping crises. No country can address these challenges alone, and none can afford to act without evidence. Moldova reaffirms its commitment to universal health coverage, with a particular focus on strengthening primary health care as the foundation of a resilient system. We continue to advance integrated people-centered services, including stronger community and preventive services. Our country prioritizes mental health, predominantly among young people, as well as the improvement of access to essential and compensated medicines. These objectives will be achieved with the support of e-health solutions and artificial intelligence. The fundamental reforms in the health sector are directly connected to the process of accession to the European Union. We believe that health in all policies and the One Health approach are essential to address today's interconnected challenges effectively. We'd like to underline the importance of WHO recommendations and guidelines grounded in rigorous scientific evidence. We support the leadership role of WHO as well as the ongoing transformation of the organization, including ensuring sustainable and predictable financing. Moldova also supports the process launched by WHO on the reform of global health governance. The recent crises, including COVID-19 pandemic, the energy crisis, and the significant humanitarian and economic impact of Russia's war of aggression against Ukraine, have offered us valuable lessons. Investments must be directed towards effective preparedness, surveillance, and response systems, fostering international cooperation so as to have the capacity to respond to future emergencies, regardless of their origin. In this respect, we support the timely implementation of the pandemic agreement, including an equitable pub system. The Republic of Moldova remains a reliable partner of the World Health Organization and relies on its support in the implementation of national strategic priorities. Thank you.
I would like to remind delegates to stick to the 2-minute time. I now invite Ethiopia and invite Slovakia to come to the rostrum.
President of the Assembly, Director General, Excellency Ministers, distinguished delegates, it's an honor to address this Assembly, a defining moment as we stand only 4 years away from 2030, the deadline for SDG. Ethiopia comes before this Assembly with a clear message. Even in the most complex circumstances, progress is possible when leadership, community, and partnership converge. Guided by our Health Sector Development Investment Plan 2, we're accelerating the unfinished agenda of UHC, reaffirming our commitment to leave no woman, no child, and no community behind. The newly released finding of 2024-2025 Ethiopian Demographic Health Survey affirms meaningful, hard-won gains in maternal and child health survival. In just 2 decades, Ethiopia has reduced maternal mortality from 673 to 141 per 100,000 live births, a testament to sustained commitment, statewide reform, impact of investing in primary health care. Thus, results which we will continue to consolidate are a tribute to our health workers, our health extension workers, our midwives, our community leaders, and the resilient Ethiopian families. Primary health care remains to be Ethiopia's most powerful and most equitable platform for health for all, and we're strengthening our investment in primary health care by re-envisioning primary health care and ensuring health workforce reach grassroots communities, expanding digital health, strengthening community-based health insurance, innovating health financing, and transforming waradas into engines of health coverage. Climate change is not a distant threat. It is persistent and intensifying determinant of health, and Ethiopia continues to lead this through Green Legacy Initiative, climate-resilient low-carbon health facilities, renewable energy deployment, and we look forward to hosting COP32 and to keeping climate and health firmly into global agenda across nutrition, non-communicable disease, mental health, AMR, emergency preparedness, and sustainable development through WHA 77, COP and beyond. As the world is shaping the new global health architecture, Ethiopia reaffirms its commitment to working in collaboration with WHO, African Union, regional bodies, global partners, guided by country ownership and leadership. Let us make this Assembly a turning point, not defined by magnitude of challenge we face, but the depth of solidarity, the ambition.
Please conclude.
And I thank you all.
I give the floor to Slovakia and I call on Uruguay to come to the rostrum, and I'd like to remind all delegates to stick to the time allotted.
Distinguished Director General, Mr. President, Excellencies, ladies and gentlemen, Slovakia aligns itself with the statement delivered by Cyprus on behalf of the EU and its member states. An increasingly complex global environment marked by growing health challenges and mounting pressures on public budgets and donor financing, Slovakia highly values the effort of the WHO in strengthening the organization's stability and advancing a more sustainable future. The Slovak Republic believes that the reshaping global health requires resilient and person-centered approaches, firmly grounded in strong community engagement, partnership, and shared responsibility. Slovakia places strong emphasis on community-based models of disease prevention and health promotion, implemented close to citizens and in cooperation with local and regional authorities. We are convinced that the robust prevention systems are essential not only for improving health outcomes, but also for strengthening societal resilience, reducing inequalities, and ensuring the long-term sustainability and efficiency of healthcare systems. Slovakia highlights the ongoing Swiss-Slovak health program, which focuses on practical, community-based solutions addressing the root causes of non-communicable diseases and reducing health inequalities through cooperation with local authorities. In the global context, characterized by demographic transitions, environmental challenges, and persistent socioeconomic inequalities, the Slovak Republic regards coordinated international engagement as indispensable. Such cooperation contributes to the strengthening of public health systems, enhances their resilience and responsiveness, and supports the development and implementation of policies that address the underlying determinants of health inequalities, while simultaneously improving the quality of life of all citizens. The Slovak Republic remains committed to international cooperation, solidarity, and shared responsibility in building healthier and more resilient societies. I thank you very much for your attention.
Cedo la palabra.
I give the floor to Uruguay, and I invite Panama to come to the rostrum. President, it's an honor to speak to member states. I would like in particular to highlight Uruguay's historic commitment to the WHO multilateral system as the global network for international health governance. So we join in the discussions on the reform of the global health architecture driven by the United Nations and the WHO, which is people-centered. We have the belief that optimizing resources is improving equitable access, ensuring sustainability of countries. Countries such as Uruguay with healthcare systems that aim to provide universal coverage face the challenge of ever more costly health technologies, which can put a brake on the sustainability of systems. Almost 20 years since the creation of the National Integrated Health System in Uruguay, public financing is the main source of funding for health spending. In 2024, we reached the highest level with 6.72% of GDP, a total cost that represents 9.31% of GDP. Out-of-pocket expenses has remained stable, and this shows that it's possible to have sustainable and universal systems. However, these numbers hide the clear inequality. We need to guarantee integrated responses to children and adolescents in extreme vulnerability is a major priority for our state. We share on the call to tackle the problems of mental health and substance abuse and addictions with integrated strategies. We're also in support of tackling in an integrated manner NCDs and fighting against tobacco use. We are also defending the fundamental right of women to take informed decisions on their sexual and reproductive health. This is key to equity. You will always have an ally in Uruguay to ensure that countries have sustainable, people-centered health systems. Thank you very much.
Cedo la palabra.
I give the floor to Panama and invite Pakistan to come to the rostrum.
Gracias, señor presidente.
Thank you, President. Your Excellencies, ministers and delegates. Panama welcomes the presentation of the report and expresses its support to the work aimed at strengthening the reform of global health architecture under the UNAT reform. This is clear. No country can face the 21st century health threats alone. Pandemics, conflicts, climate change, antimicrobial resistance, and emerging inequalities show that our vulnerabilities are shared, and our responses must also be so. We face the urgent need to have a more consistent and better coordinated and efficient global health architecture. Duplication of efforts in the persistent inequalities continue to limit our joint response efforts. We have a vision that this is a strategic way of having a more inclusive system which is based on the real needs of countries, looking at the technical and regulatory role of the WHO to ensure international health cooperation. Panama promotes the increase on primary health care and the digital transformation of systems, as well as access to medicines and vaccines. We are also aiming to improve the quality and efficiency of healthcare, and we also promote the One Health approach, which looks at human, animal, and environmental health as a joint way of tackling future threats. And we will be part of the Basel, the Bâle, Rotterdam, and Stockholm conventions. We need to take care of our environment at the same time as our health. The WHO must not be limited to just changing structures. We have to be more prepared, more equitable, and more prepared to face our joint threats. Thank you. I give the floor to Pakistan, and I invite Guatemala to come to the rostrum.
Bismillahirrahmanirrahim. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Assalatu wassalamu alayka ya khatamun nabiyyin. Thank you, Chair. Global health stands at a defining crossroads. Our interconnected reality as a global village demands collective action and shared responsibility. Pakistan, a nation of over 260 million people with more than 6.19 million newborns annually, faces significant healthcare challenges. Yet we have achieved measurable progress. We have reduced maternal and child mortality, expanded immunization coverage, and strengthened responses to TB, HIV, malaria, dengue, and hepatitis. Our universal health coverage index has risen from 40 to 56% since 2015. Polio eradication remains our foremost national priority. With sustained efforts and continued support from the Global Polio Eradication Initiative, we are confident of a polio-free Pakistan. Our government has launched a 10-year health and population strategy anchored in a shift from sick care to health care, building resilient primary health system that protects, empower, and uplift every human being, regardless of geography or circumstances. Pakistan has approved its first ever national vaccine policy and is advancing indigenous vaccine production through national and international partnership. We are proud that our 188 medical colleges produce over 22,000 skilled doctors annually, serving Pakistan and the world. We call on the global community for meaningful co-investment in the human capital which belongs to us all. At the global level, on the WHO pandemic agreement, Pakistan will engage constructively to finalize the PAPS annex on the basis of equity, equal footing, and clear legally binding commitments. Finally, calls for efficiency in the global health architecture must never come at the cost of WHO's country's presence or support for developing nations. I thank you, Chair.
I give the floor to Guatemala.
Señor Presidente,
President, Director General, delegates, 6 years on from the COVID-19 pandemic, the country continues to build our national, regional, and global coordination under the approach of One Health. Guatemala is working on interinstitutional coordination in terms of epidemiological surveillance and a timely response to health threats. Regional coordination is strengthened through the approval of our One Health 2026 to 2030 strategy under the Integrated Central American System. Health systems also face considerable challenges because of the growing burden of NCDs. These diseases saturate the health system and are an unsustainable financial burden for any country. In order to work towards true sustainability, we have to tackle the social and commercial determinants of health, promoting physical, social, and policy environments that are more healthy. We need to strengthen policy and strategies aimed at reducing the impact of commercial practices that promote the consumption of products such as tobacco, alcohol, and ultra-processed food. The main risk factors for these diseases. It's only through this structural transformation that we will be able to ensure we have healthy environments, and we tackle the causes of diseases through real promotion of health. None of this can happen without community development, and that's why through the model for the America's primary health care, Guatemala is building local capacities, consolidating a network of resilient healthcare, promoting health which is accessible to all. In addition, Guatemala is thankful for the support of friendly countries with closer links for cooperation. And we would also like to highlight the actions carried out by the Republic of China, Taiwan, and their projects have helped us. Thank you very much.
Como establecimos,
As we said, at 1 p.m., we're already at 1:05. We are going to close the list of speakers because we have other important matters to cover. I'm going to cover a few matters before we close. The Committee on Credentials will hold its first meeting today at 2 p.m. The members of the committee should proceed to room 12. The next plenary will convene in this room this afternoon following the closure of the meeting of the Committee on Credentials. I would like to remind delegates that the strategic round table from COVID-19 lessons to action, the evolution of the WHO emergencies program, will take place today from 1 to 2:15 in the EB room of the WHO headquarters. I would also like to say that we must draw attention to the system of the microphones and our plastic cards which are inserted into the consoles. These help us to correctly identify your delegation. I would kindly ask delegates to refrain from removing cards from the system so that you'll be able to participate in the deliberations without disruption. Thank you for your cooperation. The meeting is adjourned.
Good afternoon, everybody. I will be switching to Spanish at this moment. Continuaremos ahora examinando.
So we'll continue together to look at the following items on our agenda under Protecting Health. 14.1, the update on work in health emergencies, and then 14.2, strengthening the empirical base, the evidence base for public health and social measures. The relevant documents are the following. The relevant documents, I would repeat, are the following: A799, A799 add 1, Diagonal Conference 2, A79 Diagonal Conf 3, and A795. During these discussions, we're invited to provide guidance on the questions raised in the documents A79/9 and A79/9 add 1, respectively. So during the discussions, we are invited to provide input on the questions formulated in documents A79/9 and A79/9 add 1, respectively. With regard to 14.2, the committee is also invited to consider the draft resolution, which can be found in A79A Conf 2, and the draft decision contained in document A79A Conf 3. The financial and administrative impact can be found respectively in documents A79/A/conf/2 add 1 and A79/A/conf/3 add 1. When we adjourned this morning, or at the end of this morning's sitting, a number of delegates took the floor. We also had further requests to speak. The list of speakers can be found on the screen, and at the time of speaking, it should be green. It will switch on automatically when I give you the floor. Please do not push the button again when you are given the floor. That would mean that you would leave the speakers list. Delegates not on the speaking list wishing to take the floor, please press the microphone button now. I shall first of all give the floor to the delegation of Portugal, to be followed by the delegation of Ireland. Portugal, you have the floor.
Thank you. Chair, Excellencies, distinguished delegates, Portugal aligns itself with the statement delivered by the European Union, and it's grateful to the Director General for the reports. At a time when health emergencies are becoming more frequent, complex, and increasingly shaped by conflict, climate change, and financial instability, strengthening preparedness and resilient health systems are a strategic global priority. Portugal therefore commends WHO and its staff for their continued operational leadership in some of the world's most difficult humanitarian settings, often under severe financial constraints and in contexts where healthcare is directly affected by insecurity. The reports remind us of an essential lesson. Preparedness cannot begin when a crisis is already unfolding. It depends on strong surveillance systems, trusted public institutions, resilient primary health care, and sustained investment in the health workforce. Portugal particularly welcomes WHO's work on collaborative surveillance, genomic monitoring, and epidemic intelligence, including the use of digital tools and artificial intelligence to strengthen early detection and response capabilities. We also acknowledge WHO's rapid coordination and technical support in response to the recent antivirus outbreak, demonstrating the importance of timely international cooperation and transparent information sharing. Preparedness also requires sustainable and predictable financing, continued support for essential health services, including vaccination, maternal health, and mental health, and access to essential medicines and diagnostics remains critical to protect vulnerable populations, particularly in humanitarian settings. Portugal remains strongly committed to a multilateral approach to health emergencies grounded in cooperation, trust, and equity. A safer world depends not only on responding faster to crises, but on building stronger systems before crises occur. Thank you.
Muchas gracias.
Thank you, Portugal. Muito obrigado. And I now give the floor to the distinguished delegation of Ireland, to be followed by Tunisia.
With the statement delivered on behalf of the European Union and its 27 member states. Globally, humanitarian crises are increasingly complex and protracted. Climate change, escalating conflicts, and reduced levels of ODA are driving urgent health needs and threaten to reverse decades of progress on health and food security, and undermine the basis for economic growth and stability. We know that women and children are disproportionately impacted by humanitarian crises, not least given the increased risk of sexual and gender-based violence and forced displacement. More than 60% of preventable maternal deaths take place in fragile and crisis settings. The WHO's work to sustain health services and reinforce supply chains is life-saving and a profoundly important expression of global solidarity. Ireland commends the WHO's surveillance effort and success in coordinating and responding effectively to multiple concurrent emergencies. We welcome in particular the effort to protect the health of some of the world's most marginalized and at-risk communities, including conflict-affected communities in Sudan and Palestine. Ireland condemns all attacks on hospitals, healthcare personnel, patients and medical transport in situations of armed conflicts, as well as any misuse of hospitals for military purposes, and reiterates the call for full adherence to international humanitarian law by all parties to a conflict. We take note of WHO's surveillance system for attacks on healthcare as an essential tool for monitoring attacks on health and generating evidence for prevention, protection and accountability. Against a backdrop of rising needs and shrinking resources, Ireland applauds the WHO for its brave and ongoing reform and reprioritization effort, including the Health Emergencies Programme. Together, the WHO Secretariat and its member states, we must collectively work to ensure our national and our global health systems are adequately resourced, are more resilient and better able to prevent, prepare and respond to urgent health needs. Ireland is proud to support the WHO's humanitarian function through unearmarked contributions and flexible, predictable support for the contingency fund for emergencies. Let me conclude by extending Ireland's continued gratitude to the WHO leadership for the exceptional and outstanding commitment to the protection of health and prioritising the needs of the furthest behind in the effort to secure health equity and health security for all. We remain fully supportive of the WHO and the protection of health and well-being, especially for those in crisis. Thank you very much.
Gracias, Irlanda.
Thank you, Ireland. And I give the floor to the delegation of Tunisia, and Singapore would be the next speaker.
Thank you, Chair. Tunisia would like to thank the WHO for the report that was presented to us regarding WHO's work in health emergencies, as well as the report on strengthening the evidence base for public health and social measures. These reports contain very important guidance for all countries, which will enable them to strengthen their capacities for response and resilience. We also appreciate the efforts undertaken by the WHO, which are designed to strengthen response capacities in the event of health emergencies globally, particularly given the complexity of crises that we are facing right now in the world, such as natural disasters, conflicts, and all of these are a danger to the global health system and jeopardize all of the efforts that we have undertaken up until now. We would also like to thank the WHO for the support provided to member states in terms of detection, coordination, medical response and providing emergency equipment despite the financial difficulties faced by the WHO. Tunisia would like to reaffirm the importance of national capacity building when it comes to response and prevention, because that enables us to build more resilient and more sustainable health systems. And based on this principle, Tunisia has developed an action plan to strengthen the response to health emergencies and epidemics. And this program was established with community participation and with the participation of all stakeholders in Tunisia. Ladies and gentlemen, Tunisia believes in the need to build the evidence base for public health and social measures. That enables us to take the right and equitable decisions when faced with health emergencies. Consequently, Tunisia is updating its infrastructure so that we can have digital transformation in Tunisia by collecting electronic data on the health situation in Tunisia and by strengthening the possibilities for telemedicine. We would also like to strengthen cybersecurity with regard to health, and Tunisia supports research and development in the health sector, and we also support the One Health approach, and all of this can help us to strengthen our resilience and our health systems. To conclude, Chair, Tunisia would like to once again thank the WHO for all of the support provided to member states, and we are ever present to cooperate with member states and with the WHO so that we can face the challenges that we are encountering today and in the future. Thank you.
Agradezco a la distinguida delegación de
Thank you to the distinguished delegate of Tunisia. Before I give the floor to the next speaker, I would ask all delegates to observe the speaking time so that we can have a well-structured, flowing discussion. I will now give the floor to Singapore, and the UK will be the next speaker.
Singapore thanks the Secretariat for the reports on WHO's work in health emergencies and strengthening the evidence base for public health and social measures, or PHSMs. We support continued collaboration between WHO and member states to strengthen evidence-informed preparedness and response capacities for health emergencies. Amid increasingly complex outbreaks affecting multiple regions and a growing strain on health systems, continued support for WHO's work in health emergencies is more critical than ever. We are encouraged by WHO's continued efforts to support member states through operational coordination, technical assistance, and emergency response mechanisms. At the same time, member states should continue to strengthen preparedness and maintain national emergency capacities and capabilities. This will help ensure readiness for timely and effective action when needed. The recent hantavirus and Ebola outbreaks highlight the pressing need to further strengthen research and expand the evidence base for PHSMs so that national and global responses can be more timely, coordinated, targeted, and effective. In this regard, Singapore welcomes WHO's efforts to develop master protocols, guidance, and tools to support robust PHSM research and implementation. Thank you.
Gracias, Singapore.
Thank you, Singapore. And I give the floor to the distinguished delegation of the United Kingdom, and Germany will be the next speaker.
Chair, the UK welcomes the Director General's report on WHO's work in health emergencies and acknowledges the scale and complexity of the challenges outlined. We commend WHO and its partners for their responses and extend our heartfelt thanks to all those working to deliver health for all, often in highly insecure and resource-constrained environments. As WHO's largest flexible funder, the UK underlines the importance of predictable and flexible funding and surge mechanisms from member states to enable WHO to maintain rapid response capacity and encourages member states to invest in national preparedness resilience, capacity building and health security systems. The UK agrees that WHO should concentrate WHO country support on core technical functions, leveraging technical networks and collaboration with local and regional organisations. WHO may also wish to partner more effectively with regional organisations to bolster support to regions facing complex crises, to align activities and reduce risk of duplication or protectionism. Given the global reach and often rapid spread of health emergencies, it is also important to recognise that global health resilience relies on us being able to draw meaningfully on the valuable experience and expertise of experts from all parts of the world. We are concerned by the scale of the current outbreak of Ebola and look forward to receiving regular updates. Thank you.
Gracias, Reino Unido.
Thank you, UK. Pleasure now to give the floor to Germany, followed by Cuba.
Thank you, Chair. Germany aligns itself with the EU statement. We commend WHO and its staff for saving lives in health emergencies. Strengthening and coordinating global pandemic prevention and response is a fundamental function of WHO and a core priority for Germany. The Pandemic Hub in Berlin provides us with data and intelligence to act faster and has become a crucial part of the emergency program. But sustainable funding for the emergency program must be ensured, and we continue to be concerned about the funding shortfalls in the program. In this context, we invite countries once again to strengthen the WHO Contingency Fund, which has proven to be an effective and cost-efficient instrument. We underscore the importance of emergency medical teams and the WHO Global Health Emergency Core strategy to ensure an emergency-ready, globally coordinated health workforce in every country. This is a shared effort, as we have seen with the hantavirus and the Ebola outbreak. We thank WHO as well as ECDC and Africa CDC for their support in coordinating the regional and international responses. Finally, we reaffirm our appreciation of the Director General to stand on the side of science and evidence, particularly in the face of rising mis- and disinformation. It is of paramount importance that WHO leadership continues this strong stance as we move into a new era of global public health for all. Thank you.
Vielen Dank. Muchas gracias, Alemania.
Vielen Dank. Thank you very much, Germany. And I now give the floor to Cuba, followed by the Islamic Republic of Iran. Thank you, Chair. Cuba is committed to the promotion of the highest health standards for all, as enshrined in the WHO Constitution. We support the right to health. No political difference, no conflict should imperil the ability of states to provide medical services to their population. We categorically condemn Israel and US's aggression against Iran in flagrant violation of the UN Charter and international law. These illegal military attacks have caused untold damage to the health structure of Iran. Those countries responsible have not reversed their intentions. We see ongoing attacks against Lebanon by Israel, causing a huge cost in lives and destruction of primary healthcare centers and hospitals. International humanitarian law is clear. Hospitals and health centers are protected spaces. Iran's request for health support through the World Health Organization's vigilant system should be implemented, as well as Lebanon's request should be heard, extending the role of the WHO through the provision of essential services and medicines. No healthcare service should have to confront the consequences of illegal aggression. WHO has the responsibility to act and support those countries affected, trying to mitigate the terrible damage caused by these unjustified wars. So we support the draft resolution A79A Conf 2 submitted by the Islamic Republic of Iran and A79A Conf 3 from the Republic of Lebanon. Thank you. Thank you very much, Cuba. I now give the floor to the Islamic Republic of Iran, and China will be the next speaker.
Thank you, Mr. Chairman. Mr. Chairman, my delegation would like to thank the Secretariat for providing the report to us. Mr. Chairman, the Islamic Republic of Iran submitted a draft resolution under Agenda Item 14.1, entitled Protection of Healthcare and Public Health Infrastructure in Conflict Settings, with reference to the situation arising from the recent attacks against the Islamic Republic of Iran. The objective of this draft resolution is to highlight the imperative of protecting healthcare and public health systems during armed conflicts, as well as to mobilize technical support for the WHO for the health system of the Islamic Republic of Iran. In the course of the unprovoked and unlawful acts of aggression against my country, numerous civilian infrastructures, including public health and medical facilities, have sustained significant damage or have been rendered partially or fully inoperable. These attacks represent a serious threat to public health, pharmaceutical security, and health system resilience. Furthermore, the high number of casualties among children and women resulting from attacks on the health infrastructure in Iran constitutes compelling evidence that civilian objects, including hospitals, schools, and maternity centers, have been systematically targeted. As a result of this aggression, 8 hospitals were evacuated and about 30 pharmaceutical and medical equipment manufacturing units suffered partially or total damage. Furthermore, a factory producing hospital supplies and operating rooms was seriously damaged to such an extent that the factory's production line was temporarily halted and several warehouses of pharmaceutical and powdered milk stocks were targeted. It should be added that Pasteur Institute of Iran damaged 3 times in strikes 28 February, 6 March, and 21st of March, and Tawfiq Daru Pharmaceutical Company on 31st of March. The Pasteur Institute of Iran, as one of the reputable scientific research and vaccine production centers at the international level, has suffered heavily in various buildings, laboratory, and equipment sections. Mr. Chairman, in drafting the resolution of Iran, every effort has been made to ensure that the proposed provisions remain strictly within the mandate and competencies of the World Health Organization. We encourage all members to support and to work for the adoption of this draft.
Muchas gracias, Irán. Ofrezco el...
Thank you, Iran, and I will give the floor to China, to be followed by France. And please...
Dear Mr. Chair, the situation between Lebanon and Israel has escalated sharply at a critical moment when civilians are in urgent need of health service to save lives. Military attacks have severely damaged medical institutions in Lebanon and caused heavy casualties, including large numbers of women and children. China is deeply concerned about this situation. We oppose attacks against hospitals and other civilian infrastructure and call on the parties concerned to immediately cease military operations, fulfill their obligations under international law, particularly international humanitarian law, and work toward de-escalation and stabilization of the situation. We also call on the international community to increase assistance to Lebanon and support the country in safeguarding basic livelihoods, including health services. The draft decision proposed by Lebanon is of positive significance in improving local health conditions and alleviating the humanitarian crisis. The crisis involving Iran has led to a continuous increase in the number of displaced persons. Certain countries without authorization from the Security Council launched military strikes against Iran in violation of the basic norms governing international relations based on the purposes and principles of the Charter of the United Nations, therefore severely worsening the humanitarian and health situation in the region. China recently put forward a 4-point proposal for maintaining and promoting peace and stability in the Middle East, and we will continue to uphold an objective and impartial position while actively promoting dialogue and negotiations. China attaches great importance to the draft resolution submitted by Iran. We believe that the sovereignty, security, and territorial integrity of all countries should be effectively respected, that medical facilities must be protected, and that sustained humanitarian access must be ensured. We also believe that actions taken by the WHO should follow the principles of objectivity, neutrality, and professionalism. And thank you.
Thank you, China. France, followed by South Africa. You have the floor. Thank you very much indeed. France would like to associate itself with the statement made on behalf of the European Union. Firstly, we would like to thank the WHO and all member states for their rapid response and coordination in response to the hantavirus and the fake of Ebola. The international cooperation is the best way to protect international health and systems. It's a capacity that is dependent upon our ability to respond quickly and flexibly. France has renewed its commitment for the WHO's contingency fund for health emergencies. We would like to express our compassion for those affected by a health emergency in Gaza, Ukraine, Sudan, Burma. Hospitals are bombarded, staff are attacked. We welcome the ongoing efforts of the WHO and its partners, sometimes putting their lives at risk to bring a rapid and effective response to the populations in the most dangerous areas of the world. France is happy to co-sponsor the resolution for the situation in Lebanon. It welcomes the support for the population of Lebanon, and it's contributing to that through a humanitarian donation of 17 million euros and sending aid and assistance through its UN partners, also through NGOs and the movement of the Red Cross and Red Crescent. The ceasefire is one move forward to putting an end to this lethal conflict and to finding a sustainable outcome. Thank you very much. I now give the floor to South Africa, to be followed by Colombia.
South Africa takes the floor under item 14.1 to express our concern with the escalating tensions in the Middle East region, which have negatively impacted the global economy, affecting the African continent, where the cost of energy, fertilizers, seeds, and other agricultural inputs has increased considerably, threatening the agricultural production and the sustenance of livelihoods. Chairperson, robust public healthcare systems are at the very heart of ensuring the well-being of societies. When they are damaged, along with associated systems they rely on to function, the impact is catastrophic. This is especially the case for the vulnerable, who are least able to protect themselves and most reliant on functioning public healthcare systems during conflict. As such, beyond the injuries and loss of life arising from the United States and Israel's unlawful attacks on Iran, South Africa expresses its grave concern about the destruction of its healthcare infrastructure, including the Pasteur Institute, which is a WHO collaborating center. These attacks have exacerbated the suffering already caused by the imposition of unilateral coercive measures on the country. Tragically, such attacks have become the norm, even though international law provides that civilians and medical personnel and facilities are sacrosanct and must never be targeted under any circumstances. We therefore urge the parties to de-escalate and continue engaging in dialogue rather than beating the drums of war. I thank you.
Gracias, thank you, South Africa. Ofrezco el uso de la palabra a la
Thank you very much. Distinguished delegation of Colombia, you have the floor. Spain, you'll be next. Thank you very much indeed. Colombia would recall the importance of the work of the WHO in the area of health emergencies and in strengthening health and social measures to protect health as a public good. The recent experiences have clearly shown that states confront increased threats, increased in complexity and interconnected. Epidemic outbreaks, humanitarian crises, extreme climate events, and others are bringing huge pressures to bear on healthcare systems and require comprehensive, sustained responses. In this context, Colombia believes that one of the key lessons learned is that states cannot continue with temporary responses against permanent challenges. Strengthening the evidence base for health and social measures is not just a question of working out what works, but how to implement them proportionately and on a timely basis, while preserving public trust and coordinating essential services. Colombia believes it's essential to ensure that states have the conditions to be able to provide ongoing essential services, the protection of staff, health infrastructure, and timely attention to the needs of the most vulnerable, women, children, adolescents, and other vulnerable populations in accordance with international law. In line with this approach, Colombia is continuing to strengthen its surveillance of risks, diseases throughout its territory, including early detection, interinstitutional cooperation, and the provision of essential health services. Colombia considers that preparation for emergency needs to move from an approach based on response to one based on anticipation, assessing the differentiated impact on various parts of the population. Thank you very much. Thank you very much, Colombia. I now give the floor to the delegation of Spain, and the next speaker will be the Russian Federation. Thank you very much indeed. Spain would align itself with the statement made by Cyprus on behalf of the European Union. We welcome the report, and we see the support of the WHO being provided to member states for health emergencies as being essential. We recognize the fundamental leadership role that the WHO has to play in the area of preparedness in response to public health emergencies. The WHO is a source of strength and legitimacy and able to respond to such emergencies, and that is why the strengthening governance and the capacity to respond in emergencies is key. The WHO needs to prioritize these areas, focusing on those most at risk, countries and populations, building resilience in national healthcare systems, and earmarking key resources. That applies to NCDs, violence against women, particularly in conflict situations. It's necessary to promote cooperation with governments, sharing resources and experience. We need to be able to take innovative approaches to ensure maximum impact, prioritizing investments in strengthening healthcare systems for preparedness and surveillance to be able to respond better to future crises. This is particularly important where we are seeing attacks against health infrastructures and health workers. That is a threat to international law. At the same time, the correct implementation according to existing regulations, including international health regulations and the pandemic agreement, are key in order to be able to have a coordinated, effective and rapid response which will mitigate the negative impact on healthcare provision. Hantavirus and Ebola have shown that this is a fundamental principle. Viruses don't recognize borders, so cooperation between countries is a key. And that is why we need to be on the front line. Thank you very much, Spain. And I now give the floor to the Russian Federation. And the next speaker will be Lebanon. Thank you very much indeed, Chair. We welcome WHO's work in the area of responding to outbreaks. Timely response and analysis of the information available in the media in the case of health emergencies is a key part of this work. We need to ensure that we provide information rather than an infodemic. WHO's information needs to identify the real threats and their scale. Hantavirus on the cruise ship we've recently seen saw a whole noise generated around it, which itself constituted a risk. The report on global preparedness identified the risk of a new pandemic. However, such alarmist language can prompt panic. We need to recognize the importance of the huge economic and social consequences. Instead of stabilization and mobilization of international forces, we might see a worsening of the situation. On the 16th of May, the General Director announced an outbreak of Ebola and announced a fake. We are taking a very serious approach to the mobilization of resources that follows on from such an announcement, but we do believe that further consideration is necessary. We believe that identifying the fake in accordance with the international health regulations is not in accordance with the provision of the international health regulation, which the DG was making that decision in accordance with. The statement of a fake has obviously been covered at great length, and this is something that we see as needing to recognize as an issue. We believe that we have the system in order to be able to respond effectively to such outbreaks, and that is something we need to bear in consideration. Thank you.
Agradezco a la delegación de la...
Thank you to the Russian Federation. I now give the floor to Lebanon, to be followed by Egypt.
Presidente, Lebanon aligns itself with the statement delivered on behalf of EMRO. Mr. President, the humanitarian and health situation in Lebanon is gravely alarming due to the Israeli attacks. Lebanon is simultaneously navigating the phases of preparedness, response, and recovery. According to WHO surveillance system of attacks on healthcare, 169 attacks on healthcare have been documented in Lebanon since March 2026. These attacks killed 110 healthcare personnel, injured 255 others, damaged hospitals, medical transport, medical supplies, and forced the closure of hospitals. 3 of them are totally closed, and 45 primary health centers are also closed. In Nabatea Governorate alone, nearly 40% of hospital bed capacity has been lost. The Ministry of Public Health has also recorded a devastating humanitarian toll of 3,920 killed and 9,273 injured, despite the ceasefire violations and attacks continue. WHO has warned that Lebanon's health system is under extreme duress. Distinguished delegates, it is in this context that Lebanon had the honor to introduce the draft resolution entitled Health Emergency in Lebanon. This draft resolution is firmly grounded in the Constitution of the World Health Organization and the relevant WHO mandate and international humanitarian law. It is humanitarian in nature and health-centered in purpose. It seeks neither politicization nor confrontation. Rather, it reaffirms a principle shared by all member states. Hospitals, ambulances, and humanitarian access must be protected at all times, and medical neutrality must be respected under all circumstances. The draft further calls for strengthened WHO emergency assistance and technical support for Lebanon. Distinguished colleagues, attacks on healthcare threaten not only my country, but the integrity and humanitarian norms everywhere.
Gracias, Líbano.
Thank you, Lebanon. And do please adapt your statements to the speaking time. I now give Egypt the floor, followed by Poland.
Thank you, Chair. Egypt supports the draft decision proposed by Lebanon on the health emergency situation in Lebanon, given the Israeli attacks in Lebanon. Egypt expresses its concern vis-à-vis these attacks that have led to a great number of casualties, in addition to the targeting of healthcare facilities. Egypt considers that targeting hospitals, healthcare professionals, and healthcare centers is a violation of international rules and a blatant violation of international law and the basic principles of the WHO, starting with the right to health and without any conditions. We stress the need to protect healthcare facilities and healthcare workers. This is not an option. This is a moral and ethical commitment that we must all uphold. Mr. Chair, Egypt stresses the need to provide international support to the health sector in Lebanon, in addition to the health facilities and hospitals and primary healthcare facilities, in light of the pressures caused by internal displacement. We support the draft decision, which reflects our common commitment to the respect of the humanitarian and health situation in Lebanon. Thank you, Chair.
Gracias, Egipto. Ofrezco el uso de la palabra a la delegación.
Thank you, Egypt. Poland, followed by Ghana.
Thank you, Chair. Poland aligns itself with the statement delivered by Cyprus on behalf of the European Union and its member states. Poland commends the World Health Organization for its essential role in responding to health emergencies and strengthening global preparedness and response capacities. In the post-COVID-19 era, new infectious disease threats continue to emerge, including hantavirus, as well as recurrent outbreaks such as Ebola, recently declared a fake. We welcome WHO's continued monitoring and coordination efforts regarding and underline the importance of timely information sharing, surveillance, and international cooperation in responding to emerging infectious threats. We trust that the lessons learned from the COVID-19 pandemic will continue to inform a timely, coordinated, and evidence-based global response. We also welcome the continued implementation of the international health regulations and underscore the importance of their full and consistent application by all member states. Health emergencies are also driven by human activity. Beyond our borders, the Russian Federation's full-scale war of aggression against Ukraine has now been ongoing for the 5th year. We therefore continue to operate in a prolonged crisis environment. While the duration of the conflict risks generating fatigue within the international community, we must remain vigilant and continuously adapt our response. The war is ongoing, civilians continue to be targeted, and health systems remain under severe strain. Poland strongly condemns all attacks on healthcare facilities as well as on humanitarian and medical personnel. We are drawing lessons from the experience and strengthening our capacities, including through the further development of emergency medical teams. Operationally, the complementarity between governmental coordination and the flexibility of non-governmental actors remain essential. In conclusion, Poland reaffirms its strong commitment to work closely with the WHO and all partners. Thank you so much.
Gracias, Polonia.
Thank you, Poland. The English delegation of Ghana has the floor, followed by the Central African Republic.
Chair, Ghana aligns with the statement developed by Lesotho and Cameroon on the above topic concerning the 47 member states of African region. We thank the Director General for the report on WHO's work in health emergencies and on strengthening the evidence base for public health and social measures. Ghana commends WHO's leadership in advancing the health emergency preparedness, prevention, response, and resilience framework amid increasingly frequent and complex global threats. Climate disasters, disease outbreaks, humanitarian crises, and attacks on healthcare continues to strain national systems, especially in vulnerable settings. We acknowledge progress in collaborative surveillance, laboratory systems, emergency coordination, and access to medical countermeasures. We commend WHO's operational response through the incident management system, health cluster coordination, and technical support to countries facing cholera, mpox, Ebola, and other emergencies. Emergency preparedness must be integrated into resilient health systems and primary health care, not treated as standalone function. It should be embedded in national systems that can prevent, detect, and respond to emergencies whilst maintaining essential services. On the public health and social measures, Ghana recognizes the need for timely context-specific evidence-informed interventions that minimizes social and economic disruption. Risk communication, community engagement, and public trust are critical for adhering and countering misinformation, multi-sectoral collaboration, and investment in institutional capacity for evidence decision-making. In conclusion, Ghana affirms its commitment to the international health regulations, to strengthening health emergency preparedness and response, and to advancing evidence-based public health measures. We support continued collaboration with WHO and partners to build resilient, equitable, and people-centered health systems. Ghana takes note of the reports. Thank you.
Agradezco la intervención de Ghana.
Thank you, Ghana. I give the floor to the Central African Republic, Lithuania being the next speaker.
El micrófono, por favor.
Microphone for the speaker, please.
La République.
Central African Republic would like to thank the Director General for the report dedicated to health emergencies and strengthening preparedness, response, and resilience. In response to health emergencies, we welcome the efforts undertaken by the WHO in 50 health emergencies through 82 countries and territories, as well as the progress made in control of mpox, cholera, and the humanitarian crisis which has been exacerbated by climate change. We welcome the efforts of the DG to counter the reductions of the consequences of the reductions in financing humanitarian assistance, particularly on the most vulnerable countries. In the face of this challenge, we welcome the implementation of the preparedness framework for response and resilience, particularly the strengthening of collaborative surveillance for laboratory capacity, community protection, and equitable access to medical countermeasures. We would like particularly to emphasize the 4 national priorities. Firstly, strengthening epidemiological surveillance laboratories and health safety at borders in order to better detect potential diseases and epidemics. Secondly, control malnutrition caused by insecurity, displacement, and climate change. Thirdly, consolidate primary health care, particularly maternal, neonatal, and infant and reproductive health, which is gravely impacted by the humanitarian crisis. And finally, strengthen the resilience of healthcare systems through the availability of essential medicines, the development of community health, the training of personnel, and better access to emergency services. We call on international solidarity in order to be able to better meet the challenges in an increasingly complex environment. Thank you. Thank you very much to the Central African Republic, and I now give the floor to Lithuania, to be followed by Libya.
Chair, distinguished Chair, Director General, Excellencies, delegates, Lithuania aligns itself with the statement delivered by Cyprus on behalf of the European Union. I am honored to address this assembly as the youth delegate of Lithuania. We thank the Director General for the report on WHO's work in health emergencies. The report makes one message clear. Health emergencies are no longer exceptional events. Climate-related disasters, outbreaks, humanitarian crises, and attacks on healthcare systems are becoming persistent realities, while WHO and member states are increasingly expected to do more with fewer resources. In this context, sustaining the HEPR framework requires human capacity, community resilience, and long-term readiness. Yet young people represent one of the most underutilized resources in global health security. Lithuania is committed to ensuring that youth involvement becomes formal and permanent within national preparedness planning and response. Medical students and young health professionals are already contributing to outbreak investigation and control, vaccination activities, humanitarian assistance, mental health support, and community engagement. We therefore encourage WHO and member states to continue exploring ways to better integrate young people into emergency preparedness and resilience strategies, including by strengthening education, participation pathways, and crisis response training. Preparedness is not built during emergencies. It is built beforehand through education, training, inclusion, and trust. In times of resource constraints, investing in young people is not a burden, but a sustainable way to expand national response capacity. The next generation of health professionals must not only inherit resilient systems, we must help create them. Thank you.
Gracias, Lituania.
Thank you, Lithuania. I now give the floor to the delegation of Libya, to be followed by Brazil.
Thank you, Mr. President. سيد الرئيس، السادة والسيدات الأعضاء، لقد واجهت ليبيا من خلال
Thank you, Chair. Chair, ladies and gentlemen. Chair, during previous years, Libya has undergone a number of crises which have left consequences on the health sector and have had an impact on emergency and hospital care. In 2018, we created a Center for Emergency Medicine in order to strengthen the capacity of the government to respond to medical emergencies and to ensure response in general during conflicts and to strengthen emergency care. And this center has enabled us to deal with a lot of crises, and this includes the natural disaster that we faced in 2023. Currently, we are participating in the WHO program for the International Classification of Emergency Medical Teams, and our team today has obtained the Level 1 certificate. So this is one of the only teams to have this certificate in North Africa. Chair, Libya is counting on your support to strengthen technical cooperation, and we also hope to be able to obtain assistance from specialists and experts on emergency medicine and response to emergencies so that we can identify gaps and assess our needs in that area. And we would like to reaffirm our solidarity to the people of Lebanon, given the situation that they're facing right now. We stand side by side with Lebanon, and we support Lebanon's sovereignty and the integrity of its territorial integrity. We support the draft decision entitled The Health Situation in Lebanon, and we invite everyone to protect medical teams, patients, and civilians in Lebanon, and we reaffirm the importance of providing access to medical teams so that they can help all citizens in remote areas without any restrictions. Thank you.
Thank you, Libya, and I give the floor to Brazil, followed by the Republic of Korea.
Gracias, señor presidente. Mr. Chair,
Under agenda item 14.1, we welcome the progress outlined in documents A79/9 and A79/9 add 1 on WHO's emergency response. Climate shocks, conflicts, and funding gaps continue to strain fragile health systems and threaten essential humanitarian services. We support the HEPR framework's emphasis on collaborative surveillance, community protection, and sustainable financing. At the same time, emergency response must remain anchored in resilient primary health care and equitable resource allocation, particularly in vulnerable settings facing severe operational constraints. Regarding item 14.2, strengthening the evidence base for public health and social measures is a cross-cutting policy priority. As highlighted in document A79/5, effective governance increasingly depends on integrated data systems, analytical capacity, and secure digital infrastructure. We must move beyond fragmented initiatives toward continuous monitoring that assesses both epidemiological and socioeconomic impacts, ensuring proportionate and evidence-based interventions. Brazil is advancing sovereign digital health infrastructure through open data platforms, real-time monitoring systems, and the integration of fragmented health and social information networks. By promoting interoperability, transparency, and stronger analytical capacity, these efforts support evidence-informed decision-making and more resilient and equitable health systems. Evidence without equity remains incomplete. Together, let us build digital foundations that strengthen preparedness, resilience, and solidarity across all borders and communities. Thank you, Mr. Chair.
Muito obrigado, Brasil. Muchas gracias, Brasil.
Thank you, Brazil. And I now give the floor to the delegation of the Republic of Korea, followed by Bahrain.
Thank you, Chair. The Republic of Korea wholeheartedly supports WHO's emergency programs and dedicated efforts that enhance response capabilities in multifaceted threats to health security. We especially welcome the measures undertaken by the WHO to strengthen the foundation of public health and social measures. During COVID-19 pandemic, Republic of Korea implemented a wide range of preventive and social response measures. Nonetheless, we identified limitations in the systematic standards and social inclusiveness of the measures, including unclear level of intervention, application standards, and criteria for lifting restrictions. In particular, the pandemic's impact varied across regions, infrastructures, and socio-economic contexts, underscoring the need for a more precise and balanced decision-making framework. To address these limitations, Republic of Korea has benchmarked WHO's PHSM Decision-Making Navigator and Implementation Package, developing a tailored ROK's PHSM manual. This manual will apply phased social response measures based on a risk assessment-driven decision-making and establish a monitoring framework for pre, during, and post-implementation phases to bring social and economic effect and accessibility together. In addition, we will convene a social response subcommittee composed of diverse experts to review appropriateness and inclusiveness of the implemented measures, addressing potential issues throughout the implementation process. The Republic of Korea remains committed to collaborating with the WHO and all other member states to advance PHSM systems grounded in scientific evidence and social inclusiveness, thereby strengthening the pandemic response capabilities for the future. I thank you.
Agradezco a la República de Corea.
Thank you, Korea. The next speaker is the delegation of Bahrain, to be followed by Panama.
السيد الرئيس تؤكد مملكة البحرين أهمية
Chair, the Kingdom of Bahrain would like to reaffirm the importance of the conclusions of the report on WHO's work in health emergencies. It is indeed necessary to strengthen flexibility and resilience to all measures, and it's also important to build the capacities of emergency intervention teams. Bahrain has created a program designed to build capacities to adopt modern technology when responding to health emergencies. Bahrain has also modernized its national action plan and has adopted a strategy based on factual data. We reaffirm the importance of scientific knowledge when taking effective measures that will enable us to deal with health emergencies. Under item 14.2, Bahrain appreciates the efforts undertaken by the WHO, which enable us to strengthen the evidence base for public health and social measures. That is essential, which will help us to take measures based on scientific data. Bahrain has adopted an initiative for a society that is very aware when it comes to health technologies, and we are also looking at adopting these technologies at a society level. We are also trying to limit the indirect consequences of certain interventions. Thank you, Chair.
Agradezco a la distinguida delegación de Bahrein.
Thank you, Bahrain. I now give the floor to Panama, followed by Jordan. Thank you, Chair, and thank you also to the work of the WHO and health emergencies. We note the progress achieved and also the ongoing challenges and the strengthening of the evidence base of public health and social measures. The global panorama is increasingly complex, with multiple parallel crises aggravated by climate change, conflict, and fragile health systems. Recent experience, in particular during large-scale health emergencies, has shown that public health and social measures such as physical distancing, the use of masks, or community interventions are essential tools to protect a population's health. However, they're not effective unless there can be robust scientific evidence which is timely and contextualized. So we agree that strengthening the evidence base is key in order to guarantee decisions that are proportional, effective, and equitable. As the report notes, member states have underscored the fundamental role of evidence to guide decision-making, particularly in emergency contexts. There are significant challenges, though: limited resources, generation gaps, gaps in the generation and use of data, as well as the need to integrate a multi-sectoral focus, continuing to hamper the effective use of these measures. So it's essential to strengthen in research, international cooperation, and knowledge exchange based on evidence. We call on the WHO and member states to continue investing in robust data systems and the capacity for research into cooperation between sectors in order to establish a robust evidence base which allows more effective response to future health emergencies. We reaffirm our commitment to cooperate with the WHO and member states to build resilient healthcare systems which are capable of anticipating, detecting, and effectively responding to future emergencies based on evidence, focused on persons, and oriented and guided by equity. Thank you. Thank you, Panama. I now give the floor to Jordan, followed by Israel.
Bismillah ar-Rahman ar-Rahim. I'm honored to deliver the statement as co-chair of the Group of Friends for the Declaration of Protection of Humanitarian Personnel. This statement is delivered on behalf of the Ministerial Group of the Protection of Humanitarian Personnel, namely Australia, Brazil, Colombia, Indonesia, Japan, Sierra Leone, Switzerland, and my own country, Jordan. We recognize the WHO's central role in coordinating and responding to multiple concurrent health emergencies. We commend its staff on the ground for their exceptional dedication and resilience, often under the most challenging circumstances. We are deeply alarmed by the escalating threats to the safety of medical and humanitarian personnel, particularly local personnel who continue their work aimed at armed conflicts and increasing attacks on staff, assets, facilities, and the communities they serve. International humanitarian law is clear. Medical personnel are specifically protected. Medical and humanitarian personnel must be protected and respected, yet this alarming trend persists. In 2025 alone, at least 335 humanitarian personnel were killed. WHO surveillance records 284 medical personnel impacted by attacks on healthcare over the past year. We also condemn in the strongest terms actions that have resulted in the killing of the United Nations peacekeepers and significantly increased the risks faced by the medical and humanitarian personnel. To date, 112 member states have endorsed the Declaration on the Protection of Humanitarian Personnel, reaffirming their commitments to respect international humanitarian law, to strengthen protection, prevention, and accountability. The declaration, alongside with the UN relevant Security Council resolutions, including 2286 and 2730, and the Global Initiative to galvanize political commitment to international humanitarian law, reinforce obligations under international humanitarian law while underscoring the imperative to protect those delivering care in crisis settings. Attacks dedicated against those who save lives violate the very rules designed to protect them, harm vulnerable communities, and undermine our shared humanity. As WHO considers how best to protect its efforts and partnership in increasingly complex emergencies, we urge the Assembly to seize this moment. Now it's time to act to our collective commitment to respect and uphold international humanitarian law, including to protect those who act to protect others. I thank you.
Gracias, Jordania. Ofrezco el...
Thank you, Jordan. And I give the floor to the delegation of Israel, to be followed by Japan.
Israel objects to the draft resolution as tabled in Conference Paper 2. The text before us presents a selective and deeply problematic narrative. It makes serious allegations and reaches conclusions that have neither been independently established nor properly examined through impartial mechanisms. Equally concerning is what this draft omits. There is no acknowledgement of the broader regional context, including Iran's long-standing role in fueling instability through support, financing, and arming of terrorist organizations and armed proxies across the Middle East. Those groups, including Hamas and Hezbollah, as the Lebanese delegate explicitly elaborated about, and others, have systematically abused civilians and health infrastructure for military purposes. Beyond Iran destabilizing regional conduct, it is striking that this resolution remains entirely silent on the Iranian regime's own grave record concerning the right of health and the population of civilians. The right to health begins with the right to life and physical...
Una pausa. Se ha levantado un punto de orden.
Point of order.
Hay un punto de orden. Ahí está. ¿Se ha registrado un punto de orden? ¿Alguien
We have received a request for a point of order. The statement has been interrupted. If that's not the case, right, point of order.
Irán puede proceder explicando su...
Iran, please go ahead and explain your point of order.
Estamos habilitando el micrófono.
We're just turning on your mic.
Thank you, Mr. Chair. We object the statement made by the Israeli regime representative. The context of the presentation he just made is irrelevant to the context of the agenda item is under consideration. Thank you.
Gracias por su comentario.
Thank you for your comment, and we return the floor to the representative of Israel. The watch having been paused. Please go ahead.
Thank you, Chair. The right to health begins with the right to life and physical safety. Yet the Iranian authorities have repeatedly responded to peaceful demonstration with lethal force, including the shooting of protesters, extrajudicial killing, and widespread violence against civilians. Such actions constitute among the gravest possible violation of public health and human dignity. Equally alarming, the consistent finding by UN mechanism documenting the systematic denial of adequate medical care to detainees, including political prisoners, women, and human rights defenders.
Se está levantando nuevamente un punto de orden. Veo a la delegación.
A point of order is being raised. I see the delegation of Iran.
Me gustaría recordar que si se trata de un...
I'd like to remind you that if you wish to exercise your right of reply, that is something that can be expressed at the end.
Es un punto de orden.
It is a point of order.
Mr. Chair, through you, we urge everybody in this room that talked in context of the draft resolutions and subject of the agenda item. Referring to domestic issues falsely and unbiased and biased and unprovoked issues would be against the cause of this assembly. Thank you.
May I proceed? Thank you, Chair. We cannot assume the killing of the Iranian civilians a domestic issue, but okay. We are particularly troubled by the resolution attempts to instrumentalize WHO and advance one-sided political narrative. WHO is not a judicial body, nor it should become a platform for a political, motivated, country-specific resolution that selectively address conflicts while ignores equally grave situation elsewhere. If member states genuinely wish to advance the protection of healthcare in conflict settings, they must address the full reality of threats to healthcare, including the militarization and exploitation of medical facilities by terrorist organizations, the diversion of humanitarian medical resources to the use of civilians as a human shield. Easily cannot support this text and calls for member states to oppose it. Thank you.
Agradezco a la delegación de Israel.
Thank you to the delegation of Israel. Before continuing with our discussion, please do recognize that points of order are a procedural matter and different to the right of reply being exercised in a debate. I just want to make that point because it's important to keep our debate flowing and very much in line with the principles and rules followed by this committee at the WHO. I'll now give the floor to Japan, to be followed by Norway.
Thank you, Chair. We would like to express our appreciation for the continued efforts of WHO and its partners in responding to health emergencies. In the recent challenging global health environment, it is essential to ensure strategic prioritization of limited resources, as well as strengthen collaboration across organizations. In this context, Japan believes that it is critical for WHO to focus on its core functions based on its comparative advantage, giving priority to infectious disease response, surveillance, and international coordination. At the same time, it is also important to strengthen collaborative partnerships with a clear division of roles among humanitarian organizations, development agencies, regional institutions, and the private sector. Given the diverse health security needs under current resource constraints, Japan emphasizes the importance of balancing equity and sustainability. Prioritizing the most vulnerable populations in resource allocation is more important than ever, while strengthening health systems and institutional foundations through the amended IHR. Japan will also continue to contribute in cooperation with the international community, including through the vaccine donations and dispatch of emergency medical teams and infectious disease response teams. We recognize that effective responses to health emergencies, particularly for infectious disease, require not only medical care, but also robust public health and social measures. In this regard, we particularly welcome the emphasis on decision-making that takes into account equity and social impact during emergencies. Japan remains committed to advancing evidence-based, effective, and trusted public health and social measures. I thank you, Chair.
Muchas gracias al distinguido.
Thank you, Japan. And I'll now give the floor to Norway, followed by the Dominican Republic.
Thank you, Chair. We welcome the Director General's report and commend WHO's leadership in responding to acute and protracted health emergencies across 82 countries and territories. As resources shrink, difficult choices are being made with serious consequences. We note with great concern that the need to hyper-prioritize the global humanitarian overview in 2025 resulted in reduced or no access to health services for 52.6 million people. Adequate and predictable funding for WHO's Health Emergencies Program is critical. The withdrawal and sharp reduction from the fund's traditionally largest donors are deeply worrying. Women and girls of all ages remain disproportionately affected from acute and protracted health emergencies. We urge all donors to ensure that sexual and reproductive health services are integrated within life-saving health services. We remain deeply troubled by the continued attack on health facilities and health workers. These attacks are clear violation of international humanitarian law with major negative consequences for civilians, patients, and health personnel. We call on all parties in conflict to respect international humanitarian law and to ensure that the human rights of civilians are protected. I would lastly like to reiterate Norway's support to WHO for their work on public health and social measures. Our WHO Collaborating Centre is ready to continue our joint efforts in this field. I thank you.
Gracias, Noruega.
Thank you, Norway. Dominican Republic has the floor, to be followed by Morocco. Thank you very much. Chair, the Dominican Republic would also express its concern with regard to the increase in health emergencies in humanitarian crisis and conflicts. We support the international calls for the respect of international humanitarian law and access without restriction of health assistance. We recognize that the current landscape for health emergencies is marked by epidemic outbreaks, humanitarian crisis, climate change, and finance limitations. In this situation, we would reaffirm our commitment to strengthening the health emergency prevention, preparedness, response, and resilience in accordance with the guidance of the WHO. It is essential, we believe, to move towards a sustainable financing mechanism based on an equitable approach which allows countries of medium income to strengthen their national capacities without depending solely on external assistance. The sustainability of healthcare systems requires political will, international cooperation, and financial commitments over the long term. We also reaffirm our belief in the importance of a high level of vaccine coverage, epidemiological surveillance, and keeping communities' trust in vaccines. We welcome the role of cross-border cooperation, particularly in those areas of high cross-border mobility, such as the Caribbean. We welcome emergency medical teams, which is a WHO initiative getting further promotion, recognizing the key role they play in high-impact emergencies. We reaffirm our commitment to multilateralism and the effective implementation of instruments to address emergency situations. Thank you very much. Thank you to the Dominican Republic, and I'd now give the floor to Morocco, to be followed by Tanzania.
Merci, Monsieur le Président. Thank you, Chair. Delegates, the Kingdom of Morocco welcomes the report of the Director General on WHO's work in health emergencies, which offers a rigorous and comprehensive overview of interventions conducted in 2025 during 50 emergencies covering 82 countries and territories. We welcome the rigor of the health surveillance system based on the analysis of almost 500,000 messages, as well as the coordination with more than 1,500 partners of the health sector group. The guidance of this report are fully in line with Morocco's priorities. The COVID-19 pandemic enabled our country to build a resilient health system built around reform of the national health system and operationalizing emergency public health operation centers and strengthening rapid response teams. Morocco fully supports the One Health approach and has initiated multi-sectoral action when faced with zoonotic and climate threats, which is an aggravate in collaboration with veterinary, environmental and agricultural sectors. Health resilience cannot be achieved without sustainable, predictable and equitable financing. We call for consolidating the pandemic fund with strengthened accessibility for middle-income and low-income countries. Our country would like to express its desire to actively contribute to implementing the new amendments to the IHR and to drafting the pandemic agreement with emphasis on solidarity and equity in access to medical countermeasures. Morocco recommends stepping up national capacity buildings for surveillance and laboratories, in particular in middle-income countries, increasing the local production of essential vaccines in Africa, strengthening the integration of the climate crisis in preparedness to health emergencies, and guaranteeing the protection of health establishments in conflict zones, and finally assuring the rapid mobilization of human and logistical resources in the event of crises in a spirit of international solidarity. Thank you.
Muchas gracias, Marruecos.
Thank you, Morocco. I now give the floor to the delegation of Tanzania, to be followed by Bulgaria.
Thank you, Chair. The United Republic of Tanzania commend WHO for its continued leadership in advancing global preparedness in response to health emergencies and aligning with the statement delivered on behalf of the African region. The growing frequency and complex of health emergencies driven by disease outbreak, climate change, and humanitarian crisis require sustained and strategic investment in resilient health system. Tanzania emphasized a balanced approach that integrates immediate and long-term interventions, including more investment in surveillance, laboratory capacity, workforce development, and One Health approach. Chair, Tanzania proposed the following key priorities: directing resources to the most vulnerable setting based on country-specific risk profiling, scaling up predictable financing alongside domestic resource mobilization, institutionalizing core capacities, including Public Health Emergency Operations Center, workforce development and simulation exercise, and strengthening multi-sector system, including integration with the climate, disaster risk management, and local manufacturing. In conclusion, Tanzania reaffirms its commitment to strengthening national and global health security in alignment with international health regulation and global framework. We call for sustained solidarity, strategic coordination, and collective responsibility to address current and future health emergencies. I thank you.
Agradezco la intervención de Tanzania.
Thank you, Tanzania. And I'll now give the floor to Bulgaria to be followed by Malaysia.
Chair, Bulgaria welcomes the DG report on item 14.2. Experience shows that investments in sustainable research capacity are the most effective. Good policies encourage multidisciplinary research combining epidemiology, clinical medicine, public health, behavior sciences, economics, sociology, and anthropology, as the effectiveness and impact of public health and social measures cannot be adequately assessed from a biomedical perspective alone. Among the key opportunities are the growing volume of scientific data and digital tools, including the Public Health and Social Measures Knowledge Hub, which facilitate access to global and local evidence. At the same time, there is still a significant gap as regards limited capacity to interpret and apply evidence, insufficient consideration of social and cultural context, and a lack of systematic mechanisms for tracking public attitudes and behavior. In this context, the implementation of social listening mechanisms, including analysis of public attitudes, trust, misinformation, and behavioral responses, can complement quantitative epidemiological data and support more adaptive and timely decision-making and contribute to the design and targeting of social measures. The Secretariat can play a crucial role by assisting Member States in building competences for conducting PHSM policy-oriented research. In conclusion, WHO could also present a systematic, multidisciplinary and community-oriented approach, combined with innovative tools such as social listening. It is essential for building a reliable evidence base and making effective, fair and contextually appropriate decisions on measures in future health emergencies. I thank you.
Muchas gracias a Bulgaria.
Thank you, Bulgaria. I'll now give the floor to Malaysia to be followed by Lesotho.
Mr. President, Malaysia thanks the DG's timely report on health emergencies and affirms Malaysia's commitment to constructively working with the WHO to advance its objective. Malaysia takes note of the draft resolution tabled by Iran under this agenda item. Malaysia is deeply concerned by the impact of military aggression on healthcare systems and critical public health infrastructure. We are alarmed by the reported damage affecting health-related and scientific institutions, including facilities supporting disease surveillance, outbreak detection, and public health preparedness. Malaysia reiterates that civilians, healthcare personnel, hospitals, ambulances, and medical facilities must be respected and protected at all times in accordance with international humanitarian law. At the same time, Malaysia reiterates the urgent need for de-escalation, cessation of hostilities, and constructive dialogue. Sustainable peace remains essential to safeguarding public health and protecting civilian populations. Mr. President, Malaysia also welcomes the draft decision entitled Health Emergency in Lebanon. Malaysia condemns the military attacks against Lebanon. The disruption of health services and large-scale displacement is creating another humanitarian catastrophe. On both fronts, Malaysia supports continued efforts by WHO and member states to assist in the rehabilitation and restoration of affected health infrastructure, strengthen health system resilience, and ensure continued access to essential medicines, medical equipment, and healthcare services. I thank you.
Agradezco la distinguida.
Thank you to Malaysia. Lesotho has the floor to be followed by Australia.
Presiono nuevamente el botón.
Can you press the mic button again, please, delegation of Lesotho?
Okay, thank you, Chair. Lesotho has the honor to deliver the statement on behalf of the African region. We thank the Secretariat for the comprehensive reports on WHO's work in health emergencies, strengthening the evidence base for public health and social measures. The African region commends WHO for its leadership in responding to increasingly frequent and complex emergencies driven by outbreaks, conflict, climate-related disasters, and humanitarian crises. We take note that in 2025, WHO responded to 50 emergencies across 82 countries and territories, including 20 Grade 3 emergencies. We welcome progress in strengthening the HEPR framework, including collaborative surveillance, laboratory systems, emergency coordination, and access to medical countermeasures. WHO supported 179 laboratories in 136 countries and trained nearly 5,000 public health intelligence professionals to strengthen preparedness and response capabilities. The African region commends the intensified response to Mpox. In 2025, 98 countries reported more than 52,000 confirmed cases and 215 deaths, with the African region bearing the highest burden. Through the WHO-led access and allocation mechanism, more than 5 million vaccine doses were delivered to 16 African countries. We remain concerned about the worsening cholera situation globally, with over 614,000 suspected and confirmed cases and more than 7,000 deaths reported in 2025. We commend the WHO and partners for supporting vaccination campaigns targeting approximately 50 million people. Africa Region recognized the critical role of health clusters and humanitarian partners who reached 32 million people through health facilities and mobile clinics despite severe funding constraints. We remain deeply concerned that funding reductions have disrupted services in over 6,000 health facilities, leaving 52 million people with reduced or no access to health care. We are equally alarmed by continued attacks on health care facilities and personnel, with WHO verifying over 1,300 attacks. We therefore call for stronger surveillance systems, protection of healthcare workers and infrastructure, and sustainable financing to safeguard essential capacities. Finally, we reaffirm our collective commitment to solidarity, equity, and international cooperation in strengthening preparedness, response, and resilient health systems for all. I thank you.
Muchas gracias, Lesotho.
Thank you, Lesotho. I now give the floor to the delegation of Australia, to be followed by the Maldives.
Australia is deeply concerned by the situation in Lebanon. Over 2,500 people have been killed and more than 1.2 million civilians have been displaced. We also strongly condemn Hezbollah's attacks against Israel. The human cost of this conflict is mounting. Australia calls for de-escalation and for all parties to uphold international humanitarian law. Civilians and civilian infrastructure must be protected from the effects of hostilities. Israel and Lebanon's agreement to extend the US-brokered ceasefire is an important step forward. We call on all parties to the conflict, including Hezbollah, to adhere to it. Australia supports calls for the protection of health facilities, personnel and transport, and for ensuring safe and unhindered access to essential humanitarian assistance and health services. In April, over 50 countries signed on to an Australian-led joint statement on the protection of aid workers in Lebanon, and in September 2025, over 100 nations launched the Declaration for the Protection of Humanitarian Personnel, committing to protect aid workers in conflict zones. We will continue working together to ensure that health and humanitarian personnel that work tirelessly to save the lives of others do not have to sacrifice their own. Thank you.
Gracias, Australia.
Thank you, Australia. And I now give the floor to the Maldives, to be followed by Senegal.
Un instante, hay que habilitar su micrófono.
Just a moment, we need to turn your microphone on.
¿Puede hacer uso de la palabra?
You can now speak.
¿Puede hacer uso de la palabra? El micrófono está encendido.
Your microphone is on. You should be able to speak.
Monsieur le Président, distingués délégués.
The delegation of Senegal would like to align itself with the statement made by Lesotho with regard to health emergencies. We take note of the report of the Director General of the WHO's work in the area of health emergencies, and we congratulate the DG and his teams for their work in a very financially tight situation. Despite the budget cuts and the drop in humanitarian assistance, the WHO has been able to have a huge impact, contributing to saving lives and impacting the lives of millions of vulnerable people. Responding to increasing humanitarian growth, increasing humanitarian requirements, Senegal believes that the WHO should continue to play a leading role, strengthening partnerships with UN agencies, specialized agencies, financial institutions and the private sector. That's an integrated approach which recognizes the importance of responding to complex crises, particularly in those regions exposed to conflicts, epidemics and climate events. Senegal recently has had to face epidemics and has clearly understood the importance of strong cooperation between health authorities, technical partners and communities. This has all taken place in a limited financial context, emphasizing the importance of sustainable partnerships. We believe that emergency responses and sustainable investments do not compete with one another but complement each other. The WHO can encourage the establishment of national financial systems for domestic emergency funds, national sponsorship and solidarity community mechanisms. During COVID-19, we successfully experimented with such national campaigns, good practices which should be shared and recorded. We encourage the WHO to continue its leadership, to continue to innovate and support member states. Thank you very much. Thank you, Senegal. And I now give the floor to the Maldives. Turkey to follow.
Thank you, Chair. Maldives appreciates the Secretariat for the reports under these agenda items and appreciates the response by WHO in the ongoing disease outbreaks and crises. The report underscores that health emergencies are becoming more frequent and complex, demanding strengthened prevention, preparedness, response, and resilience capacities at all levels. For small island developing states, the indirect impacts of global instability through supply chain disruptions, economic shocks, and constrained resources further weaken preparedness and response capacities. Maldives underscores the urgent need to protect healthcare workers, facilities, and patients in all settings. We call for strengthened global solidarity to ensure uninterrupted delivery of essential services, including reproductive, maternal, and mental health care, particularly for women and vulnerable populations. We note the significant financing gaps affecting emergency response. Sustained, predictable, and equitable financing is critical to ensure that no country is left behind in strengthening preparedness. The Maldives is deeply concerned by the growing impact of violence and conflict on health systems and populations worldwide. The report highlights alarming levels of attacks on healthcare, disruption of essential services, and the disproportionate burden borne by populations in fragile and conflict-affected settings. We call upon WHO and partners to continue supporting member states in building resilient systems, ensuring preparedness investments translate into timely and effective responses. Thank you, Chair.
Gracias, Maldivas. Ofrezco el uso de la palabra.
Thank you, Maldives. I now give the floor to Turkey, to be followed by Ethiopia.
Turkey thanks the Secretariat for both reports. The increasing scale and complexity of health emergencies driven by climate change, conflicts, and outbreaks requires stronger national capacities and a more coordinated global response. Bearing this in mind, we would like to emphasize the critical importance of building resilient health systems, providing sustainable and predictable financing, and continuing to protect healthcare in conflict settings. Strong primary healthcare, integrated emergency services, and a protected health workforce are essential for effective preparedness for and response to health emergencies. Strengthened support for WHO's contingency mechanisms is needed. We also underscore the fact that attacks on health facilities and personnel are unacceptable and severely limit access to care. Dear colleagues, Turkey emphasizes the importance of strengthening the evidence base for public health and social measures. As we all acknowledge, effective PHSM require robust and timely data, multi-sectoral research, and transparent evidence-based decision-making. As we bitterly witnessed during the COVID-19 pandemic, public trust is essential. Therefore, risk communication and community engagement must be integral to national health policies. PHSM should remain proportionate, equitable, and context-specific, particularly for vulnerable populations. Turkey lastly reaffirms its commitment to strengthening global health security through solidarity, equity, and effective multilateral cooperation under WHO leadership. I thank you.
Gracias, Turquía.
Thank you, Turkey. I now give the floor to the delegation of Ethiopia, to be followed by Kuwait.
Chair, Ethiopia aligns the regional statement delivered by Lesotho on behalf of the 47 member states of the WHO Afro regions and thanks the Secretariat for both reports. Ethiopia's experience highlights both progress and challenges in the health emergency response. The successful containment of the Marburg outbreak in 2025 was made possible by strong national institutions and infrastructure, sustained investment in health system strengthening activities, and rapid response and coordinated support from partners. The current outbreak with Ebola are real reminders to the need of early preparedness, readiness, and response. We support to sustain implementation of the Health Emergency Preparedness, Response and Resilient Framework, including sustainable financing. Ethiopia welcomes the recently launched Global Health Emergency Corps strategy with an ambitious target of 10% readiness benchmark in every country by 2030. We call upon member states, WHO, and partners to join hands in building an emergency-ready health workforce and enhancing national capacity. Regarding agenda item 14.2, we support the development of an evidence-based for public health and social measures and call for strengthening capacity for public health and social measures, research and implementation, including context adaptation and real-time analytics. Ethiopia also encourages strong regional learning platform and exchange of best practice across member states. Thank you.
Agradezco a la delegación de Etiopía.
Thank you, Ethiopia. I now give the floor to Q8, to be followed by Barbados.
Thank you, Chair. Kuwait wishes to thank the Director General for the report, and we consider that the WHO plays an important role in supporting member states and in facing the increasingly complex health emergencies. Our region has witnessed a great escalation during recent months that have destabilized health security. The Gulf countries have been facing increasing challenges as a result of the targeting of infrastructures and the disruption of supply supply chains, including the disruption of provision of medication and essential services. Kuwait reaffirms that any targeting of civilian infrastructure and vital infrastructure related to the water, energy, or transportation is a direct threat to the health systems and their capacity to provide essential services to citizens, particularly in times of emergencies and conflicts. In this regard, we stress the importance of strengthening the preparedness and capacities of healthcare and medical workers on the basis of evidence. In conclusion, Kuwait aligns itself with the GCC countries and the Arab group, in supporting the draft decision proposed by Lebanon entitled Health Emergency in Lebanon as a result of the recent attacks targeting Lebanon. Thank you, Chair.
Gracias, Kuwait. Permítanme ofrecerle el uso de la palabra.
Thank you, Kuwait. And I give the floor to Barbados, to be followed by Madagascar.
Thank you so much, Director General, Mr. Chair, distinguished delegates. The World Health Organization, based on its track record of early response and interventions in global health emergencies, is blessed, placed, and equipped to respond to health emergencies in a timely and appropriate manner. This is particularly critical as in the early stages of emergencies, member states such as Barbados and other small island developing states may not have the human, technical, and financial capacity to respond. Health emergencies can take the form of varied threats, such as climate change events, to which the Caribbean is particularly vulnerable, to hurricanes, acute outbreaks of infectious diseases, including COVID, and now Mpox and Ebola. We remain extremely grateful for the invaluable response offered to Jamaica on the passage of a Category 4 Hurricane Melissa. Barbados is supportive of a contingency fund for emergencies which allows the WHO to respond within 24 hours of an alert and supports member states in meeting its obligations to the international health regulations. In this regard, Barbados is particularly happy with its designation of the Best DeSantis Public Health Laboratory as a collaborating center for influenza and antimicrobial resistance. Finally, we urge the Secretariat to continue to make this matter a top priority through its international reach and through collaboration with like-minded international organizations. We further support the WHO making young children, girls, and women a priority in response to future emergencies. I thank you.
Gracias, Barbados. Ofrezco el uso de la palabra.
Thank you, Barbados. Madagascar, you have the floor.
Merci, Monsieur le Président, pour la parole.
Thank you, Chair, for giving us the floor. We would like to thank the WHO Secretariat for the report before us on strengthening health emergency prevention, preparedness, response, and resilience. The lessons learnt from COVID-19 cyclones, the outbreak of, for example, Mpox, have demonstrated the importance of having integrated surveillance systems, multi-sectoral cooperation, laboratory networks, and a solid evidence base. We welcome the efforts of the WHO to strengthen the current basis for public health and social measures, and also the context for adopting measures which can be applied and accepted by communities. In the context of the IHR, we believe that the One Health approach is effective, as well as the development of integrated surveillance, laboratory networks, and the implementation of national plans for health security. We also welcome the rapid assistance provided by the WHO to Madagascar in the context of the impact of tropical cyclones and the efforts to help in the affected zones. A number of challenges remain: sustainable financing and the increasing impact of climate change. We would reaffirm our commitment to working together with the WHO and other partners to increase the resilience of the healthcare system. Thank you very much indeed.
Muchísimas gracias. Ofrezco el uso de...
Thank you very much. I now give the floor to Chile, to be followed by Algeria.
Muchas gracias, señor presidente.
Thank you very much, Chair. We welcome the report and acknowledge the work done by the WHO in the area of strengthening health emergency prevention, preparedness, response and resilience in the context of complex and prolonged and increasingly challenging crises. We need a strategic approach which is based on risk, vulnerability and health impact, particularly in complex humanitarian environments where the threats to health are greater and the situations are. We welcome the progress made in the area of cooperative vigilance, the strengthening of laboratories, epidemiological intelligence, community protection, access to medicines, and emergency coordination. The hantavirus and other viruses make us aware that we need ongoing epidemiological surveillance, communication of risk, territorial management, and intersectional cooperation under the One Health approach. Financial restrictions at the moment should not compromise global health security. We need sustainable financing which can be predictable and coordinated, which enables the capacities to be maintained between crises, vigilance and oversight to be maintained, and communities to be given due help in order to be able to respond to new challenges. We acknowledge the report and the importance of having a more effective, resilient global health architecture based on evidence in full recognition of the need for committed healthcare systems. Thank you very much. Thank you to the distinguished delegation of Chile. And I will now make a slight change to the list and give the floor to Oman. And Algeria will be the following speaker.
Thank you, Chair. Oman expresses its appreciation for the efforts of the WHO and its work in responding to health emergencies. Oman follows with concern the health situation in Lebanon as a result of the ongoing Israeli aggression that has led to a lot of casualties and destruction of infrastructure, essential health infrastructure. In this regard, Oman wishes to align itself with the countries supporting the draft decision proposed by Lebanon and other countries. Thank you very much.
Thanks to the distinguished delegate from Oman, and I now give the floor to the delegation of Algeria, to be followed by Switzerland. Algeria aligns itself with the statement by Lesotho on behalf of the African Group, and we thank the DG for the detailed report of the WHO's work in health emergencies. We note with grave concern the increase in the complexity of health crises and emergencies throughout the world. The report outlines the scale of the challenge which our healthcare systems are facing, particularly in fragile humanitarian contexts. The considerable efforts made by the WHO deserve our recognition, particularly Mpox, Ebola, hantavirus. We also notice with great concern the lack of financing for WHO emergency management, health emergency management, and its ability to respond is going to be detrimentally affected without sustainable financing. WHO should be focusing on its strategic priorities. My country particularly believes that a multi-sectoral approach is essential. The IHR committee should be able to assess what is necessary at the national level and able to mitigate such health emergencies. We believe that the respect for humanitarian and medical assistance is key, a key part of the WHO's work in intervening to mitigate suffering in zones of conflict. Thank you. Thank you, Algeria. And I now give the floor to Switzerland, to be followed by Croatia.
Monsieur le Président. Chair, Switzerland welcomes WHO's commitment when faced with crises that are ever more complex. However, we remain concerned by the financial situation of the health emergency programme, which risks affecting the swiftness of response while needs are increasing. Sustainable financing remains vital. However, the WHO cannot act alone. An effective response requires strengthened partnerships with humanitarian systems and with national health authorities. While taking into account the added value of the WHO, it is key to improve coordination and access for the most vulnerable populations. We would like to also express our concern when faced with the persisting attacks against health personnel and health establishments which compromise access to care. Switzerland recalls that international humanitarian law must be respected under all circumstances. We support the essential work of the WHO, which is designed to document these violations and to promote preventive measures. In the current context, it is furthermore crucial to strengthen the role of emergency medical teams, which enable the swift deployment of qualified medical teams during health and humanitarian emergencies. EMTs support national capacities and ensure the continuity of essential care. Finally, the Contingency Fund for Emergencies continues to be an essential mechanism for guaranteeing a swift and flexible response to emerging crises. Given the current financial constraints, predictable financing is vital in order to avoid critical delays in the supply of medicines, medical provisions, and operational support. Thank you.
Je remercie la délégation de la Suisse.
Thank you, Switzerland. And I now give the floor to the distinguished delegation of Croatia, to be followed by Guinea.
Chair, Director General, Excellencies and distinguished delegates. Croatia welcomes the report of Director General on the WHO's work in health emergencies and the update on strengthening health emergency prevention, preparedness, response and resilience. We recognize the growing complexity of health emergencies, including those linked to the natural hazards, climate-related events, outbreaks and humanitarian crises. In this context, Croatia supports WHO's continued efforts to strengthen preparedness, surveillance, emergency coordination, community protection, access to medical countermeasures, and resilient health systems. Croatia also welcomes the follow-up to Resolution WHA 77.8, strengthening health emergency preparedness for disasters resulting from natural hazards, adopted by the 77th World Health Assembly. We attach particular importance to its implementation, including through risk-informed governance, multi-sectoral coordination, trained health workforce, resilient health facilities, and stronger community engagement. We note with concern the impact of current resource constraints on emergency preparedness and response capacities. Sustainable and predictable financing remains essential for WHO and member states to respond effectively to future crises. Croatia remains committed to working with WHO and all member states to build a stronger, more coordinated and more resilient global health emergency architecture. Thank you.
Muchas gracias, Croacia.
Thank you, Croatia. I'd now like to give the floor to the delegation of Guinea, followed by Jamaica.
Chair, distinguished delegates, global health security is undergoing a period of profound change, which demands on our part absolute clarity. In Guinea, recurring epidemics accentuated by the realities of climate change are imposing upon us a paradigm shift. We must definitively move from a culture of prevention to one of being reactive, and this is precisely the guiding principle of our National Health Security Action Plan 2024 to 2028. However, the implementation of this plan remains dependent on one major challenge: the continuity of public financing. To date, the share of the national budget allocated to the health sector has not yet reached the threshold of 15% required by the regional Abuja commitments. However, to mitigate this dependence, Guinea is now relying on long-term strategic planning, the Simandou 2040 program. This initiative for macroeconomic development will enable us to significantly increase our domestic revenue, thereby laying the foundations for sustainable health sovereignty. In parallel, and without waiting for the full maturity of these economic resources, our country is making use of our primary wealth, that of quality human resources. Our operational priorities are clear: consolidating health surveillance and continually strengthening the expanded vaccination program, identifying our territorial vulnerabilities to anticipate risks and to develop contingency plans in order to ensure a swift deployment of decentralized intervention teams and continuing training of our health professionals on preparedness and response to emergencies. At the heart of this capacity building is the intersectoral collaboration and One Health approach to effectively respond to threats to the human-animal environment interface. These efforts cannot be maintained without the support of our partners, and this is why we hope to expand our cooperation and renew our trust in active international solidarity. Together, let's unite our forces to transform our vulnerabilities into shared resilience and health for all. Thank you.
A continuación.
Thank you, Guinea. I now give the floor to Jamaica, to be followed by the Syrian Arab Republic.
Mr. President, Jamaica acknowledges the report of the Director General and notes the progress made by the Secretariat. The recent COVID-19 pandemic underscored the need for rapid upscaling of research initiatives, as well as for relevant and timely evidence to strengthen public health decision-making. The initiatives of the WHO Secretariat will strengthen the local clinical trial ecosystem, as well as facilitate the development of research networks and multicultural clinical trials in low and middle income settings. However, further technical support may be needed to strengthen the relevant legal, policy, and ethical frameworks undergirding research within member states. Recalling Resolution 78.3, Jamaica reports that progress has been made on a number of areas. These include the establishment of a national health research agenda, which has been endorsed by the main tertiary training institutions. Work on a policy on research for health to provide a governance framework on research has been initiated. A Research for Wellness Fund was initiated to fund research to support the wellness initiatives of the ministry. Jamaica developed a COVID-19 research agenda during the pandemic with 7 research working groups. This has established networks which will facilitate rapid upscale in future public health emergencies. The report made by the WHO Secretariat on strengthening the public health and evidence base for public health and social measures is endorsed and supported by Jamaica. Thank you.
Thank you so much, Jamaica. Ofrezco el uso.
I now give the floor to the Syrian Arab Republic, to be followed by Bangladesh.
Shukran, Sayyid Rais.
Thank you, Chair. The Syrian Arab Republic would like to support the statement delivered by the Emre region, and we'd like to thank the Director General for his report, and we would like to thank the WHO for all of their efforts in order to help citizens in regions that are suffering from health emergencies and that are undergoing a difficult context which have an impact on the health sector. Syria would also like to co-sponsor the proposed draft decision on the health emergency in Lebanon. Syria remains committed to collaborating so that we can build health systems that are effective and transparent and which can deal with epidemics and different health emergencies in future. Thank you.
Agradezco a la República Árabe Siria.
Thank you to the Syrian Arab Republic. I now give the floor to Bangladesh.
Thank you, Mr. Chair. Bangladesh appreciates WHO's continued leadership in strengthening global preparedness and response to health emergencies under agenda items 14.1 and 14.2. We emphasize the need for resilient health systems, equitable access to medicines, vaccines and diagnostics, and sustainable financing for emergency preparedness. We express deep concern over the deteriorating health situation in Lebanon and commend WHO's continued support to the Lebanese health system amid multiple health system in the time of crisis. And we urge for respect for international humanitarian law and to take necessary measures to prevent any type of attack on health facilities and health personnel. Bangladesh supports the proposed actions under agenda items 14.1 and 14.2 and calls for strengthened international cooperation to ensure uninterrupted access to essential health services, medicines, and humanitarian resistance. I thank you.
Thank you so much, Bangladesh. In conformity with Rule 47 of the Rules of Procedure of the World Health Assembly, concerning the representatives of the United Nations and of other intergovernmental organizations, I would like now to give the floor to the International Organization for Migration, the IOM. You have the floor.
This is for statement 14.1, agenda point 14.1. Distinguished delegates, as health emergencies, climate crisis, and conflict grow more complex and interconnected, emergency preparedness and response systems must better reflect the realities of human mobility and displacement. Migrants and displaced populations should be explicitly included in regional and national strategic plans and coordination efforts for health emergencies. IOM reaffirms its commitment to coordinated humanitarian and public health actions, including through its role in the Shelter, Land and Site Coordination Cluster. IOM stands ready to work with our strong operational footprint and expertise in humanitarian response, health security, last-mile delivery, and displacement monitoring, expertise that is directly relevant to protecting health, particularly in regions facing complex humanitarian crises. I thank you.
Thank you so much for your statement. Several non-state actors in official relations with WHO have requested the floor on this agenda item. According to the privileges conferred by relationship with the World Health Organization, I have pleasure in giving the floor to the representative of Alzheimer's Disease International, the International Federation of Alzheimer's Disease and Related Disorders Societies, Inc. You have the floor.
Thank you, Chair. ADI thanks the WHO for its work during health emergencies globally, and would also like to highlight the impact these emergencies have on those living with dementia. Those living with dementia are disproportionately impacted by infectious disease, as demonstrated by the COVID-19 pandemic, for example. In Canada, dementia was reported on 36% of COVID-related death certificates in 2020. In Australia, 41%, up to 28% and 20% in the UK and Italy, respectively. ADI would like to remind the WHO and member states to be mindful of the specific needs of those living with dementia, and support the better integration of local dementia association expertise into humanitarian responses and infectious disease outbreaks. Thank you.
Thank you so much for the statement. I would like to offer the floor to Asociación Médica Mundial, the World Medical Association. You have the floor.
Thank you. Distinguished delegates, we welcome World Health Organization's work in health emergencies and highlight the escalating impact of climate crisis on global health. We wish to emphasize that armed conflict is a primary driver of health emergencies and a major barrier to their effective management in many countries. In conflict settings, health personnel are increasingly subjected to targeted attacks and threats. The United Nations Security Council Resolution 2286 condemns violence against healthcare and requires parties to armed conflict to comply with international humanitarian law. 10 years after its adoption, these obligations continue to be systematically breached. Urgent action is required to protect healthcare and ensure its neutrality. Thank you so much.
Thank you so much. I give the floor to the International Council of Nurses.
Thank you, Chair. The International Council of Nurses, representing over 30 million nurses worldwide, maintains that health is the foundation of global security and peace and strongly condemns all attacks on healthcare. Ongoing conflict takes an immense toll on the safety and mental health of health personnel. Nurses face critical shortages, persistent threats, and impossible working conditions. Through its Nurses for Peace campaign, ICN supports nurses in more than 10 countries affected by conflict and humanitarian emergencies. On this 10th anniversary of the UN Security Council Resolution 2286, ICN again urges all states and parties to armed conflict to fulfill their obligations under international humanitarian law and protect health personnel, patients, and healthcare facilities. I thank you.
Thank you so much. Now the International Lactation Consultant Association is invited to take the floor.
Thank you, Chair.
ILCA is concerned by continued emergencies that worsen water and food insecurity and disproportionately affect women and children. Breastfeeding is a survival system. It is available when water isn't safe, power is out, and roads are closed and supplies are not reaching those displaced. Breastfeeding support is critical at all times, and plans must be in place to protect it in emergency situations. Unsolicited donations of infant formula undermine breastfeeding practices and create food insecurity for the most vulnerable. Member States need to incorporate the operational guidance on infant feeding in emergencies into national disaster plans following their commitments in resolutions in 2010 and 2018. This will protect breastfeeding during emergencies, contributing to infant food security and protection against infection, critical and life-saving during emergencies. Thank you.
Thank you. I would like to invite the International Pharmaceutical Federation to deliver a statement.
Honourable Chair, distinguished delegates, FFP advanced the Immunization for All Ages initiatives, strengthening evidence and advocacy for live course vaccination against influenza, COVID-19, pneumococcal disease, and RSV. Pharmacists are already central to these efforts. 90% are engaged in vaccination-related advocacy, and over 56 countries now enable pharmacy-based vaccination, reflecting a clear global trend towards expanding scope of practice supported by evidence, demonstrating improved vaccine access, increased uptake, and strengthening healthcare system resilience. We urge Member States to fully integrate pharmacists into primary healthcare for equitable vaccine access. Thank you for your attention.
Thank you. Allow me to offer the floor to the International Pharmaceutical Students Federation.
Honorable Chair, distinguished delegates, the International Pharmaceutical Students Federation, representing over 600,000 members across 100 countries, welcomes WHO's leadership through the Health Emergencies Program and humanitarian work. We are alarmed by increasingly complex health emergencies driven by conflict, climate change, funding constraints, and health crisis, which continue to strain health systems and vulnerable communities worldwide. The increasing strain on health systems and vulnerable populations worldwide underscores the vital role we play as pharmacy students and young health professionals through outreach activities, health promotion, and specialized training. We call on member states to recognize pharmacists and pharmacy students as frontline healthcare professionals and ensure equitable access to essential medicines, vaccines, and healthcare during emergencies. Thank you.
Thank you. The International Society of Physical and Rehabilitation Medicine is invited to deliver its statement.
Thank you, Chairperson. The International Society of Physical and Rehabilitation Medicine highlights the urgent need to integrate rehabilitation in health emergencies. Drawing on evidence emphasized by the World Rehabilitation Alliance, we stress that while WHO has taken important steps to improve access, a critical need for timely, long-term rehabilitation service for both newly injured people and those with pre-existing conditions remains. Emergencies increase the need for rehabilitation, and without rehabilitation and assistive technology, impact can worsen, compounding needs and strain health systems. Prolonged crises show the necessity of addressing functioning as a third dimension alongside morbidity and mortality. We urge WHO and member states to embed rehabilitation into resilient, inclusive, people-centered response. Thank you for your attention.
Thank you. I offer the floor to Knowledge Ecology International, Inc.
In 2019, the WHO approved what was considered at the time a landmark resolution on transparency, WHA 72.8. Shortly thereafter, the COVID-19 pandemic ushered in an emergency treated like a matter of national security, where secrecy and non-transparency were often embraced. Transparency is important for public health by having reliable accurate evidence to design policies, evaluate their impact and performance, and to establish trust with the public. There's much the WHO and its member states do to re-engage on the transparency agenda, but it can start by organizing technical meetings on standards and best practices to implement WHA 72.8, the WHO Transparency Resolution. Thank you, Chair.
Thank you so much. Je donne la parole à Médecins Sans Frontières International.
I give the floor to Médecins Sans Frontières International.
Chair, on Agenda 14.1, 10 years after the adoption of the UN Security Council Resolution 2286 condemning attacks on healthcare in armed conflicts, attacks continue and have increased, with less and less respect for international laws. These attacks have massive, direct, long-term consequences for patients and medical personnel worldwide, like in Gaza, Sudan, Ukraine, DRC. MSF reminds member states of their responsibility to protect and ensure the respect and provision of healthcare and to safeguard medical impartiality and neutrality of healthcare in all circumstances, and use their influence to ensure compliance by all parties to conflicts. Therefore, a strong WHO emergency response capacity remains essential, including its role in coordinating responses with diverse medical and humanitarian actors in the field. Thank you.
Thank you. I invite Medical Women's International Association to deliver their statement.
Thank you, Chair. Agenda item 14.2 marks a critically important new chapter in building evidence-based national and global health architecture. We hereby recommend that the guidance on evidence-based public health and social measures should not be limited to lessons learned from health emergencies. Rather, it should lay the foundation for good governance principles and help reduce human error in decision-making across the continuum of regular, strategic and operational planning. Member states, including governments and parliaments, should more closely collaborate with WHO on new, holistic and practical tools for designing robust national health policies and budgets and aligning and harmonizing international aid where relevant. Thank you.
Thank you. I offer the floor to Medicus Mundi International, Network Health for All.
This statement is supported by the People's Health Movement. WHO's work in health emergencies must be defended, strengthened, and sustainably financed. Its coordination of health clusters, its support to ministries of health, documentation of attacks on healthcare, and delivery of essential services are indispensable. Still, we must resist the temptation to reduce emergency preparedness to a technocratic exercise of detection, grading, and response. War, aggression, occupation, forced displacement, climate breakdown, austerity, debt, weakened public systems, and unequal access to health technologies are producing avoidable crises. We call on member states to reject the normalization of humanitarian rationing, to protect healthcare in conflict, to replenish WHO's emergency funds, and to move from a self-serving and antiquated posture of health security to one of genuine health solidarity. Emergency preparedness must mean peace, public health systems, climate justice, social protection, community participation, equitable access, and the realization of the right to health for all. Thank you.
Thank you. Public Services International is invited to deliver a statement.
Gracias, señor presidente.
Thank you very much. Public Services International, recognizing the work of the WHO in the area of health emergencies, would like to express just how impressive it is despite the cut in resources. The global situation is extremely complex, and that requires member states to adopt far-reaching measures, including the support for the WHO framework for prevention, preparedness, response, and resilience in the face of health emergencies. Health emergencies, more than ever today, are interconnected with conflicts and geopolitical divides. Attacks on clinics, hospitals, healthcare personnel exacerbate already difficult situations and are unacceptable. PSI urges member states to set as a priority the protection of communities and the safeguarding of people's lives, particularly those of health personnel. Those are fundamental elements when it comes to responding to health emergencies. Thank you. Thank you very much.
To the Save the Children Fund.
Thank you, Mr. President. Save the Children is delivering this statement as member of the Global Health Cluster. Humanitarian crises account for nearly half of all deaths among children under 5 and 58% of all maternal deaths. Yet, maternal and child health survival in crisis-affected settings remains chronically underfunded and insufficiently coordinated across humanitarian and development sectors. Funding cuts affected 6,600 health facilities supported by health cluster partners, impacting 52 million crisis-affected people. And so with that, we urge member states to urgently fund and scale up quality maternal, newborn and child health services in all humanitarian contexts, including antenatal care, skilled birth attendant, and the prevention, detection and treatment of childhood illness and malnutrition. And secondly, to ensure that greater alignment across global health development actors with humanitarian actors to prioritize maternal, newborn and child health. Thank you.
Thank you. I offer the floor to the World Federation of Public Health Associations.
Science is the foundation of public health. It provides the evidence to understand diseases, develop interventions, and create policies that save lives. Global data collection and exchange have been critical in combating pandemics like COVID-19. Without robust scientific research, we wouldn't have the tools to track outbreaks, develop vaccines, or implement effective public health measures. The global scientific community is interconnected, relying on collaboration and the free exchange of knowledge. When funding for research is cut, when scientists are silenced, or when international partnerships are dismantled, the consequences ripple across borders. As members of the public health community, we must stand for science-based evidence and its critical role in protecting health and addressing global health challenges.
Last on our list, I would like to offer the floor to the World Health Federation to deliver a statement. The floor is yours.
Honourable Chair, distinguished delegates, people living with NCDs, particularly cardiovascular disease, face significant challenges in emergency settings due to the strained health systems. Shifting priorities and limited access to care contribute to preventable NCD-related morbidity and mortality, especially in LMICs, which bear the greatest burden of humanitarian crises. NCD complications occur 2 to 3 times more frequently in emergencies with higher premature mortality. The World Heart Federation urges member states to, number 1, prioritise people living with NCDs in health emergencies and elevate NCDs within health security agendas. 2, integrate essential NCD services into emergency preparedness, response and recovery plans. And 3, strengthen primary healthcare and universal healthcare to build resilient, inclusive systems that ensure equitable NCD prevention, treatment and care with financial protection. Thank you.
Thank you so much for your statement. Now I would like to offer the floor to Mrs. Annette Heinzelman on behalf of the Regional Director for the Eastern Mediterranean. You have the floor. Microphone, please.
Yeah,
you can proceed.
Thank you. I read this statement on behalf of Dr. Hanan Balkhi, the Regional Director of the WHO Eastern Mediterranean region. Chair, Your Excellencies, Director General. Days ago, the Director General declared the Ebola outbreak caused by the Bundibugyo virus in the Democratic Republic of the Congo and Uganda a public health emergency of international concern, thus bringing the number of active PHEICs to 2 Ebola and poliovirus. Each time Ebola has emerged in the DRC, WHO has helped to contain it through search deployment, laboratory networks, surveillance and community engagement. We will do so again. But the warning is unmistakable. Outbreaks are accelerating, while the systems designed to stop them are being weakened. Nowhere is that convergence more acute than in the Eastern Mediterranean region. Today, 117 million people across our region require humanitarian assistance. We are managing 14 graded emergencies, 44 active outbreaks, and more than 50 public health events across 17 member states. Conflict, displacement, climate shock, economic collapse, and diseases are colliding into a single expanding polycrisis. Across Gaza, Sudan, Yemen, Somalia, and Afghanistan, and amid escalation affecting Iran, Syria, and Lebanon, WHO is sustaining trauma care, delivering medicines, reinforcing surveillance, and supporting governments to manage growing public health risks. Violence against healthcare continues at an appalling scale. In 2025, WHO verified more than 1,350 attacks on healthcare globally. Nearly 40% occurred in our region, accounting for almost 90% of related deaths. Despite all this, WHO continues to deliver, working with partners to sustain essential health services under extreme insecurity. But the gap between needs and resources is now unsustainable. The WHO Health Emergency Programme faced a 553 million funding gap in 2024 and 2025. The contingency fund for emergencies entered 2026 with just $19.5 million available, while our regional emergency workforce has been cut by half. Excellencies, we cannot continue confronting expanding emergencies with shrinking capacity. Attacks on healthcare must stop. Humanitarian access must be guaranteed. And financing for preparedness and emergency response must increase now, not after the next global crisis is already underway. Thank you.
Muchas gracias, señora Heinzelmann.
Thank you very much, Ms. Heisselman. I now give the floor to Dr. Iguazu, Executive Director of the WHO Programme for Response to Health Emergencies. You have the floor.
Thank you, Chair. Distinguished delegates, thank you all for your comments in support of the critical work that the WHO's emergency program does on your behalf. We take all your comments as pointers to how we can improve, have taken careful note of each of them, and we follow up on all the specific points that you made. We note especially your comments on our financial situation. I remain confident that with your guidance and support, the work that we do on your behalf will be sustainably financed, especially given the self-evident threats that we face today. This World Health Assembly marks the 10th anniversary of WHO's Health Emergencies Program. You will remember that it was the Ebola outbreak in West Africa that drove the transformation of WHO's emergency work and led to the creation of a vertically integrated program across the 3 levels of the organization. And as we gather here 10 years later, we again find ourselves responding to an Ebola outbreak. But with where WHO stands today, in terms of our coordination, our operational capacity, our technical expertise, our partnerships, our global networks, it is fundamentally different from where we were 10 years ago. Over this decade, we have built stronger systems, expanded our operational reach, strengthened country support, developed global mechanisms that allow us to respond faster and more effectively to increasingly complex health emergencies. More importantly, we have also seen a significant transformation by you, our member states, in your own countries, and it is a shift that WHO is particularly proud of. We are seeing stronger country ownership and leadership of preparedness and response capacities, with more than 120 national public health agencies established or in development, stronger emergency operations centers and laboratories, growing research and manufacturing capacity, and an increasing political commitment to global health security. As we discussed this afternoon, we are also working with you to strengthen the evidence base for public health and social measures, addressing the gaps and recommendations raised. We are doing this by advancing guidance and practical tools on the socioeconomic impact of these measures while integrating them into national emergency preparedness and response frameworks. As we heard yesterday from President John Mahama and Prime Minister Pedro Sanchez, protecting others is ultimately the best way to protect ourselves. And countries' health security cannot be viewed as a byproduct of charity, but as an expression of sovereignty, leadership, and shared responsibility. WHO is here to support and preferably work alongside our member states as you take the lead. If we collectively value what we have built over the past 10 years, the systems, networks, operational capacities, and country support that now underpin global health emergency preparedness and response, then we must ensure their sustainability for the next decade. The next chapter of the WHO's emergency program will require continued partnership, political commitment, and investment so that WHO can remain ready to support countries before, during, and after crisis. I thank you, Chair.
Le agradezco mucho, Dr. Yeguas.
Thank you very much, Doctor, for your statement and your thoughts. Is the committee prepared to take note of the information contained in documents A79-9 and A79-9-1 and the report pertaining to this discussion as contained in document A79-5? Reports are noted. We will now consider the draft resolution entitled Protection of Healthcare and Public Health Infrastructure in Conflict Settings, with reference to the situation caused by the recent attacks against the Islamic Republic of Iran, contained in document A79A Conf 2. Is the committee ready to approve the draft resolution?
Rejected in the discussion.
Israel is asking for...
¿Alguien está levantando?
There is a request. Israel, you have the floor. Please go ahead.
Chair, as indicated in our statement, Israel is not in a position to support the decision, and we call for a recorded vote. Thank you.
Gracias.
Thank you.
Thank you so much for your patience. We are proceeding to a vote on the question of whether the committee approves the draft resolution contained in document A79/A/Conf/2. Furthermore, the delegation of Israel has requested that the vote be conducted by recorded vote. It has been decided by the Assembly that the recorded vote will be conducted by means of the electronic voting system.
No, just go ahead. We don't need this.
I would like to give the floor to the Legal Counsel to provide some explanations on the procedure to be followed in respect of the vote that has been requested. Mr. Walton, you have the floor. Thank you.
Thank you very much, Mr. Chair. And ladies and gentlemen, before we actually conduct the vote, IT department has asked me if we could just test the system to ensure that it is working correctly and avoid some of the problems that we experienced in plenary yesterday. So in order to do that, we will have a test recorded vote. This will only take a couple of minutes, I hope. In a moment, when the test begins, please check that your name, the name of your country, is on the card in the console. Please check that you can see the 3 voting lights in front of you on the console. And please choose the green button. So press the green button. And then please check on the screen that your vote has been recorded correctly. I should say that only those members who will be able to vote will see this. So if you are from a delegation that is either not registered, in which case you wouldn't be here anyway, or if your voting privileges have been suspended, your console will not light up. But for the rest of you, please check that you can see the buttons lit, press the green button, and please check that your country's vote is recorded on the screen so that we know the system is working. And if that doesn't happen, please raise your flag so that a technician can come and check. Once we've checked the system is working, we will then proceed to the actual vote. So I'd ask our IT department to run the test now, please. I know, but listen. Just to reiterate, this is not the vote, and you should just press the green button, please. You'll have the chance to vote properly in a moment. So I see Ecuador is asking for the floor. Could a technician please go to Ecuador to ensure that this works for them? And if anybody else has experienced difficulty, now is the time to raise your flag so that we can sort the problem out. That seems not to be the case, so we'll just wait until the Ecuador's issue has been resolved, and then we will proceed with the actual vote. Thank you very much, ladies and gentlemen, for your patience. It is very much appreciated. I understand that the test has been successfully concluded, so we can proceed. Perhaps since we've had that pause, I had better remind you of the question on which you are voting, and it is the following. Whether the committee approves the draft resolution contained in document A79/A/Conf/2. In accordance with Rule 73 of our Rules of Procedure, the recorded vote will be conducted through the electronic means you've just been testing, and in a recorded vote, the vote of each member is recorded. Before voting begins, please let me remind you that a chief delegate, delegate or alternate may cast the vote on behalf of the delegation. As soon as the voting is opened, please press the green button if you wish to vote yes to the question, press the red button if you wish to vote no, and press the blue button if you wish to abstain. Once the chair declares the vote open, you will have 1 minute to cast your vote. A timer will be shown on the large screen, and once that minute has expired, the chair will close the voting. You may change your vote during that 1 minute, but simply by pressing a new button. But once the minute has expired, of course, it is no longer possible to change your vote. If for any reason you don't cast a vote, you will be recorded as absent. After the voting has expired, the chair will declare the vote closed, and he will then announce the results of the vote. And in accordance with Rule 75, the vote of each member participating will be recorded will be inserted into the record of the meeting. There will be an opportunity to make brief statements by way of explanation of the vote after the result has been announced. And I should recall that nobody may interrupt the vote once it has begun, except on a point of order directly connected to the conduct of the vote itself. I will now read the names of the members that are represented at this session but which are not entitled to vote. They are Afghanistan, Dominica, St. Lucia, Somalia, South Sudan, Sudan, the Bolivarian Republic of Venezuela, and Yemen. So the member states I just mentioned will not be able to vote in the system. Mr. Chair.
Thank you so much for the clarifications. Are there any questions? No. There appears to be no questions. We should proceed as set out by the legal counsel. It is so decided. I therefore declare that voting is open. Secretariat, please activate the timer.
It's not showing.
Please note that you have 30 seconds left to cast your vote. Thank you. I declare that the voting is closed. While the results are being generated, I would like to ask delegations to please remain in the room. Thank you.
I can't see.
Gracias. Thank you so much for your patience. The following is the result of the vote. Number of members with the right to vote, 181. Number of members absent, 74. Number of votes in favor, 19. Number of abstentions, 58. Number of votes against, 30. The draft resolution is therefore rejected by 30 votes to 19 with 58 abstentions. I will now open the floor for explanations of vote. Gracias. Ofrezco el uso de la...
Thank you. I give the floor to the distinguished delegation of Sri Lanka, to be followed by Indonesia.
Sri Lanka tiene el uso de la palabra.
Sri Lanka, you have the floor.
Yes. Can I have a few minutes to give the explanation?
En ese caso, si me permiten,
So I will give the floor to Indonesia. You have the floor, Indonesia.
Mr. Chairman, the substance of this draft resolution is rooted in the WHO's mandate. We are gravely concerned by and condemn the attacks on healthcare and public health infrastructure in Iran in the context of the US and Israeli military campaign. No military or political justification can ever excuse such attacks. Disabling a country's health system is not collateral damage. It is a direct assault on the medical neutrality that anchors international humanitarian law and on a nation's capacity to heal. The WHO's work on the ground is critical to ensuring unhindered access to health services, life-saving treatment, and medical countermeasures, to mobilize technical assistance, and to informing the needs on the ground. Similarly, deeper engagement with the UN institutions in Iran should help facilitate verified assessment of its needs on the ground. Indonesia stands ready to support the health system recovery in Iran. Rebuilding a health system is not a short-term endeavor. It requires years of recovery, substantial resources, and sustained international support. Against this backdrop, Indonesia has chosen to abstain on the resolution. Our position reflects the geopolitical complexity of the text before us, not any disagreements with its substantive merits with which we share, and not any qualification of our solidarity with Iran and its people in their healing and rebuilding. Thank you.
Agradezco al distinguido embajador.
I thank the distinguished ambassador and permanent representative of Indonesia, and I would now return to the distinguished delegation of Sri Lanka. Are you ready to speak?
No aparece en el sistema. Me permito.
I can't see you on our system, so I'll give the floor to the United Arab Emirates, to be followed by Canada.
Thank you, Mr. Chair. The UAE voted abstain on the resolution because it believes in the undisputed principles established in the WHO Constitution regarding the protection and promotion of health, including through the safeguarding of critical civilian objects and essential health services and facilities. However, what Iran has done is attack its neighbors who are not party to any conflict, including my own country, the UAE, through the unlawful and widespread targeting of civilians and civilian infrastructure. In addition, Iran continues to block the Strait of Hormuz, which has caused disruptions to the delivery of medicines, vaccines, medical products, and essential health commodities, causing health implications at the global level. And I want to remind this august body that the very country that once received critical medical supplies from my own country in collaboration with the WHO to combat the coronavirus in the spirit of good neighborliness from us is the same country attacking my very own country at the moment and the country that claims to be a proponent of good neighborliness. For these reasons, the UAE disassociates itself from this resolution. I thank you.
Agradezco la intervención.
Thank you, and I give the floor to Canada, to be followed by the United Kingdom.
Thank you very much, Chair. Canada condemns Iran's destabilizing actions. We call on Iran to end all hostilities and work towards a negotiated solution to end the conflict. We remain deeply concerned by the damage caused by the ongoing conflict to civilian infrastructure, including public health and medical facilities throughout the Middle East. Canada has repeatedly called on all parties to respect international humanitarian law and to protect civilians and civilian infrastructure. Canada has also consistently condemned the strikes carried out by the Islamic Republic of Iran on civilians and civilian infrastructure across the Middle East, including Gulf states. For this reason, Canada does not support the resolution proposed by the Islamic Republic of Iran.
Gracias, Canadá. Ofrezco el uso del...
Thank you, Canada. And the United Kingdom, I give you the floor, to be followed by Belgium.
Thank you, Chair. Iran's actions over the past 3 months have demonstrated a wanton disregard for the safety and well-being of civilians across the Middle East. We condemn its attacks against civilian infrastructure in other countries. Iran's actions in the Strait of Hormuz have impacted global trade flows, particularly energy and agriculture, with potentially devastating humanitarian consequences. The United Kingdom is clear that humanitarian and medical personnel must be protected and that attacks on them are completely unacceptable. We welcome the role of the WHO in ensuring access to healthcare and continue to support it in carrying out this important work.
Agradezco la intervención.
Thank you very much. I give the floor to the delegation of Belgium, to be followed by New Zealand.
Thank you, Mr. Chair. Allow me to make the following explanation of vote. Belgium reaffirms its unwavering commitment to international law, in particular international humanitarian law, and to the protection of civilians in all circumstances. Attacks against health infrastructure, including hospitals, as well as against healthcare workers, are strictly prohibited under international law and can never be justified. Ensuring safe and unhindered access to healthcare is a fundamental obligation that must be respected by all parties at all times. Belgium has carefully considered the content and the context of this resolution, as this initiative cannot be viewed in isolation from the broader considerations related to the situation in Iran. Belgium strongly condemns the violent repression by Iran of its own population. The Iranian people deserve to fully enjoy their human rights and fundamental freedoms and to strive for a more dignified and democratic future. We call on Iran to cease its indiscriminate attacks against the region, as further escalation undermines stability and prospects for peace. Mr. Chair, our vote on this resolution does not in any way call into question Belgium's commitment to international humanitarian law and to the protection of civilians. But we will not support a regime that shows disregard for human rights and turns to the UN only when it is convenient. Thank you.
Gracias, Bélgica. Ofrezco el uso.
Thank you, Belgium. And I now give the floor to New Zealand, to be followed by France.
Thank you, Mr. President. The WHO plays a critical role in supporting ongoing access to healthcare in conflict situations, and we support this important work. As we reiterated in our national statement earlier this afternoon, all parties in all conflicts must comply with international law, including international humanitarian law. Patients, healthcare workers and hospitals must be respected and protected. New Zealand voted against this resolution because of inappropriate language included in the text and because of our concerns regarding Iran's actions in this conflict, including attacks on neighbouring countries and critical civilian infrastructure. Thank you very much.
Muchas gracias, Nueva Zelanda.
Thank you, New Zealand. I give the floor to France, followed by Singapore. You have the floor. Thank you, Chair. We take note of the rejection of the resolution on protection of healthcare and public health and infrastructure in conflict settings presented by the Republic of Iran. This should not make us lose sight of the need for the Republic of Iran to respect its obligations under human rights and international humanitarian law, in particular with regard to protecting civilian population, hospitals and medical personnel. 28/7 resolution of the Security Council condemns indiscriminate attacks carried out by Iran in the Gulf states and the immediate grave consequences on the civilian population. We are in solidarity with the populations affected, and we call on the respect of international humanitarian law by all parties. Thank you.
Muchas gracias, Francia.
Thank you, France. And I give the floor to the distinguished delegation of Singapore, to be followed by Japan.
Thank you, Mr. Chair. Singapore has voted in favour of this resolution in recognition of the humanitarian situation affecting the Iranian people. It is vital for all parties to engage in negotiations in good faith to secure a durable resolution to the current conflict in the Middle East. We, however, wish to place on record our reservations that certain aspects of this resolution are on political and non-health related matters which go beyond the purview of the WHO. The World Health Assembly is a technical forum which should be preserved for technical health-related discussions. I thank you.
Gracias, Singapore.
Thank you, Singapore. I give the floor to the delegation of Japan, to be followed by Monaco.
Thank you, Chair. As stated in the draft resolution, it is an important obligation of the member states to fully respect international humanitarian law, including the obligation not to attack medical personnel, patients, and public health infrastructure such as healthcare facilities. Japan supports the idea of the draft resolution in general terms. However, the resolution included some statements which does not align with what we have expressed as Japan's position regarding situations in Iran. Therefore, we chose to abstain from a vote. Thank you, Chair.
Gracias. Ofrezco el uso del...
Thank you, and I give the floor to the delegation of Monaco, to be followed by Oman. Go ahead, please, Ambassador. Thank you very much, Chair. We would like to express our deep concern with regard to the situation in the Middle East, which we're following closely. There is a risk of conflagration, we're thinking particularly of the negative impact on the civilian population. So we call on parties to ensure that they protect civilians and respect international law, in particular international humanitarian law. Monaco voted against this resolution. That in no way reflects a lack of solidarity with the people of Iran who are disproportionately suffering and who for many months, if not many years, have suffered greatly. Nor does it call it to question our commitment to international humanitarian law. Rather, as other delegations before me have said, the complex situation, the internal context of Iran means that we cannot support this text. But I would reiterate once again that we feel total solidarity with the people of Iran. Thank you. Thank you very much, Madam Ambassador. And I'll now give the floor to the distinguished delegate of Oman. Ambassador, you have the floor. Please.
Thank you, Chair. The Sultanate of Oman reiterates its firm stance in support of the public health infrastructure and the right to people to health, based on our conviction in international cooperation. In this regard, and in line with our values and the values and principles of the WHO in support of the healthcare systems, my country has voted in favor of the draft resolution in support of the efforts aimed at protecting the healthcare and the public health infrastructure and humanitarian infrastructure. The Sultanate of Oman stresses the need to deal with health matters from a humanitarian perspective, away from politicization. This reflects our will to work together and provide health for all. Thank you, Chair.
Agradezco la intervención del distinguido representante.
I'd like to thank the distinguished delegate of Oman, and I will give the floor to the distinguished representative of Iran. You have the floor.
Thank you, Mr. Chair. First of all, my delegation wishes to thank the member states for voting in favor of the draft resolution, which is completely within the framework of the WHO work and mandates. We also reject all the baseless allegations against my country. Some of the member states who took the floor and voted against the resolution are the supporters of the genocidal regime of Israel. The Islamic Republic of Iran reaffirms its firm commitment to the principle of the WHO Constitution, international humanitarian law, and the protection of civilians, health workers, and health infrastructure during times of conflict. Iran was not the initiator of the recent hostilities. Nevertheless, its population, including children and vulnerable civilians, as well as healthcare, research, and medical facilities, have been subjected to attacks that raise serious humanitarian and public health concerns. Deliberate or indiscriminate attacks against healthcare system can never be justified and represent a direct threat to regional and global health security. In this context, the proposed resolutions seek to uphold the neutrality of health, condemn attacks on medical and civilian infrastructure, and reaffirm and collective responsibility of member states to protect health system from politicization and violence. The World Health Assembly must remain guided by humanitarian principles, equity, and the protection of human life rather than selective or politically motivated approaches. I thank you.
Agradezco la intervención de la distinguida delegada.
Thank you to the Islamic Republic of Iran. And we will now turn to the draft decision entitled Health Emergency in Lebanon, which can be found in document A79A Conf 3. I understand that Afghanistan, Albania, Algeria, Saudi Arabia, Azerbaijan, Bahrain, Bangladesh, Benin, Belgium, Brunei Darussalam, Burkina Faso, Cameroon, Chile, Comoros, Côte d'Ivoire, Djibouti, Egypt, United Arab Emirates, Spain, France, Gabon, Gambia, Greece, Guinea, Guinea-Bissau, Guyana, Indonesia, Iraq, Iran, Jordan, Kazakhstan, Kyrgyzstan, Kuwait, Libya, Malaysia, Maldives, Mali, Morocco, Mauritania, Monaco, Mozambique, Niger, Nigeria, Oman, Pakistan, Palestine, Qatar, Senegal, Sierra Leone, Somalia, Sudan, Suriname, Syria, Tajikistan, Chad, Togo, Turkey, Turkmenistan, Tunisia, Uganda, Uzbekistan, and Yemen would like to appear as co-sponsors of the draft decision contained in document A79/A/Conf/3. We take due note of that, and that will be duly reflected in the meeting minutes. Is the committee ready to approve the draft decision? Israel, you have the floor.
Chair, we didn't want to go through this path, but the State of Israel is not in a position to support the draft resolution. We'll provide our explanation of vote following the vote, and we will ask you for a recorded vote as well. Thank you.
Ofrezco el uso de la palabra.
I give the floor to the legal counsel.
Thank you. So we are to proceed with a vote, a recorded vote on the question whether the committee approves the draft decision contained in document A79-A/conf/3. In accordance with Rule 73, the recorded vote will be conducted by electronic means, and as we have said previously, in a recorded vote, the record of how each member voting will be recorded in the record of the meeting. I won't repeat all the instructions from before, but I will just remind you that when the voting begins, if you wish to support the proposition approving the draft decision, then you should press the green, let me say that again. You should press the green button for yes, you support the draft decision. Press the red button for no, you do not support the draft decision, and the blue button if you wish to abstain. You will have 1 minute to vote. And again, you can change your vote during that minute, but not once it has finished. I would like to recall that there will be an opportunity to make brief statements by way of explanation of vote once the voting has concluded and the results have been announced. And again, please note that you may not interrupt the voting except on a point of order connected to the actual conduct of the vote itself. The countries who are represented but not entitled to vote remains unchanged from our previous vote, and I will not read it again at this stage, but let me remind you that the question is whether the committee approves the draft decision contained in document A79-A/conf/3.
Thank you so much, Legal Counselor. I've been informed that in some few minutes our interpreters would finish their day, so we will be conducting this voting process in English.
Oh. We'll have to do the explanations of vote tomorrow then.
This is particularly important since there will be a segment of explanation of vote, which could be done tomorrow. But if you agree, we will conduct the vote. So, there appears to be no questions. We shall proceed as set out by the legal counsel. It is so decided. I therefore declare Burkina Faso.
Monsieur le Président.
Yes, Chair. All my apologies. We would like to understand the goal of putting this to a vote. Does that concern the entire document or the rejection of the resolution that we voted on earlier? Burkina Faso would just like to get that clarification, because we were cited in the list that you read out.
Let me be very clear. We are talking about the document A79-A/conf/3, which is entitled Health Emergency in Lebanon. So this is the draft decision that we are voting on now. If you accept the proposal in the vote, then this decision will be adopted in its entirety. If you vote no, if it's not approved, then the decision in its entirety will be rejected. I hope that is clear. So if the yes vote carries, the draft decision is adopted. If no vote carries, then the draft decision is rejected.
Thank you so much, Legal Counselor. We shall proceed as set out by the Legal Counsel. It is so decided. I therefore declare that voting is open. Secretariat, please activate the timer. Please note that you have 30 seconds left to cast your vote. Thank you.
We have to do the rights of reply.
I declare that the voting is closed. While the results are being generated, I would like to ask delegations to please remain in the room. Thank you. Thank you so much for your patience. The following is the result of the vote. Number of members with the right to vote, 181. Number of members absent, 66. Number of votes in favor, 95. Number of abstentions, 18. Number of votes against, 2. The draft decision is therefore approved by 95 votes to 2 with 18 abstentions. As agreed before the vote, we will postpone the explanations of vote tomorrow because there is no translation available at this time.
Give the reply.
A last task. I would like to ask the committee, considering we have no translation available at this time, whether you would agree that the right of reply might be given at this moment, or should we do it at a further time? It would be with no translation. The right to reply by the Islamic Republic of Iran.
Israel.
Israel has raised the flag. Iran as well. Israel, you have the floor.
To provide an explanation of vote, Chair, yes? Yeah. Thank you, Chair. Israel remains actively engaged in ongoing negotiations with Lebanon aimed to achieving...
No, it's a non-explanation of vote. It's the right to reply. The explanation of vote could be carried out tomorrow. At this moment, we are considering the possibility of right of reply. Only right of reply, with no translation. Iran has requested the floor.
Thank you, Mr. Chair, for giving me the floor to exercise our right of reply. Mr. Chair, under the agenda item 14.1, one representative has deliberately spoken at length on every issue except the protection of health. This is a striking omission. In reality, the Israeli regime is systematically destroying and dismantling the health system, along with any remaining traces of civilization and humanism. Such actions demonstrates a complete disregard for the most fundamental humanitarian principles. The representative of the Israeli regime, by deliberately departing from the agenda of this meeting, once again sought to distract attention from the matter under consideration through blatant falsehood and coordinated campaign of disinformation aimed at leveling baseless accusations against Iran. Such conduct comes as no surprise. It is entirely consistent with the established pattern of behavior of the Israeli regime, whose very conduct has long been rooted in deception, lies, the deliberate distortion of facts, terrorism, and criminality. I thank you.
Thank you so much. Israel is asking for the floor.
Yes, thank you, Chair. It does indeed require a great level of audacity to come and speak and ignore the plight of the people and then accuse everyone else of the criminal, inhumane actions they are doing. The problem of the Iranian violence is exceeding much beyond their borders. They're harming the whole Middle East, the whole world, by their actions. Ignoring this fact and keep repeating it and adjusting the narrative as you see fit does not have the support of this room, and it spoke clearly. Thank you very much, Mr. Chair.
Thank you. Distinguished delegates, we have finally arrived at the end of the session of this afternoon. We will reconvene tomorrow after the report of the Committee of Credentials, and it will be approximately, my apologies. I see that the Islamic Republic of Iran has now requested the floor.
Thank you so much, Mr. Chair. Iran categorically and unequivocally rejects all such unfounded allegations. Indeed, if there is anyone utterly disqualified from the lecturing others on international law and the rule of law or human rights, it is the Israeli regime itself. Its record is stained by decades of systematic crimes and persistent widespread violation of virtually even norm and principle of international law, including international humanitarian law. I thank you.
Thank you so much. So the agenda item is suspended. We will reconvene tomorrow, immediately after the report of the committee. Sorry, Canada. Please, Canada, so sorry. I was so carried away, yes.
I'm
Please,
very sorry,
I offer
Chair.
you the floor.
I'm very sorry, Chair. I just want clarification of what we'll start with tomorrow. If delegates will have an opportunity to do an explanation of vote at the beginning of the session tomorrow. Thank you.
Yes, thank you so much for the question. Yes, absolutely, by all means. As we mentioned before the vote, we didn't have translation, so you will have the opportunity actually for the explanation of votes. So this agenda item is only suspended. So once we reconvene, you will have the opportunity to present your explanations of vote, naturally with translations. So I should be careful before. I think I'm on the right side to assume that we can suspend this item of the agenda. We will reconvene tomorrow at approximately 9:15 after the task of the Committee of Credentials. Naturally, you can consult all the details on the daily agenda. I would like to remind all the delegations that we will have different parallel events and a reception by the President at 7 on this building. You will have further information on the daily calendar and at the website of the World Health Organization. Thank you very much. We finish this meeting.
Buenas tardes.
Good afternoon.
Un almuerzo agradable o un I hope you've had a good lunch or a good meeting if you've been in another meeting. We're going to come back to the general debate under item 3. We'll have the same system. I will call a country to the rostrum, and I'll call the next country to come up while they wait for their turn. I now give the floor to the representative of Egypt, and I call the Syrian Arab Republic to the rostrum.
Is Egypt? Mr. President, Excellencies, ladies and gentlemen, تتقدم جمهورية مصر العربية بخالص.
The Arab Republic of Egypt would like to convey its thanks and appreciation to the WHO for its support of the global health system and the people's health security in the midst of challenges. I would like to reiterate the productive partnership between WHO and Egypt, which has produced many achievements on the regional and global levels. The WHO is hosted in Egypt of the Emirate office, and it also is a keen believer in the importance of multilateralism. Egypt also has a long track record in fighting communicable diseases, which led to many certifications from the WHO with regard to the elimination of a long list of diseases, including poliomyelitis, malaria, measles, and trachoma. And it is also implementing many advances in the elimination of hepatitis B and hepatitis C. It is the only country which has occupied this global ranking, and we have also seen the report that was released recently in Bangkok by the WHO with regard to the piloting and leading efforts by Egypt in the fight against hepatitis virus. The Interagency Task Force of NCDs has also recently appreciated the efforts of Egypt in the fighting against obesity, especially child obesity. We carry on our support to achieving universal health coverage and the plans by the WHO in this regard, and especially with the second stage extending the coverage to 18 million citizens. And we further support the efforts in the negotiations around the pandemic agreement and the PAP system, and supporting local production and the transfer technology. On another front, Egypt has made advances in a number of important health files, including micromedicine and radiology. And in conclusion, Egypt reiterates the importance of protecting civilians and health infrastructure, especially in the midst of current humanitarian crisis. Thank you, Mr. Chairman.
Cedo la palabra a la Federación de Rusia.
I give the floor to the Russian Federation. Distinguished President, distinguished colleagues, in the Russian Federation we're implementing systemic state measures to increase the quality and accessibility of medical assistance, starting from primary healthcare and ending with innovative medicine. We have a new system of providing emergency help and responding to emergencies. We've introduced organizational approaches to incident management. We're carrying out large-scale updates to medicine, including using IT. We have achieved serious results, and this shows that we've taken the right path. And mortality rates have fallen due to cardiac incidents. We've also worked on rehabilitation. We're paying particular attention to diabetes and obesity, and we have endocrine centers where children and pregnant women are monitored in their glucose levels. We're also working on ensuring a healthy way of life, and we've reduced the use of alcohol and tobacco. We are training medical staff, and we've also increased the number of specialists. We also have perinatal centres and children's hospitals. We've also broadened our programme for neonatal screening, and state treatment is provided for certain cases. We've also have reached a historic minimum of infant mortality. We are also dealing with, for example, with tuberculosis, and we have introduced artificial intelligence. We're sure that in the field of healthcare, we need to strengthen the key role of WHO, and this must be depoliticized and based on protecting the interests of citizens' health rather than political interests, and we support the principle of one China. Thank you.
Now I give the floor to the Syrian Arab Republic.
In the name of God, the most merciful, the most compassionate, Mr. President, ladies and gentlemen, this session took place under an important theme, which is the reconfiguration of global health, common responsibility. The Syrian Arab Republic considers that this responsibility starts by enabling countries to build fair health systems that are resilient and based on experience sharing and respect of national priorities. Syrians have learned through the many harsh years that the vulnerability of the health system does not only threaten health, it also undermines dignity, stability, and trust in the future. And the Syrian medical expertise have proven their abilities in the midst of the most difficult circumstances. Ladies and gentlemen, we have seen recently the move through our strategy to a more unified effort that's based on the sustainability of primary health care and the rehabilitation of infrastructure, as well as the consecration of governance and accountability. We pay special importance to the inhabitants of camps and working towards the end of camps in 2027. And with regard to health security, we emphasize early warning and surveillance, and we have been able to immunize more than 795,000 children, among which 179,000 who did not receive any prior doses. We look forward to fostering further partnerships that rehabilitate our health infrastructure and that in a way that fosters institutions without replacing them. And we reiterate that protecting the right to health in the occupied Syrian Golan as well as in the occupied Palestinian territory is a collective, legal and ethical responsibility that requires the protection of the patients and the health workers. And in the end, we reiterate the importance of collaborating with WHO for a more sustainable future. Thank you.
Now I give the floor to Qatar and call Uganda to the rostrum.
Bismillah ar-Rahman ar-Rahim.
In the name of God, the most passionate, the most merciful, Your Excellency, the President, Director General, Your Excellencies, the world gathers today in a difficult moment. The progress towards universal health care and coverage is still an unattained goal, and our health systems are suffering under the brunt of emergencies, climate shocks, and AMR, as well as non-communicable diseases and the widening inequalities. Your Excellencies, there are three priorities that lead Qatar. First, promoting emergency preparedness and the full implementation of IHR. Secondly, the investment in primary healthcare as the pillar of universal health coverage. Third, adopting innovation responsibly through AI, through digital transformation and new technologies. which foster an ethical system that guarantees the full dignity and rights of human beings as a tool for equality and not to deepening inequality in healthcare among the peoples of the world. While the United Nations prepares its celebration of its 80th anniversary, we support further coherence between the multilateral system and the harmony between the efforts of humanitarian response and sustainable development requirements in order to achieve better global health and UN system with results that we hold on to everyone. There is no alternative to WHO that is strong and effective, that is run efficiently and sustainably financed. Let us have a single message. Let us stand by equality with the people who need to fulfill their health needs. With international cooperation, we shall prevail with these goals. Thank you.
I give the floor to Uganda and call Canada to the rostrum.
Mr. President, Excellencies, Uganda associates with the theme of this 79th session and commends the DG for his leadership. We welcome his report because it resonates strongly with our national priorities in its emphasis on PHC, UHC, sustainable financing, workforce, and surveillance. Uganda supports reforms at the WHO and the broader UN system. However, these reforms must strike a delicate balance, addressing challenges while preserving WHO's fundamental capacity to strengthen country-led operations and respond to member states' needs. The COVID-19 pandemic revealed systemic vulnerabilities and proved that we must act collectively. Uganda therefore supports a fair and legally binding pandemic agreement with equity as its cornerstone, including timely technological transfer, local manufacturing capacity, equitable access to vaccines and therapeutics. We urge the finalization of the PAB's Annex. Mr. President, Uganda is currently responding to an Ebola outbreak. However, we have over time built a very strong resilient system to deal with public health emergencies. With the strong national leadership in the country and the collaboration with WHO and other partners, we shall effectively respond to this outbreak as we have done before, because we've had outbreaks and we've managed them in a record time and with low case fatality rates. Mr. President, we remain committed to implementing Agenda 2030 and are making progress in maternal and child health, the HIV response, immunization, and universal health coverage. Uganda currently hosts over 2 million refugees, the biggest number in Africa, with enormous health needs. We are concerned by the dwindling responsibility and burden sharing. We call for enhanced support by WHO and other partners to Uganda in order to support our national health systems for the refugee response. Finally, Mr. President, Uganda calls for renewed global solidarity, predictable and flexible financing, and stronger cooperation to build a resilient health system. Thank you.
I give the floor to Canada and call Cambodia to the rostrum.
Mr. President, distinguished delegates, in Canada, healthcare is not a cost to be managed. Healthcare is an investment in ourselves and in our economy. Our universal, accessible public healthcare system is a Canadian value, one that will remain and keep the true north strong and free. And in this time of uncertainty, we simply cannot afford to leave anyone behind. It is absolutely crucial that we, as global partners, work together. Research is global by nature. Discoveries only become impactful when they can move across borders. Because when challenges are shared, the solutions must be as well. Diseases do not respect borders. Le Canada est déterminé à travailler en collaboration.
Canada is determined to work with other countries to protect and respond to global health threats. And the recent events with the outbreak of antivirus Andes strain is the concrete proof of that. The international response has shown the significant and vital role of WHO. And in that spirit, we support the significant participation of Taiwan as an observer at WHO. I know that our common efforts produce tangible results and have done so in Canada and throughout the world, because working together saves lives and ensures the safety of Canadians and people all over the world. Thank you.
Cedo la palabra a Cambodia.
Cambodia has the floor, who will be followed by Gabon.
Monsieur le Président, Monsieur le Directeur Général.
President, Director General, dear colleagues, our global health is facing a vital challenge that will determine our future. The crisis of international financing that we are all aware of must make us think very carefully about reshaping the system that we currently have available to us and reorienting it towards more pragmatic solutions and investments. It gives us an opportunity to look with bravery and ambition to the future in order to reshape the global health architecture in a very speedy way. The vertical organization of expenditure that we have known has seen some success in certain diseases, but to see continuing progress, we need to take advantage of the transformative power that we have available to us to influence and improve the health of our peoples. This reset needs to see an approach based from the current model focusing on diseases to a model focusing on factors of production such as universal access, human capital and social cohesion. This new model requires capacity building at the local level and preventive and primary healthcare systems that are well adapted to the needs of the population. And that movement needs public and private investment in innovation and resilience at community level. Strategic investments in human, animal, and environmental public health and pandemic preparedness must be a priority for the national security of governments and engaging all stakeholders through the One Health approach. That will only be sustainable if it engages communities, because that's where the systemic and interdisciplinary perspective becomes a reality. The future of global health is local, equitable and diversified, and the global community must seize this opportunity. Thank you very much indeed.
Cedo la palabra a Gabón.
Gabon has the floor, and I'd like to invite Israel to come forward. President, Director General, distinguished ministers, to redefine global health and our shared responsibility, His Excellency Brice Clotaire Oligui Nguema shares this vision. He is the President of the Republic and head of our state and government, and he has put the health of our people at the very forefront of the National Growth and Development Plan. One Health activities and the strengthening of public policy, particularly in regard to prevention, and the establishment of an operational center for public health emergencies have been implemented. We also have a regulatory framework, including digitalization and the optimization of data management for digitalization of health facilities. They have now become a reality. Strengthening capacities to achieve universal health coverage has also been pursued. The pharma sector is also undergoing reforms. We've implemented the National Medicines Agency certified ISO 9001. And the implementation of telemedicine is also effective in many health regions. President, tangible development of financing, new sustainable financing mechanisms with the support of partners enables us to guarantee equitable access to vaccines, medicines and technologies and quality care, particularly in vulnerable populations in Gabon. Activities designed to improve performance and resilience in our healthcare system require us to make more reforms and to better prepare the global health architecture for various health crises. Health is a vital pillar of global stability. That's why Gabon calls for common, ambitious and responsible action in coordination with WHO. Thank you very much.
Cedo la palabra a Israel y...
We give the floor to Israel, and then Mexico will be next.
Mr. President, Excellencies, the World Health Organization faces challenges that demand decisive action to advance credibility, sustainability, and good governance. Such action is essential to ensuring all member states and all people benefit from a strong and effective global health body, one that can effectively coordinate responses when needed, promote universal health coverage, and foster innovation. Indeed, international collaboration remains the engine of global health. By exchanging data and scaling best practices, we have achieved breakthroughs in oncology and acute trauma rehabilitation that were once unimaginable. Mr. President, the financial constraints facing the organization require us to refocus on WHO's core mandate. This means working above political considerations, ensuring we are led not by political agendas, but by professional standards alone. As we approach the selection of a new Director General, we must ensure that the WHO's leadership is transparent and accountable. In recent years, we have witnessed a deeply concerning divergence from WHO's professional work and commitment to neutrality. We expect a higher standard from WHO. It must adhere to professionalism and scientific integrity and prevent political distractions from undermining WHO's important work, including removing standing political agenda items. We call on the Secretariat to review the WHO system of surveillance of health in conflict to ensure stricter alignment with WHO's mandate in support of health cluster guidance, guide resource allocation and shape mitigation strategy. We must focus our efforts to ensure a continuity of care delivery, including in times of conflict, and Israel stands ready to share its experiences. Israel places great importance on inclusive participation in the World Health Assembly, at least in the capacity of observers, as we previously established practice. We believe WHO should maintain an open and inclusive approach in the interest of the advancing global health. We remain hopeful that a constructive path forward will be identified. Finally, Mr. President, we must address the persistent challenge of misinformation, which continues to erode critical public health efforts. WHO must update its communication strategies to engage the public directly, countering falsehoods with evidence-based clarity to restore global trust. Thank you.
Cedo la palabra.
I give the floor to Mexico and invite Vanuatu to approach the podium. A very good afternoon, ladies and gentlemen, Your Excellencies. Mexico speaks at the 79th Global World Health Assembly with the conviction that reshaping global health is a shared responsibility. In the current context marked by geopolitical tension, health challenges and profound transformation, multilateralism faces tremendous pressure, but this is also a historic opportunity to renovate and strengthen multilateralism. Global health today needs a more effective, equitable and coordinated institutional architecture capable of responding in timely fashion, building synergies and strengthening collective action in the face of more and more complex challenges. The transformation of WHO mustn't be limited to doing more with less, but it must be designed to do something different and better. Regions will play a vital role as they bridge between global priorities and national needs, preserving their technical capacity and responses aligned with their epidemiological and social contexts. Mexico reiterates its commitment to health as a human right and is advancing towards universal health coverage based on strengthened primary health care. Initiatives like Health House for House and telemedicine are bringing preventive and integrated services to the most vulnerable communities. All of these actions reflect the principles and vision of the World Health Organization. Mexico will participate in the reshaping of this organization with a sense of responsibility, solidarity, and a vision for the future, because defending health is protecting human dignity, reducing inequalities, and strengthening the stability of our societies. Health is the link that binds us together. Science is our most powerful tool, and international cooperation is the vital path to build a fairer future and a more resilient and humane future for all. Thank you.
Cedo la palabra a...
We give the floor to Vanuatu, and Maldives will be next.
Esteemed President, Excellencies, distinguished delegates, partners and friends. It is an honor for Vanuatu to join this important discussion on reshaping global health through shared responsibility. Responsibility that must be exercised not only globally, but also nationally and within our communities. For small island developing states like Vanuatu, this is not an abstract concept. It is practical, urgent, and deeply connected to the everyday realities of our people. Primary health care remains the foundation of resilient, equitable, and people-centered health systems. Achieving better health outcomes is not only about expanding services, but also about transforming how we govern and deliver them. In Vanuatu, decentralization is central to this transformation, bringing decision-making and health services closer to provinces and communities makes care more responsive, culturally appropriate, timely and accessible. It strengthens local ownership, empowers leadership at the community level, and ultimately improves health outcomes. When decentralization is effectively aligned with primary health care, it creates a strong pathway toward universal health coverage by ensuring quality services reach people where they live. This shared responsibility cannot rest with governments alone. Communities must be active partners in designing services. Health workers must be empowered at every level. Development partners must align with national priorities, and global financing mechanisms must be flexible enough to support decentralized models in small and vulnerable states. For Vanuatu, resilience is also central to this conversation. As a country highly vulnerable to climate change and natural disasters, decentralized systems help maintain continuity of care during crisis and strengthen preparedness, adaptation, and long-term sustainability. Vanuatu has developed its National Health Adaptation Plan 2026 to 2030. Vanuatu stands ready to work with partners across regions and institutions to advance this shared vision. I thank you.
Cedo la palabra.
I give the floor to Maldives, and I invite Togo to come to the rostrum.
Mr. President, Director General, Excellencies, distinguished delegates, it is an honor to address this assembly. We gather at a time when global health faces interconnected challenges. Conflicts continue to displace communities, destroy health systems, reminding us that peace remains the foundation of health. Economic instability, rising costs, and inflation are placing enormous pressure on national health systems, while for small island developing states like the Maldives, the climate crisis is already a public health emergency. Despite these challenges, the Maldives remains committed to building a resilient and equitable health system. We continue to maintain sustained progress in communicable disease elimination and maternal and child health. At the same time, we are confronting the growing burden of non-communicable diseases through bold preventive measures, including taxation on unhealthy products and a historic generational tobacco ban to protect future generations. Our commitment to universal health coverage remains unwavering. Across our dispersed islands, we are strengthening social health protection and expanding digital health services to ensure access to care for all communities, including those in remote atolls. We are also investing in the development of human resources for health, strengthening training, capacity building, and workforce resilience to ensure a skilled and sustainable health workforce for the future. These achievements would not have been possible without the technical support and collaboration of the WHO and our development partners. We deeply value the continued partnership of international and regional partners who work alongside us to strengthen health systems, build capacity, and advance equitable access. For small states like ours, a strong, adequately financed, and independent WHO is essential. Excellencies, global health challenges do not respect borders, and neither should our solutions. Let us act with urgency, strengthen solidarity, and build a healthier, more resilient, and more equitable future for all. I thank you.
Cedo la palabra a Togo.
I give the floor to Togo, to be followed by Palau.
Monsieur le Président,
President, Ministers, distinguished delegates, it's an honor for me to take the floor once again at this World Health Assembly on behalf of the government of Togo. I wish to express our sincere gratitude to the WHO for its constant support in implementing our health priorities and strengthening resilience in our health system. The theme this year on reshaping global health as a shared responsibility resonates particularly strongly in the current context marked by geopolitical tensions, economic vulnerability, humanitarian crises, climate change, and the re-emergence of health threats. In Togo, under the leadership of our President, health remains at the heart of public action. Universal health coverage is one of the major pillars of our governmental roadmap, reflecting our ambition to guarantee every person access to quality healthcare, irrespective of where they live, how much they earn, and of their social condition. In that context, our country has begun to make important strides forward with the introduction of universal health insurance, which for many years was in the domain of the public sector, but which is now being opened up to the formal private sector, and then decisively will be extended to non-wage earners by January 2026. And Togo is strengthening primary healthcare, modernizing its healthcare infrastructure, and capacity building, particularly with regard to community health agents, healthcare workers, and strengthening our healthcare system. We reiterate our commitment to strengthening world health security, and we welcome the progress that's been made in reshaping the global health architecture to ensure better epidemic preparedness and response. Thank you.
Cedo la palabra a Palau.
Palau has the floor, to be followed by Thailand.
Mr. President, Excellencies, delegates, ladies and gentlemen, it is an honor and privilege to deliver my remarks on behalf of my government and the people of the Republic of Palau. Let me begin by expressing our profound gratitude to the Director General and the WHO for its invaluable support in the past year, especially to us in the Western Pacific. under the leadership and guidance of our regional director, Dr. Pukala. In Micronesia, a historic milestone has been achieved by the WHO through the opening of a new WHO country office and the installation of our first country representative. For that, we thank you, RD Dr. Pukala, for realizing the challenges we small states face and for ensuring that our needs and interests are represented effectively, but more importantly, supported in a greater capacity. Our theme for this year, Reshaping Global Health, a Shared Responsibility, is a true testament of how far the organization has evolved in its vision toward solidarity, and for that, my government applauds the WHO. Finally, as we world leaders in health are convened here today, I wish to recognize the critical importance of inclusivity and togetherness. The right to health belongs to every human being. It is a shared responsibility